Damien is the name of the 8 billionth human being. He was born in the Dominican Republic and was fortunate to come in. Might seem to be a given for us, but for billions of people around the world, that's simply not the case. And the more people there are, the more important it becomes to act responsibly and sustainably. We believe that good healthcare should be standard rather than something special. That's why we work together with our customers to develop innovations that push the boundaries of what's possible. It's what gets our more than 70,000 colleagues out of bed each morning, and sometimes keeps them up at night. We need this kind of passion and diversity, and that's why we invest in the potential of each individual. That makes us more than pioneers in health. It makes us healthineers. Digital twins allow patients to receive individualized diagnoses, treatment, and follow-up care. Thanks to intelligent, image-guided diagnostics, treatments are more precise than ever. With the help of digitalization, data, and artificial intelligence, we optimize procedures and treatments in an outstanding way. New imaging systems allow for earlier detection of diseases and more targeted treatment. With innovative methods, labs can recognize disease profiles more reliably and adapt to other challenges along the way. By continuing to integrate and digitalize imaging and treatment in oncology, we're getting ever closer to a future in which cancer is no longer something to fear. But even the most advanced technology is worthless if not enough people have access to it. That's why we cooperate with international partners to tailor our innovations to the needs of our customers, healthcare providers, and local infrastructures. We pioneer breakthroughs in healthcare for everyone, everywhere, sustainably. That's how modern healthcare will become an accessible, affordable reality for billions of people. Just the most normal thing in the world.
Γίνεται κάτι τόσο μικρό, να περιέχει τόση ουσία, τόση γνώση και εμπειρία, τόση ευθύνη, τόση δυναμική, τόση ευαισθησία, τόση φροντίδα, τόσο νιάξιμο. Γίνεται κάτι τόσο μικρό να καταφέρνει να κάνει τόσο καλό. Στη Unifarma γίνεται. 60 χρόνια αξία για τον άνθρωπο, ευθύνη για την κοινωνία.
60 χρόνια. Ένα ταξίδι που ξεκίνησε από το όραμα του Δημήτρη Πενταφράγκα, ενός φαρμακοποιού από τον Εύρο. Και έγινε ιστορία ελληνικής φαρμακευτικής καινοτομίας και βιομηχανίας. Από τότε, ένα πράγμα μένει αμετάβλητο. Η δέσμευση να βελτιώνουμε τις ζωές των συνανθρώπων μας. Κάθε δεκαετία, ένα βήμα πιο μπροστά. Από την πρώτη εγκατάσταση στο Πικέρμι και τα πρώτα σκευάσματα, στα ποιοτικά γενώσιμα που κέρδισαν την εμπιστοσύνη των Ελλήνων. Με την ίδρυση του πρώτου ερευνητικού και πειραματικού κέντρου της χώρας. Τις εξαγωγές που μετέφεραν τη γνώση και τα φάρμακά μας σε όλον τον κόσμο. Την καινοτομία του Inhaler που αναγνωρίστηκε διεθνώς και την παρουσία μας σε περισσότερες από 90 χώρες. Μέχρι σήμερα έχουμε διαθέσει πάνω από 300 εκατομμύρια συσκευασίες, βελτιώνοντας την καθημερινότητα εκατομμυρίων ασθενών. Και παραμένουμε η νούμερο 1 φαρμακευτική εταιρεία σε πωλήσεις στην Ελλάδα, στην αγορά λιανικής και στα ασφαλιστικά ταμεία. Συνεχίζουμε με νέες επενδύσεις που διαμορφώνουν το μέλλον. Πίσω από κάθε επίτευγμα βρίσκονται οι άνθρωποι της ΕΛΠΕΝ. 3 γενιές επιστημόνων, ερευνητών και συνεργατών που μοιράζονται τις ίδιες αξίες. Με ακεραιότητα, ομαδικότητα και αφοσίωση κάνουν πράξη το όραμα της εταιρείας κάθε μέρα. Στην ΕΛΠΕΝ, η διαφορετικότητα, η επιστημονική αριστεία και η ίση συμμετοχή είναι δύναμη. Περισσότεροι από 1.700 εργαζόμενοι σε Ελλάδα, Γερμανία και Μέση Ανατολή ενώνουν τις γνώσεις και τις δεξιότητές τους για έναν κοινό σκοπό, την εξέλιξη της υγείας και της φαρμακευτικής επιστήμης. Σήμερα κοιτάμε μπροστά. Με νέες μονάδες παραγωγής, με επενδύσεις σε έρευνα και καινοτομία, με διεθνείς συνεργασίες που φέρνουν την ΕΛΠΕΝ πιο κοντά σε περισσότερους ανθρώπους. Χτίζουμε το αύριο της ελληνικής φαρμακευτικής επιστήμης με την ίδια αφοσίωση που μας καθοδηγεί εδώ και 6 δεκαετίες. Να καινοτομούμε, να θεραπεύουμε, να εμπνέουμε. ΕΛΠΕΝ. Advancing Health and Care for All.
Πιο ψηλά! Δεν κλέβουμε!
Μπορώ να διαλέξω κάτι πιο χαλαρό. Δεν είμαστε σε reality επιβίωσης. Και για το χώρο θα ήθελα κάτι πιο ατμοσφαιρικό. Να αλλάξουμε και την ώρα. Τόσο πρωί το καφές μου δεν έχει κάνει stretching.
Θέλεις παντού τη δύναμη της επιλογής όταν έχεις το My Health First της Eurolife FFH. Μια πιο οικονομική λύση ασφάλισης. Γιατί με το My Health First διαλέγεις εσύ όποιον γιατρό και νοσοκομείο θες, με απευθείας κάλυψη εξόδων ή με ποσό οικονομικής παροχής που γνωρίζεις από την αρχή. My Health First. Δύναμη επιλογής.
40 χρόνια τώρα, στον Όμιλο Βιοιατρική, βαδίζουμε δίπλα σε κάθε οικογένεια με ένα και μοναδικό σκοπό. Την προάσπιση της υγείας όλων. Γι' αυτό, εδώ και 40 χρόνια, επενδύουμε συνεχώς. Σε κορυφαίους συνεργάτες. Σε εξοπλισμό τεχνολογίας εχμής. Σε προηγμένα συστήματα διασφάλισης ποιότητας. Σε πλέον σύγχρονες και ασφαλείς εγκαταστάσεις. Σε πιστοποιήσεις από ηγετικούς οργανισμούς του κλάδου μας. Σε σημαντικές διεθνείς διακρίσεις και συνεργασίες. Στη στήριξη της χώρας και την κοινωνική προσφορά. Επενδύουμε πάνω απ' όλα στον άνθρωπο, για να αισθάνεστε όλοι εσείς και οι αγαπημένοι σας σιγουριά και ασφάλεια κάθε φορά που εμπιστεύεστε την υγεία σας στον όμιλο Βιοιατρική. 40 χρόνια Βιοιατρική. Είμαστε εδώ για την υγεία όλων.
Στην Εθνική Ασφαλιστική, τα όνειρά σας, οι άνθρωποι σας, η υγεία σας, η ζωή σας είναι για εμάς πάντα σε πρώτο πλάνο. Γι' αυτό κάνουμε πράξη την ασφάλεια. Εθνική Ασφαλιστική. Εδώ για την επόμενη ημέρα.
Damien is the name of the 8 billionth human being. He was born in the Dominican Republic and was fortunate to come into the world with the help of excellent medical care. Healthcare that starts from birth and extends throughout our lives might seem to be a given for us, but for billions of people around the world, that's simply not the case. And the more people there are, the more important it becomes to act responsibly and sustainably. We believe that good healthcare should be standard rather than something special. That's why we work together with our customers to develop innovations that push the boundaries of what's possible. It's what gets our more than 70,000 colleagues out of bed each morning, and sometimes keeps them up at night. We need this kind of passion and diversity, and that's why we invest in the potential of each individual. That makes us more than pioneers in health. It makes us healthineers. Digital twins allow patients to receive individualized diagnoses, treatment, and follow-up care. Thanks to intelligent, image-guided diagnostics, treatments are more precise than ever. With the help of digitalization, data, and artificial intelligence, we optimize procedures and treatments in an outstanding way. New imaging systems allow for earlier detection of diseases and more targeted treatment. With innovative methods, labs can recognize disease profiles more reliably and adapt to other challenges along the way. By continuing to integrate and digitalize imaging and treatment in oncology, we're getting ever closer to a future in which cancer is no longer something to fear. But even the most advanced technology is worthless if not enough people have access to it. That's why we cooperate with international partners to tailor our innovations to the needs of our customers, healthcare providers, and local infrastructures. We pioneer breakthroughs in healthcare for everyone, everywhere, sustainably. That's how modern healthcare will become an accessible, affordable reality for billions of people. Just the most normal thing in the world.
Γίνεται κάτι τόσο μικρό, να περιέχει τόση ουσία, τόση γνώση και εμπειρία, τόση ευθύνη, τόση δυναμική, τόση ευαισθησία, τόση φροντίδα, τόσο νιάξιμο. Γίνεται κάτι τόσο μικρό να καταφέρνει να κάνει τόσο καλό. Στη Unifarma γίνεται. 60 χρόνια. Αξία για τον άνθρωπο, ευθύνη για την κοινωνία.
60 χρόνια. Ένα ταξίδι που ξεκίνησε από το όραμα του Δημήτρη Πενταφράγκα, ενός φαρμακοποιού από τον Εύρο. Και έγινε ιστορία ελληνικής φαρμακευτικής καινοτομίας και βιομηχανίας. Από τότε, ένα πράγμα μένει αμετάβλητο. Η δέσμευση να βελτιώνουμε τις ζωές των συνανθρώπων μας. Κάθε δεκαετία, ένα βήμα πιο μπροστά. Από την πρώτη εγκατάσταση στο πικέρμι και τα πρώτα σκευάσματα, στα ποιοτικά γενώσιμα που κέρδισαν την εμπιστοσύνη των Ελλήνων. Με την ίδρυση του πρώτου ερευνητικού και πειραματικού κέντρου της χώρας. Τις εξαγωγές που μετέφεραν τη γνώση και τα φάρμακά μας σε όλον τον κόσμο. Την καινοτομία του Inhaler που αναγνωρίστηκε διεθνώς και την παρουσία μας σε περισσότερες από 90 χώρες. Μέχρι σήμερα έχουμε διαθέσει πάνω από 300 εκατομμύρια συσκευασίες, βελτιώνοντας την καθημερινότητα εκατομμυρίων ασθενών. Και παραμένουμε η νούμερο 1 φαρμακευτική εταιρεία σε πωλήσεις στην Ελλάδα, στην αγορά λιανικής και στα ασφαλιστικά ταμεία. Συνεχίζουμε με νέες επενδύσεις που διαμορφώνουν το μέλλον. Πίσω από κάθε επίτευγμα βρίσκονται οι άνθρωποι της ΕΛΠΕΝ. 3 γενιές επιστημόνων, ερευνητών και συνεργατών που μοιράζονται τις ίδιες αξίες. Με ακεραιότητα, ομαδικότητα και αφοσίωση κάνουν πράξη το όραμα της εταιρείας κάθε μέρα. Στην ΕΛΠΕΝ, η διαφορετικότητα, η επιστημονική αριστεία και η ίση συμμετοχή είναι δύναμη. Περισσότεροι από 1.700 εργαζόμενοι σε Ελλάδα, Γερμανία και Μέση Ανατολή ενώνουν τις γνώσεις και τις δεξιότητές τους για έναν κοινό σκοπό, την εξέλιξη της υγείας και της φαρμακευτικής επιστήμης. Σήμερα κοιτάμε μπροστά. Με νέες μονάδες παραγωγής, με επενδύσεις σε έρευνα και καινοτομία, με διεθνείς συνεργασίες που φέρνουν την ΕΛΠΕΝ πιο κοντά σε περισσότερους ανθρώπους. Χτίζουμε το αύριο της ελληνικής φαρμακευτικής επιστήμης με την ίδια αφοσίωση που μας καθοδηγεί εδώ και 6 δεκαετίες. Να καινοτομούμε, να θεραπεύουμε, να εμπνέουμε. ΕΛΠΕΝ. Advancing Health and Care for All.
Πάμε δυνατά! Πιο ψηλά! Δεν κλέβουμε!
Μπορώ να διαλέξω κάτι πιο χαλαρό. Δεν είμαστε σε reality επιβίωσης. Και για το χώρο θα ήθελα κάτι πιο ατμοσφαιρικό. Να αλλάξουμε και την ώρα. Τόσο πρωί το καφές μου δεν έχει κάνει stretching.
Θέλεις παντού τη δύναμη της επιλογής όταν έχεις το My Health First της Eurolife FFH. Μια πιο οικονομική λύση ασφάλισης. Γιατί με το My Health First διαλέγεις εσύ όποιον γιατρό και νοσοκομείο θες, με απευθείας κάλυψη εξόδων ή με ποσό οικονομικής παροχής που γνωρίζεις από την αρχή. My Health First. Δύναμη επιλογής.
40 χρόνια τώρα, στον Όμιλο Βιοιατρική, βαδίζουμε δίπλα σε κάθε οικογένεια με ένα και μοναδικό σκοπό. Την προάσπιση της υγείας όλων. Γι' αυτό, εδώ και 40 χρόνια, επενδύουμε συνεχώς. Σε κορυφαίους συνεργάτες. Σε εξοπλισμό τεχνολογίας εχμής. Σε προηγμένα συστήματα διασφάλισης ποιότητας. Σε πλέον σύγχρονες και ασφαλείς εγκαταστάσεις. Σε πιστοποιήσεις από ηγετικούς οργανισμούς του κλάδου μας. Σε σημαντικές διεθνείς διακρίσεις και συνεργασίες. Στη στήριξη της χώρας και την κοινωνική προσφορά. Επενδύουμε πάνω απ' όλα στον άνθρωπο, για να αισθάνεστε όλοι εσείς και οι αγαπημένοι σας σιγουριά και ασφάλεια κάθε φορά που εμπιστεύεστε την υγεία σας στον όμιλο Βιοιατρική. 40 χρόνια Βιοιατρική. Είμαστε εδώ για την υγεία όλων.
Στην Εθνική Ασφαλιστική, τα όνειρά σας, οι άνθρωποι σας, η υγεία σας, η ζωή σας είναι για εμάς πάντα σε πρώτο πλάνο. Γι' αυτό κάνουμε πράξη την ασφάλεια. Εθνική Ασφαλιστική. Εδώ για την επόμενη ημέρα.
Welcome at the Health Above All conference. Mr. Nicolaou, would you be so kind as to join me on stage that you may kick off the conference? Honorable Prime Minister, Your Excellency, Ministers, ladies and gentlemen, dear representatives of academia, Dean, Rector, representatives of the various associations of patients and pharmaceuticals, welcome at this conference. Thank you very much for attending this event. Let me extend special thanks to the Prime Minister, Mr. Kyriakos Mitsotakis. Thank you for gracing us with your presence. The participation of the Greek Prime Minister confirms the fact that health is a national priority. Next is now, along with Dun Consulting, are co-hosting for the 5th year in a row this conference. It's all about health, or health above all. This is placed under the auspices of the Ministry of Health. Thank you, Mr. Georgiadis, Admiral Georgiadis, the Minister. Thank you for being so supportive of this conference. And this is also a conference under the auspices of ECPA, the Athens National University. Thank you, sir, for being with us, and the Panhellenic Association of Pharmaceutical Companies. This meeting is the meeting point of scientists, scholars, experts, the politicians, and it also touches on the needs of this society. The objective of this conference is to embark on an essential and substantive dialogue on the present and the future of the health system. At the very heart of this conference, we've placed the health strategy of this country in the digital age, with emphasis on biotechnology and AI. These two forces, as we speak, are shaping the new landscape in terms of prevention and treating, but also, generally speaking, health services. Having said that, we are here to deal with the big challenges that the health sector is faced with and all the interventions that are called for at this critical sector. And of course, we're going to take stock of the strong socioeconomic impact thereof, with a view to dealing with timeless and perennial pathogenies and weaknesses. Today, this day, we're going to discuss various subject matters that are about the present and the future. They're also about the opportunities. They will discuss production, biotechnology, data, and the role thereof, the role of innovation, AI, and its applications in mental health and health in general, as well as the ever-growing dynamics and prospects of research. Top scholars and scientists, and also officials, representatives of the pharma market, the business world, the professionals, the health professionals, and the representatives of patients are here to present and acquaint us with their views about a health system that will be up to par when it comes to the challenges of the new digital era. Let it be noted that the proceedings of this conference are also broadcast live via EES.gr, but also through enikos.gr, real.gr, ologia.gr, and economia.gr. And Real FM is at the same time broadcasting and will be broadcasting throughout the day various excerpts, extensive for that matter. We will be also broadcasting the interviews of both the Prime Minister and the Minister of Health. By way of conclusion, let me share with you my conviction that today's statements, speeches, and the ensuing dialogue will offer us added value within the context of an effort with a view to having a sustainable and strong and robust health system. Thank you very much, ladies and gentlemen, for attending this event, and thank you for your active participation in advance. And let us all hope that this will be a very successful day event. With these thoughts in mind, let me kindly ask the Prime Minister, Mr. Kyriakos Mitsotakis, to join me on stage. We are going to have, I believe, a very interesting debate.
So, thank you very much, Prime Minister, for being with us. It's a great honor. And of course, it highlights the national priority, which is, of course, healthcare. So I should like to ask you to discuss your philosophy in your behind the effort that you have undertaken to promote prevention. First of all, Mr. Hadjinikolaou, let me congratulate you for organizing the conference at a very pertinent point in time. The timing is perfect because the health issue is taking priority in Greece and worldwide, especially after the AI revolution. We may, all of us, very rightly so, I would say, have our reservations concerning this revolution. But in my view, if one thing is going to be positive, have a positive result, this is AI. So, come to the very center of our discussion. In 2023, when we were again voted into government, one of our three central priorities had been the creation, the building of a new national healthcare system. So, we should move away from the rationale that healthcare means care in health centers or in hospitals. In the past, the Ministry of Health was a ministry for hospitals, and of course, one should concern themselves with the provision of healthcare by hospital, but we are one of the frontline countries in Europe as regards the implementation of a very ambitious program, for which we need the help of your help, the help of the media, to promote prevention, how to identify any illness at its very, very beginning. We have more than 4 million people in Greece who have taken advantage of the free tests provided by the state, and this is on the initiative of the state and not of the people. And the digital tools have helped you a great deal. Yes, of course, but what has really helped is a gradual change of attitude that healthcare is not a difficult thing or unpleasant thing or fearsome. Let's take the women who have had an early breast cancer, about which they knew nothing about, but the majority will be cured because we have urged them to take the necessary tests. So we help people overcome the fear of a prevention test, of an early test. And this is very important also in the public debate. People who can speak to the public opinion should be mentioning this issue. Yesterday, I read in Kathimerini newspaper an article by Alexis Papachelas, who very courageously described his own adventure, his own problems, and I should like to congratulate him for saying all this, for overcoming his fears. These things we believe that they concern somebody else, our neighbor or whoever, but this is not certain. So there are certain protocols that need to be followed, and I'm very happy to see people embracing this initiative. We make it easy for them. So we want to be on the front line of Europe. Both the minister and the deputy minister are very well aware that even in the WHO we are a model country for the early prevention tests that we promote, not only about cancer, colon cancer, issue of child obesity, mental health issue, which are of a huge importance for our teenagers, self-harming, for instance, on which we have undertaken a recent initiative. Very often we look under the carpet, under the bed too, and this is difficult to do, but we want to identify the concerns of the people, and we try to deal with them. Another important issue, Prime Minister, is our big hospitals, their perception, their image. Where do your efforts to refurbish the hospitals? At what point has it reached? Listen, the hospitals, the healthcare sector has been one of the great beneficiaries of the RRF after the pandemic. What is happening both in hospitals and in healthcare, health centers is watershed point. I'm not just saying this just like that. More than 150 hospitals. I was in Markopoulou on Saturday myself. You just have to look at the before and after pictures. We are doing the best, the most extensive refurbishing buildings and equipment of the healthcare system ever. And this, of course, helps the operation, the functionality of all this infrastructure, because an emergency care department as such is not that important. But the thing is that somebody, from the moment they enter a hospital up until the moment they depart, they have to understand that there is a new attitude. And Minister, we need to find a different way. This plastic bracelet, I've said this repeatedly, we have to change the bracelet, find something else, because this brings other things in mind. But still, we know how a patient goes through after entering the emergency care. We have not reached the point where we want to be, but we are moving in the right direction. And as regards the shaping of infrastructure, is advancing. And this is not only about emerging care. We are refurbishing, we are rebuilding different floors one by one of the big hospitals. And Mr. Hadjinikolaou, I believe that this is also reflected by what people tell us. One of the innovations is are asking the people to assess the healthcare services, and this has helped us a lot. We have gathered lots of info. We get a greater picture when we ask the patients themselves than when asking people around them. People who are served by the healthcare system have a much better image or a much better experience than the general impression. Why we need to know why one big hospital may not be as good as another one. This is very important, and this is valuable information for the Quality Assurance Authority, and they can go in and look in depth, and we will go into further depth the way that are these very detailed assessments that we ask. So you're talking, do we already have mobile units? Do they provide services in far away areas? Yes, once I went to Britannia area in order to see how these mobile units operate, and it is quite moving. Technology has allowed us to do things that we were unable to do. a mobile unit may visit a remote village and then visit again after a while, and they have the data available concerning the previous visit. So we don't want to have parts of this country that are forgotten, neglected. We want people to stay in their villages, especially these people who stay in the villages are maybe older, and the state needs to show them care. I'm here to help you. I try to help you. We have a state healthcare system which is working in favor and not does not neglect the people. We bring the medicines at home. With the minister and the deputy minister, we struggled with that because you make a decision, but then until you need to work very hard until it is implemented. So I'd like to congratulate the leadership, minister and deputy ministers, because they did work very hard. I remember how we overcame the first difficulties, and today, especially cancer patients have an alternative channel in their service.
Your government is being under criticism, and so were the previous government. So people tend to say that many Greek doctors, physicians who went through the university studies here, they are highly specialized, but eventually leave Greece and go abroad. They go abroad because the opportunities that they're offered there are so much stronger than what they get here. Now, the Ministry of Health has kicked off an initiative, and I know it's been on a roadshow in Europe and in the States with a view to convincing successful Greek physicians who are currently working abroad to come back. Is this working? Is this paying off? Should we be hopeful about the future of some good physicians, Greek physicians who are working abroad coming back? Well, to begin with, let's pay credit to and acknowledge the contribution of our educational system. The rector is here. Our medical schools, the national universities of Greece, the medical schools thereof are doing an excellent job. And of course, there's always further scope for progress and growth. Science is making leaps and bounds. A physician told me recently that the very foundation of knowledge changes every 18 to 24 months, which goes to say that once you have graduated, you need to keep training. It's a lifelong thing. You need to be educated and training throughout your lifetime. But let's put this aside. Having said that, as we speak for the very first time, we are getting more Greeks to come back than compared to the number of those that left, that is. So more are coming back because there are big opportunities on offer. Yesterday in New York, and let me comment and congratulate the Minister of Labor that was there, dozens of companies, some of which work in the pharma sector, the health sector. There are also health provision services. Everybody was represented. They met in New York. This was a spectacular event, and it seems that there was a huge turnout of Greeks who are looking into a scope for them to come back. We are giving them great incentives. Along with the minister, we did something that was simple yet quite decisive. So we agreed that when you have a specialized physician in the States, in Canada, in Switzerland, in the UK, in Australia, meaning if the accreditation entities in the respective countries have provided you with a certificate, and so you have a validated document that shows you are certified, highly specialized, you can come back and you will be automatically recognized. So there will be no red tape. That was one important hindrance. Quite often physicians tended not to come back because when they came back here, people would tell them, the responsible entities would tell them, you have to go back, sit a few exams, 2 or 3 courses. Now this is gone. We automatically and instantaneously recognize their specialties and their expertise. Nowadays, you see, because of the current U.S. administration, it's even tougher for non-Americans to stay on and be employed there. And I'm not just talking about the health sector. So there are people coming back, and I'm very happy because yesterday's event was highly successful. And despite the difficulties, no doubt there are difficulties. Greece in 2025 is incomparable compared to what it used to be a few years ago. And many are coming back because indeed they firmly believe that this country is going in the right direction despite the difficulties, or else nobody would be talked into coming back. You see, if people expect that in 2 or 3 years down the road we are going to embark on new adventures, it would be impossible for someone to make such a huge change and move their family with them. Another permanent criticism that I keep hearing about, and I've been working in this field for decades, so I've always remembered that vis-a-vis any government. Now, the other criticism concerns the people or the human resources or the lack thereof in the Greek NHS. So here's my question. Have you been beefing up the NHS human resources-wise since 2019 when you assumed power until today? I mean, have you increased the human resources and have you found ways to make sure that expenditure and proper management of human resources is efficient and effective? We, us, as a Prime Minister, we've increased that by 15%. We have seminal voids or deficits. We're not exactly where we want, especially when it comes to the islands, and despite the fact that we have given generous incentives, we're lagging behind. Compared to 2019, the remuneration of physicians and doctors is higher, especially compared with other public sector servants. And there have been other incentives. For instance, the taxation of entities that physicians established, they'd always ask for that. So we're heading in the right direction, and no doubt as concerns properly managing and checking on or auditing expenditures, we have ushered in a huge change, meaning that we are keeping stock of expenses. We have different systems and we're more strict and austere compared to what we used to be in the past, because there's no doubt in our minds there was and still was rather scope to save money. And that was possible to do without it being detrimental to the quality of health services provision. If you check the total expenses as listed in the budget, they have doubled compared to 2019. I'm talking about nominal prices, nominal figures. So indeed, we have heavily invested there and we've made important progress. Now, a very important investment about the way day after is pertinent to the fact that a more customized medical services provision, new drugs and medicinal substances that will have special features, they are more costly, meaning that the sustainability and viability of the healthcare finances is something that should be of concern to us all, always, and that is why the ministry is focusing on that, and it's knowledgeable. And I guess the Ministry of Health is not complaining about the increase in their expenses. But I've also told the ministry that whatever you save, you can have it. So whatever money you save will not go to the treasury. It will come back to, again, funding and financing health services. And you talked about modern drugs. There's the Greek pharmaceutical companies or pharmaceutical sector. Its footprint is important both in Greece and in Europe. The government scheme with a view to coupling the clawback with investment projects, that helped. Is this going to continue, especially with lots of resources in the years to come? And in particular now, when in Europe there is a whole discussion about repatriating pharma production. To begin with, this scheme was very successful. It turns out, and I can see amongst you in the public, so many successful companies that have heavily invested, taking advantage in this scheme, and there is scope for more in the years to come. And I'm personally committed to continuing this for as long as there is, and I believe there was always going to be huge interest in the local pharma industry. I believe that especially after the COVID pandemic, this whole discussion acquired other interesting features. There's a need on the part of the continent of being self-sufficient and independent in terms of fundamental and basic drugs and the production thereof. We are exporting more than 10% of generic drugs. Greece is exporting more than 10% of generic drugs that are being consumed in the rest of Europe. So we are a dynamic here in Greece, a dynamic and exporting sector. And at the same point in time, we are focusing on specific sectors, and we can have the edge there, competitive advantage that would work. And there are also clusters in Attica and in Tripoli. I don't think anyone saw it coming, but in Tripoli there is a cluster, meaning there is a concentration of important pharma industries. Having said that, there's also decentralization. we want to support this sector to the extent that we can and could. We have been supportive of this sector. We have been dealing with problems from the past. Nonetheless, Prime Minister, I've heard people complain about the fact that the total clawback in Greece is one of the highest in Europe. Greek pharma companies are saying that the clawback is a huge burden, and it's also cause for sustainability, non-viability issues. Despite your government's measures, the clawback is on the rise. And here's the question: are you going to fund it or subsidize it further? To begin with, I always refer such questions and discussions to the competent minister, and the Minister of Health is in frequent communication and has frequent contacts with the pharma industries here and abroad. We have a certain horizon, or rather we've made progress compared to the past with regard to how we want to move as far as this is concerned, and I believe that we're doing better. We're not satisfied, but we're certainly better off compared to where we used to be in 2023. Which brings me to the day after. As you described it yourself, what sort of big steps and interventions should we be expecting or looking forward to in the health sector for the next few months? And what sort of digital projects are you working on? And more than that, other projects, what are you rolling out? What will be ready and up and running by the end of 2026 or the beginning of 2027? Firstly, we have very strict timelines because of, which are related to the RRF. There are projects that must be done and wrapped up by August, not the end of 2026, but August 2026. The Ministry of Health is very well aware of that. They are picking up speed. Anything that won't be funded that way and wrapped up by then will have to be funded and financed through the state budget. There's no delay whatsoever. I mean, I'm not worried. I'm certain that the Ministry of Health will catch up and everything will be ready according to the lines. We're talking about infrastructure projects and digital projects. There's a real revolution happening there. The fact that today you can book an appointment to more than 100 hospitals, more than 300 hospices or health centers, and you can have a date tomorrow, an appointment with an available physician tomorrow. This is a revolution. It is a revolution. It is unprecedented. Nobody saw it coming a few years ago. The My Health app is a good matrix that will change everything. It's the beginning. It will change everything in the health sector. It will certainly help us contain expensive. Don't forget about the fact that we, in terms of e-prescription systems, we were in the avant-garde. We thus can control or check upon expenses. If we bump into a physician who, compared to the average, prescribes 10 times more drugs for a specific disease, and there are that guidelines. So there are things to be expected or not to be expected, so we can check on that and we can look into it. It's easy to do now. You know, the cost of pharma, it's certainly an equation that involves both the quantity and the price. So we have to check on both the quantities and the prices. We want to have the best of prices and the quantities that we need. Greece is generous when it comes to provision of services, health services and products. We are more generous compared to other more rich countries, if I may put it in such terms. Countries that have more money and are well off, especially as concerns very costly medication. But that does not signify that we must waste money. We have to make sure that we cater to the needs, pharma-wise, of people who are in dire need of more expensive drugs. But then again, we have to make sure that we don't rob off AOP, because in essence that signifies we are robbing the Greek average taxpayer. So thanks to the digital revolution, we expect a huge revolution to happen, and that will be important in terms of also providing services to the citizens, services from the state. There will be tools, AI tools that will be introduced, and such tools will facilitate and accelerate this communication. AI tools can be introduced or rather can be helpful in triage, and they can be used in the ER. They will never replace people, physicians or orderlies and nurse staff. We talked about the doctors, but you see what's missing is actually nursing staff. Nursing staff is missing everywhere. It's not a Greek issue. It's a European, if not a global issue. So AI, to me, is a tool to improve productivity and to improve scope, especially when it comes to a country like ours. We have isolated areas. We have the insular part of Greece. This can be helpful in terms of us revolutionizing the ways in which we provide health services. And it's just the beginning. This is just the beginning of a huge revolution. Greece wants to be at the forefront. We want to be supportive of local and domestically based AI companies, because we also have reliable data. It's anonymized. We always make sure that we protect personal data. We protect the individual files and records. We're talking about personal data, individual data, especially when it comes to diagnostic tests and exams. This data is precious, and we are the ones that we will be making decisions about the companies we will be working with and which companies we are going to help us reap some benefits or surplus value, because there will be surplus value to benefit the Greek citizens. Before I extend my thanks to you, I cannot but take advantage of your presence, and I'm going to ask about something that's topical. Are you referring to health, says the Prime Minister? No, says the journalist. I will talk to you or ask you about the farmers and their mobilization. It's about the health and robustness of the political system and the health and robustness of the economy. It seems that there is an escalation in terms of farmers and the movement. They're making new decisions. They will be blocking up all the byways, not just the central motorways or the main roads. They are talking about also proceeding with blocking the access to the port of Volos. Is the government or you personally going to do something about it? You know what? The primary sector and its health is something that should be of concern to us all. And let me say that there's a big change with regard to OPEKEPE. It's painful. The political cost is there for this government. I would agree that it's happening belatedly. But this is a sine qua non precondition. It's the most important reform that is happening in order for us to plan ahead for the primary sector or the agricultural sector of the day after. Because we have honorable fishermen, animal farmers, agri-farmers. They are honorable and they are not receiving the money they're due because we are counting on an old system that dates back decades ago. So this is a necessary change. I do understand that the payments are belated, but there will be important sums paid to the farmers and everybody in the primary sector by the end of December. Since you're asking me about these mobilizations, let me point to this. All of us have to think about the fact that quite often extreme mobilization and rallies could make the rest of the society turn against the ones that are well justified in making assertions and claims. I'm saying that because my door is always open. The minister who's in charge, his door is open. It would be important for this debate with them and us to happen with the roads being open instead of them being closed off. We are open to a dialogue in good faith. We want to know who we are talking with. We have to have representatives talk to us, and we would like to know what sort of demands they're making, because as we speak, their demands are vague. And there's no real effort being made in order for us to sit at the same table together to plan ahead. Indeed, there are real problems. They're tangible. There are issues that concern the prices of products. This is not a Greek problem. It's a European problem. Let's look at what we can do within the context of the European limitations, if you will. But we can't make promises. We can't make promises about sums to be paid to the farmers that won't be able to be paid. And then there will be no excuse for us to pay such sums. And then Europe will come to us and expect us to refund the money. I believe that the European dimension must be taken into account. Again, we shouldn't have this debate at the expense or to the detriment of the society, especially now in view of Christmas coming, but we have to do so in goodwill. And remember, last time there was this discussion, our secretary, who comes from a farming area, remembers that. Back then, we made specific steps. We resolved the issue of the excise duties or the special taxes paid by the farmers. We proceeded with certain rebates or deductions in terms of their energy bill. But you can't just go blindly about it, or else there's the serious risk of the rest of the society being eventually against the farmers and losing track of the real problem, because the real thing is to plan ahead. Thank you. Thank you very much, sir.
I will now call upon the Minister of Health, Mr. Adonis Georgiadis, to make a short address, but later on we will also interview him. Mr. Georgiadis, please join us. Deputy Minister Themistokleous, Rector of the Athens University, Mrs. Nicolaou, Ms. Karpodini, President of the Pharmacists Association, and ladies and gentlemen, first of all, it is a very great honor for me to be here with you and to take the floor immediately after the Prime Minister, who, as you have realized, is very up-to-date about what's happening in the health sector. And I must tell you that every day we follow his instructions, his leadership. So let me tell you, we are very proud about our achievements during the second term of Kyriakos Mitsotakis. And I'm not saying that we're not proud about what happened in the first, but this has been Mr. Hadjinikolaou. There is not even one indicator, not even one, I repeat, where Greece has not made substantial progress in the last approximately 3 years. Even when we have to deal with difficult issues such as the clawback, which is a burden for the pharma industry, we are doing better than before because also of the new medicines that come into the system. Now, Greeks are able to make an appointment with a specialist within very few days, better than than any other European citizen. We are better than all of the countries. Now, coming to what the Prime Minister said, in combination with My Health App, we provide something that the rector is very well aware of, that was being discussed for decades in Greece. Prevention must be a priority. These were words, but we've never done it. Now we do it, and we do not advertise as much as we should. We have managed to screen 5 million of our citizens, not only about cancer, colon cancer, and heart diseases, and renal problems, but now, with the electronic health file, we have a full registration of the Greek population, even the dental care, which is a huge problem for Greece. We are about to introduce a program in cooperation with the WHO. We are looking at starting a program for dental health care in Greece, which for the time being, we have not been doing well. As regards the renovation, the refurbishing of the healthcare buildings, we are doing well. Criticism is that the building walls, people will not make people healthy. Yes, of course, but for doctors and patients to be staying in derelict buildings, this is no good. The other day we visited with the Prime Minister the Markopoulou Healthcare, a building that was constructed in 1986, and up until 2024 nothing had been changed there. Now, can you imagine a building since built in 1926, what happened, how it was in 1924? It was a derelict. The other day, we have provided a state-of-the-art healthcare center. The people working there were warmly thanking us. So we are upgrading 93 out of 127 hospitals and many of the health care centers. So this is a major effort that's been undertaken, and we should not ignore it. We also send high-cost medications at home, and hopefully, Mr. Baltas, also from the pharmacists very soon. So it is the state and our ministry wish to do away with the long-standing problems. You may remember the long lines in front of the shameful lines in front of the AOP, the healthcare system pharmacies. These do not exist anymore. We thought that it was our obligation to do away with a long-standing problem that was making thousands of people to... Yes. Okay, stop. We have an interview upcoming. Yes. So you're right. So we are here just a few weeks before Christmas. Wish you a happy Christmas at this well-organized conference, and we are very proud to be able to discuss not the future but what has already happened here. So I wish you success, and all the rest I will tell you during the interview. Thank you. Two addresses and then the interview. Let me inform you that the president of the Panhellenic Association of Pharma Industries, Mr. Theodoros Trifon, has not joined us today because this conference has, unfortunately for us, coincided with the opening of the LPEN subsidiary in the Middle East, which is a very important moment for his group of companies. It's opening to other countries, and he has sent us a video.
Η οικονομία και η κοινωνία είναι ξεκάθαρη. Η αύξηση της συμβολής των παραγωγικών κλάδων στο ΑΕΠ της χώρας μας. Μόνο έτσι η οικονομία μας θα αποκτήσει ανταγωνιστικότητα. Μόνο έτσι θα ενισχυθούν οι εξαγωγές, οι επενδύσεις σε νέες τεχνολογίες, η έρευνα και η καινοτομία. Μόνο έτσι με πραγματικές προοπτικές ποιοτικής απασχόλησης για τις νέες και τους νέους της Ελλάδας. Μόνο έτσι τελικά θα υπάρχει πλεόνασμα, το οποίο θα μπορέσει να διαχυθεί και να διατεθεί σε όλους τους πολίτες. Σε αυτό το εθνικό στοίχημα, η ελληνική φαρμακοβιομηχανία διαδραματίζει ένα κομβικό ρόλο. Από το 2020, υλοποιούμε ένα μεγάλο επενδυτικό πρόγραμμα 1,8 δις, που αναβαθμίζει σημαντικά τις παραγωγικές και ερευνητικές μας δυνατότητες. Η Ελλάδα, κυρίες και κύριοι, έχει 51 εργοστάσια, το 12% της παραγωγικής δυνατότητας της Ευρώπης. Οι επενδύσεις αυτές δημιουργούν υψηλή προσθέμενη αξία για το σύνολο της οικονομίας, ενισχύουν την ποιοτική απασχόληση με χιλιάδες καλά αμοιβόμενες νέες θέσεις εργασίας, αναβαθμίζουν θέσεις Ελλάδας σαν ένα σύγχρονο και ανταγωνιστικό παραγωγικό οικοσύστημα στην Ευρώπη. Δεν είναι τυχαίο, κυρίες και κύριοι, ότι στέκομαι με φόντο τις μεγάλες επενδύσεις σε παραγωγή και έρευνα της ΕΛΠΕΝ. Δείχνουμε στην πράξη εργοστάσια, θέσεις εργασίας σε ένα μεγάλο οικοσύστημα. Αυτή είναι η προσθέμενη αξία της ελληνικής φαρμακοβιομηχανίας. Ταυτόχρονα, οι επενδύσεις της φαρμακοβιομηχανίας θωρακίζουν το εθνικό σύστημα υγείας. Εξασφαλίζουμε κάλυψη για πάνω από το 65% των αναγκών των πολιτών της χώρας. Εξασφαλίζουμε επάρκεια και αυτάρκεια με εγχώριο παραγόμενο φάρμακο. Ειδικά σε περίοδο κρίσης, αυτό είναι πολύ σημαντικό. Για να πετύχουμε στη μεγάλη προσπάθεια της ελληνικής μεταποίησης, η Ελλάδα και η Ευρώπη πρέπει να ενισχύσουν συνολικά την παραγωγικότητά τους. Μόνο έτσι θα μπορέσουμε να καλύψουμε το κενό έναντι της ΗΠΑ και της Ασίας που συνεχώς διευρύνεται. Απαραίτητη προϋπόθεση είναι η αντιμετώπιση του υψηλού βιομηχανικού κόστους. Από την ενέργεια μέχρι το κόστος της γραφειοκρατίας, μέχρι το κόστος της πράσινης μετάβασης. Αυτά αποτελούν ανταγωνιστικό μειονέκτημα για τις ελληνικές παραγωγικές μονάδες. Εξίσου κρίσιμο είναι να υπάρχουν σταθερά και αποτελεσματικά κίνητρα για επενδύσεις. Θέλω να αναδείξω εδώ το πολύ επιτυχημένο πρόγραμμα του συμψηφισμού του Clawback με επενδύσεις. Το πρόγραμμα αυτό ουσιαστικά έχει συμβάλει στο να δημιουργηθεί ένα νέο μεγάλο παραγωγικό οικοσύστημα στη χώρα μας. Για μας είναι το πιο επιτυχημένο ΣΔΙΤ που τρέχει αυτή τη στιγμή, με ορατά αποτελέσματα. Πρέπει να ευχαριστήσω τόσο τον Πρωθυπουργό, τον Υπουργό Ανάπτυξης, αλλά και άλλους υπουργούς, διότι μαζί το 2019 σχεδιάσαμε αυτό το πρόγραμμα και τώρα, 7 χρόνια μετά, βλέπουμε στην πράξη το αποτέλεσμα και πώς άμεσα έχουν προχωρήσει τόσο μεγάλες επενδύσεις. Κύριε Χατζηνικολάου και κυρίες και κύριοι, η παρουσία του Πρωθυπουργού, των Υπουργών Υγείας και Ανάπτυξης και φορέων υπογραμμίζει και δέσμευση και πολιτική βούληση. Η υγεία και η ανάπτυξη είναι δύο αλληλένδετες έννοιες. Η φαρμακευτική πολιτική πρέπει παράλληλα με την κάλυψη των ασθενών να έχει ταυτόχρονα και αναπτυξιακό προσανατολισμό. Κάθε ευρώ που δαπανάτε πρέπει να δημιουργεί εγχώρια προσθέμενη αξία. Συγχρόνως, πρέπει επιτέλους να διασφαλιστεί απαραίτητη χρηματοδότηση, έτσι ώστε να αντιμετωπιστεί ριζικά το φαινόμενο του υπερβολικού clawback που δημιουργεί σοβαρές παρενέργειες. Αν η χώρα μας επιμείνει στη διαμόρφωση ενός σταθερού και μακροπρόθεσμου πλαισίου για κλαδικές πολιτικές σε τομείς υψηλής προσθέμενης αξίας όπως η φαρμακοβιομηχανία, τότε η ελληνική οικονομία θα ανοίξει νέους ορίζοντες ανάπτυξης με ουσιαστικά ωφέλη για όλους τους πολίτες. Ευχαριστώ για την πρόσκληση και σας εύχομαι κάθε επιτυχία στις εργασίες του συνεδρίου.
Thank you, President, and I will now give the floor to the Rector of Athens University, Professor of Cardiology, Gerasimos Siassou, to address the meeting after thanking him for his support to the conference for the third year in a row.
Honorable Prime Minister, Ministers, Mr. Hadjinikolaou, Ms. Pirioti, and distinguished representatives of the NDTs of the health sector. It's really a great pleasure for me to be at the 5th year Panapola conference. It's the third that I'm attending, and it's under the auspices of the Athens National University, Kapodistrian University, ECPA. Indeed, this is a great example of working together across sectors, including the private and the public sector, on things that are pertinent to public health. This year's conference is at the heart of the big changes that are happening in the health sector. We're talking about AI, digital analysis of data, and developments in the biotechnology sphere. All of that is changing the ways in which we understand disease and illnesses, organize and set up health services, and also proceed with interventions. Of the past 5 years, patents filed in tech are in excess of the number of patents that are filed and are pertinent to other sectors, including IT and ICT for that matter. And so this is a new era for health. Accuracy, speed, customization of services, they are playing the leading role now. This is a transition that certainly gives birth to opportunities, but calls for responsibility in decision making. And of course, there's calls for investing in knowledge, and it calls for a close collaboration between academia, universities, the private sector, and the state. This very conference is essentially highlighting and contributing to the creation of a future policy. Our university was the first provider of health services after the revolution of 1821. The medical school of the University of Athens was the very first to establish university clinics and hospices all over Greece. ECPA's medical school was the very first to establish infrastructure that took care 190 years ago of the revolutionary fighters. And nowadays we have a presence in 16 hospitals, 4 of which are university hospitals. Therefore, our medical school is there to provide really high state-of-the-art, high-quality educational training and learning work. We are investing in innovation, we're investing in know-how and expertise, and we believe that knowledge created in the framework of the universities must be returned to the society as such. Let me share with you the fact that since 2022, for instance, within the span of 3 years, the University of Athens has created 3 spin-offs, 9 spin-offs, 3 of which were actually established this year, 2025. Other than research, we definitely focus on properly training and educating new health professionals. We're adjusting and adapting our programs and projects. Already, the undergraduate AI program of ours is part and parcel of our medical school programs in order for our undergraduate students to encompass AI and make sure it's they're part and parcel of their daily lives. That's why they excel everywhere in Greece and abroad. But let me also commend and congratulate the organizing committee of this event, and especially Mr. Hadjinikolaou and Ms. Pirioti, the acclaimed journalists for such an exceptional conference, the agenda of which makes sure that it encompasses distinguished scholars and speakers and health professionals. Since we also had both the Prime Minister and Mr. Avanis Georgiadis, the Health Minister, before I took the floor. Really now, I have to say, and this is an institutional statement, it's not a political statement. After all, I have no right to make political statements, but I have to extend my warmest thanks to the Ministry of Health, because infrastructure is important, and it's true, it's key. What is happening in every hospital, including university hospitals, the buildings are being upgraded. That's important. Human resources wise, personnel, openings, vacancies, they are being filled in recent years. And when it comes to the 7 medical departments all over Greece, there's been a distribution of seats and vacancies of the past years. 470 are now filled. It took 20 years, or rather during the past 20 years, they were vacant. And there is also the prevention scheme under the name Prolambano. Rest assured, ladies and gentlemen, especially when it comes to studies and programs, I was there involved in the planning and design thereof. So rest assured, ladies and gentlemen, there's no such prevention program elsewhere in the rest of the European Union with a view to preventive cardiovascular disease. All of that must be commended, and the University of Athens, ECPA, is always steadfastly working with the Greek state, the government, the Ministry of Health, the Ministry of Education. We're closely working together and we're deciding upon the goals of the future. And of course, our goal for the future is to continue to provide high quality services, health services, innovative research, and to keep training the health practitioners of tomorrow, the health professionals of tomorrow, because health above all actually signifies an innovative and practical system that will be people-oriented. Thank you. So much. Dean, over to you, sir, the Minister. Let me kick off, Minister, with the digital transformation of the health sector or health services. Will you please acquaint us with how it works and to what extent it's facilitating the national health system of Greece? We have the 1566, a new hotline, and after that we are going to talk about the e-records and files. To begin with, I hope you have all downloaded the My Health app. I hope you have it on your digital devices. Raise your hands. Who's downloaded it? Let me see you. I hope you're telling me the truth. I haven't downloaded. There you go. Mr. Hadjinikolaou has not downloaded the app. I have to, he says. Well, objectively speaking, says the Minister, we have created over the past 2 years various digital tools, especially the My Health app is a shocking revolution. This contains your personal dossier. It's important. You're seeing a health practitioner and you have there the overview of your state of health, your tests, your lab results, your meds. I haven't downloaded because I'm afraid that there's no room for my dossier. But you see, the capacity is huge. Don't worry, Mr. Hadjinikolaou. No matter how big your dossier may be, if you go to the ER, this shows the practitioners which meds you shouldn't take because you may be allergic. This is life-saving. Moreover, in here, in the My Health app, you also now have the picture archiving and the communication system. So you have RES and PACS in here. You might have your CT scans or MRIs. And then there is the Prolambano, Prevent and Preempt program exercises. These are the reminders for upcoming tests. There's this icon for the new appointments there. You can book an appointment with health practitioners. These are free of charge appointments. They may be AOP contracted, or you may book an appointment with any entity, health facility whatsoever, be it at a hospital or a hospice or a primary health care service provider. So now, people used to say you have to wait for 5 months, and now you can find an appointment thanks to My Health app within the span of a week. As of the 15th of December, we are going to also allow for such appointments to be made in order to have blood samples drawn, to have an MRI scan, any diagnostic check whatsoever within the public sector system at hospitals or contracted labs. So there's also the bracelet that the Prime Minister has referred to. This is connected to the My Health app. Once you are admitted to hospital, I'm not talking about someone who can't walk, but if you are an ambulant patient, then you can wear the bracelet and it communicates with the app, and now you can know in how many minutes the doctor will see you. So in the meantime, instead of waiting there, you can do stuff and come back at the right time. All of that. Wow, this is there's e-file, health file, this is included. Yes, everything is in here. So everything is in the application. It's visible, it's obvious, you can see it anytime. This has also encompassed a digital assistant that helps the doctor and a digital assistant that will be up and running pretty soon, maybe next week, to facilitate the lives of citizens. What about the bracelet that the Prime Minister mentioned? He said that the connotations are very strange. We can't change that. The bracelet will stay. So what's the advantage? You have a digital tracking method now. Well, there are two things. First, this bracelet and the fact that a patient may wear it is allowing us to keep track of what's happening in real time at the area departments of various hospitals. So the emergency department, I can check what's happening at Attikon or Evangelismos Hospital and how long the line is or the waiting time at the Yenimatas Hospital. This is very important in order to know what's not working, but this is also important in terms of the patients. Mr. Hadzi-Nikolaou, this has put chaos into order. When you're admitted at the ER, what is the ER? You are not just taking a stroll there. You may be stressed or anxious. Maybe you are worried and you are sick. The last thing you need then and there is for you to feel that you're in limbo. Thanks to this system, you know at any time where you're supposed to go and at what time exactly. This, as such, in itself, changes the experience at the ER. And we worked with Marios, with Mr. Themistokleos. So we had a press conference held at the Ministry of Health together, the two of us, last February. And we had tracked down the waiting time. It was on average 9 hours. So our objective was to slash it, thanks to the hiring of new staff, the fact that we have the bracelet, the new schemes, the new entities we have established. Everything now has helped us to slash that waiting time, and we are under 5 hours. Imagine that, within the span of a year, or less than a year, we managed to save patients, each and every patient, at least 4 times of waiting. What about the national system on network for telemedicine? Do you have stations or terminals? We are making a lot of progress, and at the health centers this is working. Within the year 2026 we are going to revolutionize that thanks to new telemedicine tools and instruments. Telemedicine technology, well, AI plays a great role there. It's evolving. How many terminals do you have? Each and every health center has one, so we can have telemedicine there. It's dense. We have 360 telemedicine centers. They are working. They're up and running as we speak. We have new digital systems. They're easy to use. They're not the old systems, but let me reiterate that the big plan involves the isolated areas and getting the pharmacies on board. Mr. Baltas is there. Pharmacies and drugstores in Greece during the memoranda era were thought of as a burden. The IMF used to say that it's a problem. It's problematic to have so many pharmacies and drugstores in Greece, and we have to slash the number, but you see, they're helping us. The pharmacies and drugstores can help us spread out this network of services and terminals, and it can help cover all of Greece. We will be using AI, and we will be involving and putting on board only the pharmacies and drugstores to make sure throughout Greece that we are giving scope for even more tests and exams through doctors. Don't get me wrong, we are not abolishing the physicians. It's just that thanks to technology being used by the pharmacists and the chemists, we will be able to involve everyone, to have everyone's needs covered, even in isolated areas. Which brings me to the RRF. The Prime Minister said, and we heard him say that, he said that there's not a lot of time ahead of us. After all, it's August 2026. By August 2026, we have to make sure that we have wrapped up, or rather absorbed all the funds and do all the projects. To what extent are we being successful? How far are we as of yet? And what else do we have? When it comes to absorption rates, in 2024 and 2025, we were in the avant-garde. We were actually the champions, ahead of everyone, compared to the rest of the ministries of Greece. By 170 million, we exceeded our initial goal. And again, despite the fact that this year we had 500 million, we still did absorb more than that. 503 was the objective, and you've gone beyond that. Yes, we have managed to absorb more than 600 million for that matter, and I'm talking about payments. You see, we are ahead of every ministry in terms of absorption rates. We're absorbing faster and we're going higher. Our objective is to take advantage of the last single euro. Is this used for innovations and refurbishment, modernization? Yes, it's about all of that, plus digital tools and technological equipment. Ms. Juma and Mr. Karagiannis, I can see them in the public today. We are in the final stretch for the big hospitals. No doubt we're doing great. Our goal is to make sure that we use every single euro, that nothing goes to waste. The RRF is a huge blessing, and it would be such a waste and a pity if we let such an opportunity go to waste. And of course, the RRF, we are using it in close collaboration with the Ministry of Development, and we are taking advantage of the investment clawback. It's not just the digital schemes or the upgrades. We are talking about the future of pharma, next generation. You heard me talk to the Prime Minister. There are complaints. The pharma companies complaining in Greece. I'm really impressed. Mr. Demos, who's here right across me, and he is one of the fervent supporters. He's one of the sponsors, Mr. Demos, of this conference. He has a bitter smile on his lips and he's drinking bitter coffee. Mr. Demos, since we named him, you know what? These are all my friends now. And during my previous tenure, they were friends. Yeah, but you have to make sure that you nurture these friendships. And I think that the global is being detrimental. They used to love me in 2013-14 when I had taken them to 2 billion. I think we're doing okay even now when we're giving away money. But let's put things in order. I'm very proud. Everyone should be proud as of the fact that Greece has been accused of not being a productive country, but now we are exporting 10% of our production in Europe while we are consuming 2%. And now with a cluster in Tripolis, thanks to the investment clawback, we have the Demos plant. Dimitris, hopefully it will be inaugurated in 2026. There is Faran, there is Alpen building there, the whole cluster in Tripolis. And then in Attica, we have the VNX plants, the industrial facilities, and Bennett. All of that is affording us great scope for pleasure. And we're happy because it turns out that what we build is offering prospects for the next 30, 40 years.
As regards domestic pharma, we have made a political move. We have provided a sustainable and stable environment for our pharma sector for the coming years. That was not easy because there are people in here who objected to that. But I believe that we are implementing a transparent and balanced policy. Clawback is not an easy thing to manage. Everybody wants more money, of course. The issue is, since we are already adding funds, can we deal with the difficult situation, an aging population, greater needs in medication? Then the preventive policy increases the need for medication because people know that they suffer from something. So the fact that somebody went and had a heart disease screening, people who were not aware that they should be taking statins, they know it. So there is an increase in the expenditure. Of course, in a 10-year horizon, this will be beneficial because their lives have been saved. But for the time being, this is increasing the cost. So it is difficult to deal with that issue still. But we are all aware of the situation. Please, can you describe us the how the electronic system of monitoring the use of medication is operating, and whether we are saving expenditure that has been paid by the state and the taxpayers. First of all, we don't have the HMBO, but we have a more specialized system in the ministry. So what do we do today? There are much fewer the medications for which there is a ban on export, and many more in the pharmacies. As regards the house delivery, home delivery of medications, this is a major achievement. In the past, I have been accused when I was looking at the long lines because I was providing them coffee, etc., while they were waiting. But I did say that we're going to deal. So the first stage, these medications will be distributed by the pharmacists, then sent to home, and there will be a third stage. So when the cycle will be completed, more than 60,000 people who would be waiting in front of the state pharmacist will receive the medication at home. This has improved their quality of life. So it is a great pleasure. Plus, the pharma industry is certain that there are not going to be any waste of money. This is all good. Can you give us a picture of the operating theaters? People were worried about the afternoon and evening operations. We know each other since many years. I'm sure that many people are not aware that much of my career is because of Mr. Hadjinikolaou, whether people consider it good or bad, but still, it is not because of me. It is because I offered you some opportunities when you were excluded from the media. Well, this is no mean thing. Yes, sometimes this leads to success and sometimes to disaster. Opportunities are not always successful. Anyway, I'm not a person who likes calm situations, so fuss has always been around me. So, do you remember what happened when we were in front of the surgeries in the evening? There was a huge fuss, but now, 2 years later, we have 88,000 operations in the afternoons or evening. So these are obvious solutions. People will be saved for decades in the future. We also organized the private dentist in the NHS system. People were complaining, and when we organized the electronic appointments, people were complaining, but now 1 million people use the electronic system. There's always somebody who will complain. The issue is that you should have a plan and you must implement it. The prevention program we hastily discussed during the investment issues, but let's look at the problems. 765 breast tests and many thousands of prevention tests, PAP tests. So we are 11 million in Greece. 1 out of 2 has used at least once one test from this prevention system. And if there are pending prevention screening tests, then do them, please. It's a waste of resources if you don't. It's not a quantitative issue, because even if one life has been saved, this is invaluable. Imagine the thousands that we have saved. Mr. Hatzinikolaou, when we did the colon cancer prevention screening test, we were giving doing it through the pharmacists. We were called thieves, but to date, this has identified and saved more than 7,000 people, 7,000 who were not aware that they had early stage colon cancer, and now they have been saved. This is very important, especially in a country with demographic issues. And Prime Minister was right when he said it's not only the data and the tests. Many people never screened, never had did prevention tests or early tests, and now they are used to it. So let's conclude with mental health, which I believe that we underestimate in the public debate. Has something been done there? Has it been reformed, upgraded? We need to specifically discuss what has been done and what your intentions are. Already since my first mandate was, I see that the mental health situation has deteriorated. I don't know how this can be explained. People say social media, they say the pandemic stress. For instance, I go crazy when I drive the Kyriakos. Well, I ride my motorcycle, but always wearing a helmet. But modern life is stressful, yes. Mr. Vardzopoulos and I, we have been working on mental health. Things are doing well. We have upgraded the psychiatric hospitals. We have also established phone lines, to support lines. Also, as regards the adolescents, we have banned adolescents from buying tobacco and alcohol. By the way, I should like to warmly thank the Hellenic police. Already a few days ago, they started a program of checking the bars to control the young people who are there. We have already prosecuted bar owners who have violated the law. So we have a coordinated action at this level, and you will see the results. So in conclusion, what are your objectives for the coming year, 2026? In 2026, we aspire to fully use the RRF resources. This is an issue, important issue, so that we can hand over a very good system. The progress made between 24 and 25 and achieve the same progress in 25-26. If we are able to achieve this in 2026, the results will be better. We have made a call for tender for 126 doctors in remote areas, Drama, Xanthi, etc., in the north. But I believe that we will do better. We are about to introduce another important incentive which will be implemented in 2026. Thank you, Minister, also for supporting this conference every year. And now I will hand over the mic to the All of Health, All of Year.gr, Miss Emilia Stathakou, who is the health editor of Real News and Real FM. She will be presenting to you a very important sector. She will be with you in shortly.
60 χρόνια. Ένα ταξίδι που ξεκίνησε από το όραμα του Δημήτρη Πενταφράγκα, ενός φαρμακοποιού από τον Εύρο. Και έγινε ιστορία ελληνικής φαρμακευτικής καινοτομίας και βιομηχανίας. Από τότε, ένα πράγμα μένει αμετάβλητο. Η δέσμευση να βελτιώνουμε τις ζωές των συνανθρώπων μας. Κάθε δεκαετία, ένα βήμα πιο μπροστά. Από την πρώτη εγκατάσταση στο Πικέρμι και τα πρώτα σκευάσματα, στα ποιοτικά γενώσιμα που...
Ladies and gentlemen, good morning. After such a very interesting interview that the Minister of Health gave to Mr. Hadjinikolaou, we will embark on the discussion of the first session, which is about the very core of pharma policy in public health. From lacking meds all the way to using biotechnology to embark on a new era, the lack of pharma and meds and access is not a conjunctural challenge for Greece, but this is a pan-European phenomenon that's exerting pressure on the systems. It's certainly an issue of quality to access, and it tests the patience of everyone, including practitioners and patients alike. As we speak, Greece is faced with a huge wager about to upgrade our productive basis to turn this crisis and the non-sufficient supply of drugs into a new opportunity for us to eventually produce, generate and export innovation. We are in the presence of the links to this chain. So we have various representatives. Mr. Babis Karathanos, who represents the ministry, is here. Mrs. Theano Karpodini, the governor of EOP, is also here. Olympios Papadimitriou, the president of the CEFE, is here. Mr. Sapounas Spiros, the National Meds Organization, NOREOF president, is here, along with Mr. Demos, who is the president and the CEO of DEMO, and the vice president of PEF.
Που φέρνουν την ΕΛΠΕΝ πιο κοντά σε περισσότερους ανθρώπους. Χτίζουμε το αύριο της ελληνικής φαρμακευτικής επιστήμης με την ίδια αφοσίωση που μας καθοδηγεί εδώ και 6 δεκαετίες. Να καινοτομούμε, να θεραπεύουμε, να εμπνέουμε. ΕΛΠΕΝ. Advancing Health and Care for All.
Good morning and welcome. Thank you for joining us. Mr. Karathanos, let's kick off with you. Let's start with a positive piece of news. Over the past year or so, and that's the good news, is that by comparison to last year, the previous year, Greece used to be faced with not sufficient supply of basic meds. Nowadays, this has been dealt with. It's resolved. What changed? Factors that changed? Interventions that were taken? Well, thank you for the invitation. Of course, other than my capacity, which I have almost since the start of the term of Adonis Georgiadis, I was in charge of pharma policy during the Troika years, and that's part of the experience that accumulated. But then again, I am well versed in terms of managing crisis. Back then with the Troika, the expenses were slashed, and there were also price issues, there were problems, and the Troika was trying to get half of the drugstores to close down in Greece. Indeed, we're better off. 3 years ago, in the winter of 2022, with Mr. Plevris, together, we were at the ministry together, the big issue was the fact that, as you probably know, most of you, we had a dual gap. On the one hand, meds were exported because meds here were cheaper. In the rest of Europe, the price was higher, and therefore we were exporting heavily. And so the Greek market was left without necessary drugs, fundamental meds, and when it comes to missing drugs or not having enough, the production had dropped. The big companies had dropped the production again because of the low prices. We didn't get sufficient quantities in Greece. What was the solution to the problem? We tracked down real-time the itinerary, if you will, the drug, given the platform that the minister said before, described before we created this platform. Now we are tracking down what's happening with the reserves, the supply in the warehouses, at the level of the pharma companies, what's there, at the level of the individual pharmacies too. There we have a slight glitch because there are various drugstores that do not have the respective warehouses and they don't have an electronic system for us to keep track what's incoming or outgoing, but we're going to change that, and eventually we're going to extend a helping hand to the drugstores for them to have an overview and for us to have the overview. That afforded us scope to track down the real deficits or voids and what was missing. And if, according to the legislation, if the Greek market is not covered, then the drugs cannot be exported. EOF was helpful that way. Remember, we had 360 drugs that were not allowed to be exported. As we speak, it's 150, so it's important for this market. Yes, and I believe, says Mr. Karathanos, that the third measure we took was important. It was a brave decision made by Avanis Georgiadis last summer. Last summer, after 13 years, for the first time, the cheap drugs prices were increased because many of those drugs were actually not being marketed anymore, and there was a huge gap. We needed them direly. We're talking about drugs, the price of which ranged between 5 and 10 or less, and they used to be imported at higher prices through a FED. Now we want that wager. We want that wager throughout the whole range of this problematic sphere because there are still problems. Half of what was missing from the cheap drugs has been replenished, and now there's a process going on. It will be wrapped up by the end of this month. I'm talking now about provenly effective and efficient treatments to make sure that we no longer import so highly priced drugs and treatments. So this is the fundamental thing. That's how we manage to replenish the gap. Please make sure that you take 2 minutes each. I am determined to have a discussion on as many things as possible. Mr. Karpodini, it's over to you. Excuse me, Mrs. Karpodini. Let's stick to this subject. The European Union is drafting a so-called critical drugs list and a new regulatory framework for drug and med safety and security. Now that there is more funding and financing, do you think that it's possible for an individual country to sustain fiscal pressures, or should we resort to EU-wide mechanisms like the ones that were created during the pandemic to make sure that there is access of all patients, especially to pricey treatments? Thank you, Mrs. Tathatu, for the question. Thank you for inviting me to this event. Indeed, the problem of missing or not enough quantities of specific drugs is not solely Greek. We had the fewest such deficits or gaps and voids during the pandemic. You know why? Because we're fortunate. We have Greek pharma companies, which, especially during the pandemic, adjusted to the new situation and made sure that the market was being supplied with critical drugs and treatment. We have LP drugstores in Greece. Nowadays, thanks to the house delivery of drugs and meds, they have been supported, and then the private pharmacies will also be helping out. Now, such treatments and the respective drugs will be given to the interested parties locally. Now, that has helped us make sure that there's nothing missing from the market. And this is very, very important because now we know that at the central warehouses, we have the reserves. They are customized, they are very individualized, they are highly priced. And thanks to the central management system that's working digitally, nowadays we make sure that there's nothing missing, especially when it comes to the critical, costly drugs. Coming back to your question, the solution doesn't just lie with what we do. Mr. Karathanos mentioned very important things about the ESPADIF, and let me also refer to the fact that there is a special committee that keeps track of what's missing. As of day one, Mr. Angelis, the Secretary General, established this. We meet often, and the ESPADIF has encompassed all the critical drugs, and we are talking, even at real time, whenever there's an issue or a pharma company says they don't have, we discuss it real time to make sure that everything's covered. And we have the representation at the level of the European Commission. As you said, and you were to the point, the institutional framework is being discussed. It's going to be reformed, and there is a steering committee there, and a new regulatory framework is being created now to provide European companies with incentives for them to eventually become more autonomous and independent as concerns the provision of raw material and resources, and their productive capacity. Those two are the main reasons why quite often we are faced with lack or deficits. And then it's the old active substances. They are really low priced, and we are fortunate because we in Greece have very robust companies, pharma companies, and we for our part are creating an institutional framework that will allow such companies to market these very cheap drugs without a lot of red tape impediments for them to produce them locally. We understand why, says the moderator, and say, allow me to speak longer, but this is important at the pan-European level. At the level of Europe or the EU, we're trying to ensure there is drug and meds independence and sufficiency, to have enough raw material and resources, and to have incentives provided for locally sourcing and producing such meds. As the Prime Minister said, or rather the Minister said, we want to make sure that we no longer depend on other continents, including the Americas or the States, Canada and Asia. So it's very important for us to be participating in this framework, which is being created as we speak. And there's another parameter I'd like to refer to. It's EU related. We will have central procurement, all of us, when it comes to critical drugs, all of us in the EU, to eventually be stronger and more powerful negotiators, to also make sure we have, when it comes to rare drugs and critical drugs, enough of them. Right. We understand what the Greek pharma industry's stance is, but before I give the floor to Mr. Demos, let me insist on the EOF's success story. Mr. Sapounas, you have been instrumental in shaping pharma policy, and you've been instrumental in terms of filling in the voids and making sure there are no gaps. But I can't help but wonder, do you have the right tools and the right growth or development to be up to par? Because there are people nagging recently. Thank you very much for the question. To be honest, what was mentioned before really covered the whole cluster of measures that was taken to make sure there are no gaps and voids. At EOF, we keep saying that if we improve the core business of ours, everybody will benefit. Everybody will stand to gain. The pharma industry, the citizens, and everybody who's working in this field. So we're simplifying procedures. We are optimizing reality and daily lives. We are digitizing as much as we can every process and procedure. My personal goal is to make sure that we, during 2026, fully digitize EOF and integrate all the databases for everything to be one single thing. So one source, if you will, and that will allow us to do everything. Now, this is very important. Next year, when we meet, you're going to check whether the fully digitalized services are there. Yes, or maybe at least the beginning thereof will make me happy. That's how things are going. That's where we're headed. That's what we're thinking about within the context of the EOF, the Greek Drug Organization. We are aware of the fact that the volume is increasing. Our role in clinical trials is increasing. People are asking us to slash time. We are aware of that. We know what the complaints are. We have conducted a survey. It's a matter of delay, of efficiency, effectiveness, and time. So if we improve, simplify, and digitize our process and procedures, no doubt the personnel's mood will improve, and then we will be able to do our part. Since you have touched on complaints, let me give the floor to Mr. Papadimitriou. Mr. Papadimitriou, President, the expenses for the health sector in Greece are quite significantly lower. It's 5.3% of the GDP compared to 8.4% in the European Union. So on average, we're doing better. We have rebates and clawbacks. It's obligatory, it's compulsory, and all of that has got to a certain level, which is characterized by the pharma industry in Greece as non-sustainable, non-viable. What about FAIR's understanding with a view to the current financing framework, and is this impacting and how on viability of the market and accessibility of patients to new treatments? This is the most important. Thank you for your question, Ma'am.
Thank you very much for this question. Thank you to Real FM for this, for inviting me. I hope that I am not only present here as the head of complaints. No, there are others here in this sector as well. Don't listen. As regards the financing of the public medication expense, we are lagging behind. Yes, this government has contributed in recent years, but the rate of the growing rate of the expense compared to the state contribution are not aligned. Therefore, we are increasing the clawback, and unfortunately, the minister is not here. I must say that he sometimes steals our slogans, but he has identified a number of leaders of the expenditure increase. So if we understand that the state recognizes these leaders of increasing expenditure, things are not doing well because the gap will not be bridged. In the best case scenario, this remains stable. In next year, we will have the fourth year where pharma will contribute to the state more than it earns, especially as regards medication prices that are set by the state. We don't set the prices, and we are called upon to sell our products, to market our products with this. The average expenditure in Greece for pharma is 270, while in France it is 555, and next up from us is Portugal, 338. But Mr. Demos, we have placed you last with intentionally. We want to conclude with good news. So we'd like to hear from the Greek pharma. It is a dynamic sector, increasingly dynamic. So how has it achieved the self-sufficiency of Greek and European pharma expenditure? Listen, to everyone discussed the Greek pharma sector today, the Prime Minister, the Minister, the political leadership, and all those who deal with medicines. The figures are very well known. We are 2% of the European population, but we provide 10% of production units in Europe. Greece has a best practice, especially in the field of critical medicines and hospital medication, with the multi-winner medical system which was introduced during the Troika and Adonis Georgiadis as minister. The whole Europe is now trying to follow, and they are asking for more criteria, not only on the basis of price but also quality. So we see a shift in the European Union. But let's look at the reason why the pharma is the growth industry in this country. During the past 20 years before the pandemic, EU policy wanted to finance our research and innovation, and everything that was labor intensive, such as the generic drugs, would be imported. But we, at the time, we were a small village in southeastern Europe that was receiving funds from the EU. But the North changed their companies, their plants, production units, and stopped producing generic drugs. But when the pandemic came, Europe was left without medicine, and we Greeks we were able to keep hospitals open in France and Germany on a daily basis by sending trucks from Greece. And there are many cases that I could cite to you. Why are we here in this position? The MOUs, these played an important role in our sector. Before 2011, medicines were expensive. We need to be honest here. We were living in a paradise of prices, of charges, of corruption, etc. We had not realized where we were heading, and some companies had managed to make the extra profit into productive investments, research, etc. But when we entered the crisis period, there were drugs were missing, not because of Greece, but because of the multinationals. They wouldn't bring the the medicines in the country, not because of the prices, but because they were not so sure they would be paid. In Greece, our companies wanted to sell, but we did not find buyers. We wanted to survive in a new era of prices, so we started looking at making our companies competitive on a global basis. So we organized synergies, we organized ourselves, we looked at our advantages, and by now we have done our self-criticism, we have completed it, and now this is a sector which we believe will become the pharma sector of Europe. Well, for this we wish you all the best. This is a national priority, and also the most important person here is the patient. So, moving on to the patients, only 25% of new treatments that have been approved by EMA are available in Greece. When should we expect the Innovation Fund, and when are we going to be ready so that we can have equal and more fair access to innovative treatments? Listen. Even during the crisis, Greece was at the forefront of medications, and especially medications for serious diseases. Olympios earlier described the reason why the expenditure is growing, and while the system is being funded with the pharmaceutical expenditure has increased by 700 million in the past 4 years. At this point in time, we are approaching 3.5 billion. So why the state has increased the expenditure? Why do the company contribution is increasing? We are a country that provides important innovative medicines as opposed to other countries. We are a society and a state that looks at the person, that provides this innovative treatments. And during the crisis, again with Mr. Georgiadis, we have added 400 medicines that had not been imported by for the past 3 years, and which were being sold at 3 times the price. On this, in order to support the innovative treatments. But we are lagging behind as regards a system to assess the new treatments. We want a real assessment. Yes, this has to be completed. This effort has started 15 years ago. Come on. Yes, we have already. This is already underway. We expect to improve this assessment from France and Germany. There are 2 institutes that do real research, and the new medications that change the treatment compared to 500 medications in France, only 7% provide an improvement, and in Germany only 1%. So it does not mean that whatever is called an innovation is a real innovation. We need to make a real assessment, because the money spent on expensive treatments at the first or second stage, which we could be spending at the third stage, we could help us achieve our goals through the assessment and not waste funds. And the assessment might focus on real treatments and therefore provide patients with the right medicine at the right stage. And what the minister said earlier, during 2026, we expect to complete the digital links. So we expect to have control of the prescription system. We want to see the data, because doctors may be prescribing an expensive medicine at the first and not at the third stage, for instance. We need to move gradually. Therefore, with the innovation fund, we will have a third channel where new innovative medications will be included. Genetic treatments of high value are going to be introduced. Such treatments may allow people who are blind due to the macular disease, and this might cost, the treatment cost 50,000 per patient, but this will regenerate the gene and people will be able to see again. This we need to provide. So these genetic treatments will actually will bring a huge cost to the social security funds. Ms. Karpodini was quite right. This is a revolution in the field of pharmaceuticals, and it is very important for them to be taken centrally by the EU so that we can be able to provide them. And the Greek pharma sector has really played an important role both during the crisis and currently, because this success, the fact that Greek pharma companies did not to close down but to grow with a clawback, with the price of medications during the crisis, with the troika, etc., etc. The fact that we have protected our pharmacies. They wanted us to close down 50% of our pharmacies, but the crisis has shown that the pharmacists that all over Greece have helped us at the primary health care. So we say yes to such a medications policy, and we are willing to include the new medicines and treatments, but in a manner that the state can support it financially. Yes, Greeks did well during the crisis, but how about in normal periods, normal times? You are in touch with the providers, you know the system from the inside. So does the company rise to meet the need? Does the state rise to meet the needs of the patients, or there are requirements that are not being covered and require more focused financing?
Thank you very much for the question. As you know, since 2025, as of this year, we have the Innovation Fund, the Greek Innovation Fund. And all these products about which Babis talked, ATMDs, advanced treatments that use genes or cells or tissues, and prime meds, which, according to the EMA, are supported more so for them to be evaluated faster, because these meds are dealing with uncovered, quote-unquote, uncovered medical needs. Therefore, I believe that Greece has put in place a very good strategy as far as the access policy is concerned. Innovation access to innovation. And you talked about sustainability and resources. That's why I think that these resources are over and above any regular budget. So this is a new fund that will get extra money. I think that this is something that the companies were asking for, and especially the foreign companies that have more advanced and more innovative products. Now it's real, it's there. Coming to sustainability or viability, we have taken a lot of measures, as the Minister said, and let me refer to some additional, I agree, and I'll pick up from where he left off and add to it. We have considerably increased our checks and our audits, and thanks to AI tools, we can identify any forged or illegal prescription cases. And this is a huge success. This is helping us considerably contain the waste of resources or the use of resources without any point whatsoever. Recently, and in close collaboration with the Ministry of Health, we are using protocols, and thanks to IDICA, we are locking them into the system. As Mr. Karathanos says, this is a way to make sure that protocols are not bypassed. Do you have a timeline? Because these protocols have been talked about for the last 10 years or so. Next year, when you and Mr. Sapounas will be here and we will be having the same discussion, will you be able to tell me that it will be done? You won't be talking to me or shouldn't be talking to me. You have to ask these questions to the ministry. This is in the hands of the relevant directorate, a directorate that works on registries and protocols. We, for our part, we as an entity supervised by the Ministry of Health are there, and indeed we are participating actively in the finalization of this, including the decision on the parameters, and then IDICA is going to take over. They're going to digitize everything properly. Therefore, we will do our part after the ministry does its part, and they communicate that. We turn this into a lingo that's understood by a contractor. So, Mr. Karathanos wants to have the floor for a second, right? Well, let me say that as we speak, we have about 30% of the protocols that are being used. Next year, we're going to be at 80%. This is what we are aiming for. Mr. Papadimitriou, are you optimistic? Do you think that the pharma policy of recent years has produced measurable results? And what are the voids and the gaps that are still exerting pressure on the system, according to you? Well, I believe that if we want to predict what will happen in the future, we have to take stock of what happened in the past. Let's take stock of what happened in history to gauge the developments. I believe that the ministry, well, maybe this is a characteristic of the general public sector. It's a matter of speed or lack thereof, speed at which things are happening. Our problem is that we are moving in a sphere that is locally and globally very speedy. When the speed of implementing certain regulatory or reforming measures is rather slow, unfortunately the gaps are increasing instead of diminishing. So I can only hope that these predictions and what we're listening to will materialize next year, so that next year your question will make no sense because there will be no need for anything. But then again, given the track record of the past, I'm afraid that even next year your question will be there and will be valid. This was not a very positive note, Mr. Papadimitriou, but it remains to be seen, right, Mr. Karathanos? Mr. Sapounas, the critical role of the Greek pharma industry is obvious when it comes to securing enough quantities of meds. So, what is the role that ELF can and should play to facilitate and further enhance innovation, local production, and the extroversion of Greek pharma industries? Allow me to interject. Amongst the many reasons why the Greek pharma industry is so successful is the role of the ELF as such. We are strict in our protocols, in our evaluation. we afford no deductions or discount, quote unquote, metaphorically. So we have played our role. Of course, I understand there's a point in saying that we are late in responding. I'm not saying that we are in an ideal situation, but I believe in the highly trained staff of the OFF. I know, I have a first-hand experience. The people in the OFF are helping. So given that, let's provide further assistance and support to the people of the OFF. We've already embarked on hiring new people. There's criteria for hiring new staff is strict, and by properly manning the organization, we're going to have results. Last week, I signed off to including in the ethics committee 2 new members, chemists. Since we're talking about the new era and evaluating new drugs, this is the type of measures we're taking to be proactive vis-a-vis this whole ecosystem that Mr. Papadimitriou said is ever-changing and the demands are high. He was to the point, rightly so. But I also believe in the people of the OFF. So I believe that the industry has been successful so far to a great extent because the OFF is very, very strict with evaluations that checks the protocols that we informs. Mr. Demos, what about the Greek ecosystem? Innovation is a critical pillar for the competitiveness and the self-sufficiency of the sector. We voiced our concerns about innovative drugs and the missing quantities. Do you think that Greece can become an important research and development hub? A European one? And what about the fundamental prerequisites in terms of investments, of incentives, of human resources in the regulatory environment for these prospects to materialize? To begin with, let me comment something with regard to innovative meds and prime drugs, especially as concerns macular disease, because that will afford scope for blind people to see. Who can say that this shouldn't be reimbursed by the state? And who can say this or that committee should not approve of this drug? But then again, we also have to take stock of another thing, and this is a general concern. No health system can possibly pay for all prime meds, all innovative drugs, no matter how hard we try, no matter which protocols we endorse, what mechanisms we put in place. Germany, Sweden, Greece alone cannot cope with that. They can't fund that. And therefore, I expect that over the next 10 or maybe 15 years, that's on an optimistic note, sooner or later we will have to move to a different model. And maybe primary care meds will be paid out of pocket by the interested parties, meaning the patients, in order for prime meds to be paid by the state. This is my piece of thought. I believe we're heading there. The state can't go on paying for everything. Coming to innovation, Greece is already a hub in innovation, a research and innovation, a research and development hub. And the development clawback that started in 2019 has been instrumental. The main investors or companies that are rolling out huge schemes and programs and projects, many research programs and projects, we have established new research centers. 14 new research centers were built in Greece. People were hired, new researchers and even researchers from abroad are on our payroll. And we were in the avant-garde. And let me share a figure. R&D investments in Greece between 2019 and now amount to about 1 billion. 500 million coming from the Greek state, another 500 million coming from the Greek entrepreneurs. So there's something we see, and this is promising. That's why we are investing our money. Don't get me wrong, innovation does not signify that tomorrow a Greek company is going to produce a drug that will allow blind people to see. Obviously not. But then again, foreign companies like Novo, Berger, Novartis, those companies from abroad have been around for more than 100 years. The Greek pharma companies, let's not forget about it, is 50 or 60 years old. We are a middle-aged sector locally. Maybe 40 years down the line, yes, we will have produced such drugs, and maybe people who are deaf will be getting our drugs to get their auditory capacity back. But we are producing hybrid drugs. We have the delivery systems. We are focusing on inhalers as well. So indeed, the Greek pharma industry is undertaking innovative actions and activities, and that's going to give us more cash flow, to have more research. There is the appetite now. But we have a long way to go to get where our competitors from abroad are in terms of innovation that is making headlines. Mr. Karathanos, we have a long way to go to have public funding for pharmaceutical expenses. What should be done to have more money coming from the state and also save more money to make the system more sustainable and viable, to cater to everyone's needs? What do you think will pay off and what's needed? I believe the primary means through which we are going to get to a sustainable funding and financing for the system to eventually get the clawback to drop and make it sustainable for companies to produce. I'm bold enough and courageous to state this publicly. I believe that the retail drugs, meaning cheap drugs, which are marketed through the chemist shop, should be at 30-35% of the rebates. It's 40 to 45 now. High-cost drugs, or FIC as they're called, they are marketed through OP and they're reimbursed or given through the hospitals and the local public chemists. That is 50 or 60% and 55 to 60. The rest, I believe this is the objective that we're going to get to at the end of this decade. As of the year 2027, we are going to have important drops in the clawback and there will be important changes in the prices. This will happen thanks to controlling prescription of drugs, and the digital system will help. All therapies and treatments must have so-called locked protocols that won't allow individual physicians and practitioners to prescribe pricey drugs if there is no diagnosis or any outcome of the first stage of treatment. We have to take advantage of all technologies to keep abreast of developments and to utilize the scientific knowledge and expertise to take advantage of such treatments and such meds. So it's very important at this particular point to have a proper HTA organization, a health tech assessment organization that will provide us with such information. And since I and several of the people that are here, we are taking part in these committees. There's a committee, what's its name? What's the name? There is the negotiation committee with Mrs. Bukozotou and the HTA committee under Mrs. Bakopoulou. There are two such committees. We are taking part in that. They are working hard. They're negotiating with the companies for the year 2025. Let me share the money we are going to save. Thanks to the existence of these agreements, we're going to save the Greek state 1.3 billion. That signifies money saved to benefit the state, and this money will be invested in bringing in more such treatments and therapies. Of course, I'm optimistic. Of course, the numbers have to increase. We have to make sure that we increase public spending for pharma and treatments because this is an aging population, and so needs are increasing. Definitely, there are new drugs coming at the level of hospitals. The expenses have increased for drugs and medication, the price of which is in excess of 30 euros. The rest, below 30, the expenses steady. And we diminished the clawback for the meds that are worse than 5. And what about the checking or controlling of prescription at the level of hospitals? Not just yet. The high cost and pricey drugs and prime meds through the hospitals are checked on through OSIP and SIF and OP. These are very highly priced drugs. We are doing that, but we have to make sure that they're given at the right stage and to the right people. So by way of conclusion, let me say that I believe we have to have some sort of increase in the expenses. The minister and the whole team behind him are exerting pressure on the Ministry of Finance. I believe that the Prime Minister understands how precious and valuable this is for us to have these prime meds or new drugs come to the market. We're running a risk. Many of the new drugs, if there's no deal, they will be left outside the market. We don't want that to happen, and so the year 2026 will be good, and 2027 will be even better.
So we will meet again, according to you, in 2 years. So now, there are situations that are irrational. You are in touch with the providers, not only the pharma, it's the laboratories and lots of other people. So we see that we had a measure imposed to us by the MOUs, but now is a central policy. So what are your forecasts? I will discuss the low policy issues, because the statins, which were discussed earlier, someone said you didn't tell us what you're going to do with the statins. So we have Professor Staphylas with us. So, and with this opportunity, I want to tell you that the protocols are in the competency of the ministry, and we as an organization, alongside the minister, we have set up a group to rationalize expenditure. So we're doing what the obvious things that should have been done already many years ago for all the medications in the positive list. We lock the on the base the indications. We have started with the most important groups, and very recently this committee, this group, who I don't know if the president is here, they have responded to my request, especially as regards the statins. They have undertaken a fantastic study with alongside specialists, and we were able to incorporate this up in our system and to prioritize the patients depending on their risk level. So we saw that the high-risk patients require a huge amount of the total expenditure. So this effort takes place at many levels, and they are collective. Controls are very important. What did the Prime Minister said today, and what has he repeatedly told everyone? What all the savings stay with you. So this is what we are striving for in AOP. We have managed to increase the fiscal surplus, and it is now the time has come. Part of this surplus, which comes from the fact that we receive it from the clawbacks, we will keep. So, Mr. Papadimitriou, you as the pharma industry, do you have made a sustainable proposal to the government for a sustainable pharmaceutical framework? What can be done that patients can have access to the medicines? Listen, our proposals have been there since a very long time. The focus is that we need to update and rationalize the financing, the funding. This has been understood. The government believes that things are as they are and no further funding is required. The second thing relates to a better control of demand and distribution of the expenditure. So these are structural changes, protocols, etc. What Ms. Karpodini has just said is what we want to achieve. This is our direction as well. The most important thing is how quickly some things are looked at and implemented. There is not a problem of over-prescription in Greece. The mix of the pharmaceutical expenditure depends on whether the cheapest medication is chosen. So the state control, the state is responsible. The state control is inadequate, and this has been our problem in recent years. Things are improving, I must admit, but we have not reached the point where we need to have reached. So it is better for pharma to sell less and return 50%, or rather than selling more and return 80%. No, Mr. Karpothinis, this is true. Listen, the Prime Minister said that the pharma expenditure depends on quantity and price. Mr. Papadimitriou, in this country, we pay well for the medicines because we used to be at the 3 lowest prices in Europe. We are now at 2 lowest in the Eurozone. This costs 120 million to the budget. So when patents expire and the prices fall here, this requires a 10-year period, so another 120 million for the budget. So a big part of the budget relates to this, and you are quite right, and I agree that we at some point need to understand, and that's why the Prime Minister asks us to make savings. Medications with the same pharmaceutical value will be paid at the lower price of the medication. Mr. Papadimitriou, you want to comment on that? Listen, what can I comment upon? I believe that the industry is trying to contribute proposals. Deloitte we have funded Deloitte to make a study which we sent to the ministry, but the response was not the expected one. But anyway, if we understand that the state does not believe in better financing the system, then they need to find a way to control the expenditure and the demand. They don't do it. They let the companies do that. And if we go on like this, at some point, someone will say, I'm unable to provide this medicine in the market, and well, this is something that to be avoided. But when you pull the rope all the time, sometimes at some point it will break. So I hope it will never break. We are certain about it. There is a program. There is a proposal. Yes, but this rope has become an elastic one. So let's look at what the Greek Medicines Organization have to do in order to improve the situation for everyone. What's your personal vision? A question or a comment on what Mr. Papadimitriou. I am a clinical doctor at the same time, and there is, in my view, an issue of overprescription. He said there is no such issue. But listen, it's not quantifiable, but an indicator is the consumption of antibiotics. We're number 1 per capita, which shows the culture, the mentality, both of patients and doctors. So we need to raise awareness of the public opinion and, of course, the medical staff, and, of course, to prescribe cheaper medications. Now, as regards our organization, the Medicines Organization, this has already been answered to a great extent. Yes, we believe in our human resources. We want it to be staffed because in this manner we will multiply both the revenue and to the Greek economy. We want digitalization. We want better cooperation among the different players. All of us collaborate very well, and I have been in the ministry for 21 years. We have never seen such a good level of cooperation among the different stakeholders, and this is going to bring about good results. And at the European levels, we try to deal with our obligations to the extent that we can, or to participate in joint actions to raise our visibility, and we ask them to to help us. We are not the same as France or Germany. We need to get know-how from them. Yes, we have a strong pharma industry. Mr. Demos, your company has decided to proceed with the development of biotechnology medicines, active. This is a real innovation. How come you have decided to do it? This is a business risk, and what is your vision for the whole situation of medicines in Greece? When we are discussing biotechnology and innovation, we are discussing at least 50 million per molecule and a marathon for the next 10 years. So the first issue is the funding, which for where the state is helping us through the new clawback. But the second issue is the stability that Greece has shown us, where every three years things change. We have decided to proceed with a 10-year horizon, and on the basis of two criteria. Number one, our company is a hospital company, so there was no other option for us but to proceed with biotechnology. So we are moving in this direction. Most of the techniques in hospital techniques are biotechnological, and what we saw is that 70% of the medicines expenditure of hospitals is going to be on biotechnology. There are also some social or scientific criteria that have led us in this direction. We understood that we need to give something back to Greece, to our scientists. We are the most important company of injectable medicines. We have the conditions of creating biotechnology. Sterility is the key to our sector. So we also want to bring back, to help the brain gain as research, as regards researchers. We are going to proceed with clinical studies. So many require them to, I believe, to be that we will be the first ones to do it with our first biotechnology molecule. And I believe that we are going to make a point that we were the ones to start biotechnology in Greece. So I hope that your vision will come true. And now we will watch a video of the Minister for Development, who was unable to attend because he had to travel abroad.
Για σημαντικές επαφές με εκπροσώπους αμερικανικής κυβέρνησης δεν μου επιτρέπει να βρίσκομαι σήμερα μαζί σας. Ωστόσο θέλω πραγματικά να ευχαριστήσω για την πρόσκληση και να υπογραμμίσω τη σημασία που έχει το συνέδριό σας. Ένα συνέδριο με πολύ καθαρό μήνυμα, υγεία πάνω απ' όλα, και με επίκεντρο τη στρατηγική της υγείας στην ψηφιακή εποχή, την τεχνητή νοημοσύνη και τη βιοτεχνολογία. Στην εποχή μας, η υγεία, η καινοτομία και η ανάπτυξη δεν είναι τρεις χωριστές έννοιες. Συνθέτουν μαζί ένα ενιαίο κρίσιμο πεδίο πολιτικής με ουσιαστικές συνέργειες. Η εμπειρία που βιώσαμε όλοι οι δύσκολοι της πανδημίας και οι ελλείψεις των τελευταίων ετών σε φάρμακα σε ολόκληρη την Ευρώπη μας έδειξαν με ξεκάθαρο τρόπο ότι η παραγωγική αυτάρκεια, ιδίως σε ένα τόσο κρίσιμο τομέα, τελικά είναι θέμα εθνικής και ευρωπαϊκής ασφάλειας. Και σε αυτή την πρόκληση, η ελληνική φαρμακοβιομηχανία, ένας ισχυρός δυναμικός κλάδος που στηρίζουμε με όλες μας τις δυνάμεις, έχει αποδείξει ότι μπορεί να είναι στην πρώτη γραμμή, με σύγχρονες μονάδες παραγωγής, ισχυρή εξαγωγική παρουσία, θετικό εμπορικό ισοζύγιο, χιλιάδες θέσεις εργασίας υψηλής προστιθέμενης αξίας, είναι ένας από τους πιο δημιουργικούς ισχυρούς πυλώνες του νέου παραγωγικού προτύπου που υλοποιούμε στην πατρίδα μας. Η υγεία και η οικονομία αποτελούν δύο όψεις του ίδιου νομίσματος, διότι πέραν όλων των άλλων, μια ισχυρή οικονομία μας δίνει τη δυνατότητα να επενδύουμε όλο και περισσότερο στην υγεία. Και κάθε ευρώ που κατευθύνεται στην πρόληψη, στην έρευνα και στην καινοτομία, επιστρέφει πολλαπλάσιο στην κοινωνία μας. Κάθε νέο φάρμακο, κάθε νέα θεραπευτική προσέγγιση που γεννιέται μέσα από την έρευνα δεν μεταφράζεται μόνο σε μια επιχειρηματική επιτυχία. Οδηγεί σε καλύτερη ποιότητα ζωής στον ασθενή, σε πιο ανθεκτικό σύστημα υγείας, αλλά και σε ισχυρότερη και τελικά πιο εξωστρεφή και ανταγωνιστική ελληνική οικονομία. Η βιοτεχνολογία και η τεχνητή νοημοσύνη μπορούν να αποδειχτούν καταλύτες σε αυτή τη μετάβαση. Από τα δεδομένα στη γνώση και από τη γνώση στην ανάπτυξη νέων πιο στοχευμένων φαρμάκων και θεραπείων που μπορούν να παράγονται στην Ελλάδα. Η τεχνητή νοημοσύνη επίσης μπορεί να εξοικονομήσει πολύτιμο χρόνο στο γιατρό προς όφελος του ασθενούς, να βελτιώσει τη διάγνωση, να στηρίξει την εξατομικευμένη ιατρική. Αλλά πρέπει να κάνουμε απολύτως ξεκάθαρο ότι η τεχνητή νοημοσύνη χωρίς δεδομένα δεν μπορεί να υπάρξει και αυτά τα δεδομένα πρέπει να είναι ποιοτικά, καλά οργανωμένα, αυστηρά ανώνυμα, με πλήρη σεβασμό στην ιδιωτικότητα και σαφείς κανόνες εμπιστοσύνης. Ως Υπουργείο Ανάπτυξης στηρίζουμε σταθερά τις επενδύσεις στη φαρμακοβιομηχανία, στη βιοτεχνολογία, στην καινοτόμο έρευνα μέσω του αναπτυξιακού νόμου αλλά και των στρατηγικών επενδύσεων μέσα από ισχυρά κίνητρα για έρευνα και ανάπτυξη. Θέλουμε η Ελλάδα να είναι χώρα που παράγει φάρμακα, εξάγει τεχνογνωσία και προσελκύει όλο και περισσότερους ταλαντούχους επιστήμονες. Σας ευχαριστώ θερμά, σας εύχομαι καλή επιτυχία στο συνέδριο και τα συμπεράσματά του είμαι βέβαιος ότι θα είναι πολύτιμα σε όλους μας. Ευχαριστώ και πάλι.
Thank you. And this was the message of the Minister of Development, and this is certainly fully aligned with the spirit of the discussion. It's as if he was taking part in this discussion. That's the epilogue of this part. Let me extend my warm thanks to Mr. Karathanos, Mr. Kapodistrian, Mr. Sapounas, Mr. Papadimitriou, and Mr. Demos. And let's now move on to the next part of this session. Ladies and gentlemen, following everything we heard, it's clear meds are going through a time of changes, huge opportunities and challenges, and let's now embark on a discussion on big data, innovation, and the role of critical entities that shape and determine the tomorrow of this ecosystem. We will be inviting Mrs. Niki Tsouma, the CEO of IDICA, Mr. Baltas, who is the president of the Panhellenic Pharma Association, Mr. Boufidis, who is the Secretary General of PEF, Mrs. Tsekoura, the president of the Union of Patients, and Mr. Paliaros, who is the president of the Pharmaceutical Cooperatives of Attica. Thank you for being with us, ladies and gentlemen. Ms. Tsouma, let's start with you. Given that e-prescription is processing 800 million prescriptions and there are millions of patients, how can we be well focused when we turn this data to have not just indicators that point to consumption but real policies? Good morning, says Mrs. Tsouma. Thank you very much for inviting me to this event. Yes, indeed. Now, prescriptions amount to 1,200,000,000, which means that the e-prescription system is a vibrant system. It's a system that's dynamic. On a daily basis, it's working, it's up and running, it's producing, it's storing data, and it's not just the data of the prescription system. On the basis of this data, we've built the national medical dossier for each and every patient. So we have the health dossier per patient. For years now, data is being generated, stored, and processed. Yes, indeed, there is data created and generated at very different sources. And we're talking about primary information. The prescription system is one of the many such sources. The prescription system includes the medical information that is generated at the level of the medical practitioner's office or the practice, then the drugstore, and you have the prescription first, then you have maybe you have a lab test or results, there you have it. Then you have the prescription, the exam, the outcomes, and then in due course, and as health issues evolve, we have created registries for patients. That's another source for primary information and data pertinent to the individual patients. We also have hospital systems and their respective data. You heard that we have fully digitalized the system. We have the RISPAC system all over Greece, a radiology info system plus picture archiving. So this is part and parcel of the e-dossier. You have more data than prescriptions. And that in turn signifies that we are entering another stage. We're talking about strategizing based on evaluating properly the data. It's not just about how many prescriptions were issued, how many, which ones, what sort, how many per location, how many that afford us epidemiological data or statistical data or geographical data or historical data that are intertwined with the regions and locations, the historical and social distribution. This is a plethora of data through the use of state-of-the-art processing systems. We're taking advantage of this data to eventually have a strategy. Right, let's provisionally stop here. Let's look at this strategy now and what the role of the pharmacist, the chemist might be. The health system is being digitized, Mr. Baltas. AI and data analysis, how can they improve and enhance the role of chemists, of drugstore owners, and improve and earn safety and security? To begin with, let me thank Mr. Hadjinikolaou and Mr. Thadou because you are giving me scope to discuss something that, and please pay attention to that, focuses on Greek patients. This subject matter is of interest to us really now. Let's think about the fact that this is a time when things are changing fast. Technological developments are so fast and so many, also in the field of biotech, that now we are living in a new environment where scientists can use innovative drugs and provide customized remedies and treatments. But there are challenges. New tech is costly, that's one thing. Demographics, the aging of the population is a serious issue. It's exerting huge pressure on the systems. And then again, it's a matter of patients' expectations. Patients see there are new innovative drugs coming out in the American market and they think that the day after it's possible to have these come to Greece. And that's where chemists have a role to play, in the sense that we, as chemists, when it comes to this particular issue, we believe that you can have different ways to approach innovation. Firstly, the product itself has innovation. There are biotech products, customized treatments. And then a second thing that was mentioned by the previous speakers or the previous panel, yes, indeed, there is a Greek pharma industry and there are respective businesses that can fill in the gaps in the rest of Europe. They provide or produce innovative drugs. And maybe you're aware of the third thing. There's this standard practice. We have Galenic medicines. They are repositioning themselves on the map. You know why? Because at the level of the European Union, the EU is doing that. Galenic drugs are produced by the chemists at the labs. This is innovative. There's maybe a syrup for a child, and the child physician, the pediatrician, wants to have it in a specific form or format, I can do that. Are there many chemists that can do that? Yes, certainly is the answer. And in addition to that, pray forgive me for interjecting, says the moderator, but in recent years, I see your sector develop more commercially, if you will. Right. This is a new turn. The pandemic has taught us a lot. The minister said that there was a time when the Troika said 10,000 drugstores must close. And now there's a change. If you have a so-called local doctor, community doctor, come once a month, who's going to help? The Lachin gel, for instance, it's missing. It's just an example. It's missing from the market. But this gel can be a galenic drug. The drugstore owner or the chemist can do it. And then MVO is the organization that validates medicines. It started to check whether one medicinal substance or product is fake or not. It's a matter of philosophy. Vic and everyone knows that we have drugs made in Europe and maybe they come to Greece. If this medicine comes to a specific storage room or a warehouse, if it goes to the patient or not, we can track it down and we can see what's happening elsewhere if we can't find it. This is really highly innovative. And you know what? It wasn't underlined before. Espadiv is a system that works. I don't know if the president of the office here, you can improve that, they can improve it. But then again, do you know where the quintessence of all is? It allows you scope to know whether there are any gaps or missing quantities and drugs from the market. And this is very important. And the second most important thing is this. The system, as we speak, does not disallow the warehouse to proceed with exporting without checking first what's that. But you've opened up 3 different issues or chapters. I can't keep up. Please bring this to a close. I'm just trying to show you and make the point that this is innovation. Innovation is everywhere.
Are you aware that the greatest problem in Europe is the microbial tolerance? Well, please don't go into that. Next speaker. Mr. Boufidis, what can we change in the prescription system so that it can become economical and sustainable without hindering the access? Listen, as a pharma company, we believe that all patients should have access to all medications. And Mr. Thaku, we cover 8 million social security numbers. We are able to do that. The previous speaker said that cheaper medications have to be given a price increase. Why? Because the Greek patients need it. So we should not allow Greek patients to suffer from a multifactorial system. We need to support Greek patients with quality Greek medications, and which we, as an association, we sound them to more than 70 countries. Mr. Tsekura, the issue is important. But nothing is important if the situation is not does not improve for patients. So, can you tell us whether, after everything we've heard, we see new opportunities and new responsibilities? How can we ensure that the patient will really benefit, not only as the beneficiary, but also will be involved in the decision-making process? Thank you, Mr. Thaku. It is an honor for me to be representing Greek patients as on behalf of the Association of Greek Patients. Your question is very important. How can the patient become a real beneficiary of the situation. If we really want the patients to really benefit, not to be one of the stakeholders, there are three solutions. Number one, we need access to data. I was very happy to listen to Ms. Kapodistrian, who is really making a great effort, especially in the field of heart disease and cardiovascular problems. We need to be able to assess the data and receive the right prescription. The new treatments have to be assessed and paid for, real protection of medicines, and of course the prescription system needs to be have to access the hospitals. So we are entering a new era of data, and therefore we know that this data requires the involvement of patients, the association of patients. We have excellent cooperation with IDICA, but this has to be institutionalized. It is an issue of transparency, accountability, and social legitimization in order to have a real transfer of patients' experience. Patients will support the shaping of policies, and therefore we will have an easier implementation of these services using digital tools such as the electronic file and the health book. Yes, these are self-evident in other countries. Exactly, and that's why we insist on this cooperation. Let us look at the role of pharmacists. The Prosfifape group is steadily among the 100 great bigger companies that are active in Greece. This is a cooperative of pharmacists. How have you managed to have this position? Thank you very much for honoring us with an invitation to attend. What is this pharmacist cooperative? Because it's a good thing. This is made up by tens or hundreds of pharmacy owners who own a pharmacy warehouse. They jointly decide on the direction of their joint business. The reason for this is that they wanted to be able to control the previous link in the pharmacy chain. Maybe our name is not widely known because we don't have a contact with the last consumer, but you may have seen our vans that circulate in order to ensure the sensitive product, that is medicines. It is not a very commonplace that a cooperative would be among the 100 larger companies. This makes us proud because we have managed to combine business with the social companies. We are constantly increasing our numbers. Pharmacists trust us. Quality improves, and they feel that there's a feeling of ownership among the pharmacists. They want the system to flourish and grow. This was a very smart idea, proven by facts. Mr. Tsoumas, let's get back to you. You said that big data arrive in the pharma and so industry. How can we provide this big data to the production of medication?
What we can picture, what can be done, what is actually being done at various layers is The fact that we are feeding in the Greek pharma enterprises with the statistical data that are of interest to them at the initial level of outcomes, the outcome of a certain flow of data, or at a second layer or level, at the level of what's happening with clinical data and the outcomes of other types of research. This means that the pharma industry can now have access to all those statistical data that are of interest to it in the sense of the initial outcomes or expectations and predictions and forecasts, but also the essence of things, the whole cycle of the life cycle of the medicine, how it's marketing, what about its impact on public health, what it's doing on the health in general, even individualized and customized outcomes. And therefore, we can draw conclusions and check upon the outcomes by taking advantage of anonymized statistical data per category, per sector, per location, per region, per disease, per medical condition, per type of medicine plus category of patients. And therefore, now, the pharma industry has data, statistical data of all sorts. They're infinite. Shall we give the floor to Mr. Boufidis? How important is this, sir? And how can the Greek pharma industry ensure Catholic and universal coverage, a steadfast one, for all patients at this time when the system is under pressure? This is possible, it's feasible, it's a fact that we can, and we did so much. Let me remind you about what happened during the COVID pandemic. Back then, we did things that were not publicized. Germany and France, they closed off their borders and they said they're not exporting anything else because they didn't know what to expect. We had no problem whatsoever vis-à-vis the Greek patients here. 44 industrial plants were working day and night during the COVID pandemic, and I think we are all aware of the results. Now, thanks to IDECA, we can do the following. We can use Greek quality drugs, Greek generic drugs, to therefore cater to the needs of over 70 or even 80% of the patients. And this is important to most general categories. And this is helping us save money for innovative and private drugs. And this is good. It's a solution for the next 5 years. Mr. Baltaos, what is your understanding in terms of innovation in pharma? I'm not just talking about products. I'm talking about procedures, new experiences for the patients. And what's the role of the chemist in this transition? To begin with, I think it's necessary the way innovation is. But first, let me help you understand about what chemists are doing. We are faced with patients who can't stick to their treatment, but there are systems in place, they're created by the drugstores. We can thus have access to the device, the digital device, the cell phone, in order for us to tell the patient exactly when the time is for them to take their med. And if they're working, they're cooperative, there will be confirmation. The patient will click on the icon, will know they took the medicine today, will come back the day after. So we're using it with dementia patients, patients that are faced with difficulties. It's tough for them to remember the exact dosage, and in close collaboration with IDECA, of course, we can make progress that way. And there is the rapid test. Remember when we used to have them? Without them, it was impossible to deal with COVID. Now, rapid tests. We kept track of them. Now all tests can be done digitally. We keep track of them through the drugstores, and that's quite helpful to the practitioner. The doctor now knows what the conditions are, what the patient is faced with, and the chemist can inform digitally the practitioner. Mr. Tsakouras, all of that, we understand so much. It's very important for the patients. This is a new era. But here's my question to you. There are all critical entities here present. So what is the most feasible or applicable next step to be made, collaboratively speaking. It can materialize next year. The most realistic step that we can make, all of us together, is to build jointly a system that will put an end to the inequalities that have emerged. If we wish for a health system that will serve the patients and not managing expenses, then all of us have to help build a strong primary health care system and entities to that end to stop the coming and going of individual patients from primary to secondary healthcare practitioners or entities with no reason whatsoever. So let's help them not do unwanted stuff. Let's have cooperation with the pharma industry on all levels to have early access to innovative treatments, and that's where prevention has a role to play. We have to empower and enhance the role of the chemists. The Union of Patients of Greece and the primary healthcare services have to work together to manage prevention. They're very close to patients. Great, says the moderator. Just give me 1 more minute. In Greece, we've made steps, but something's still missing, meaning a steadfast strategy. We can't have changes happen all the time. We can't have fragmentation of measures. What we need is a national policy that will be a decade-long one to put in place a system that will allow for patients and pharmacy policies to be working together and not for patients to pay a lot of money. Things keep changing, but they stay the same. Mrs. Juma, you discussed the enforced role of chemists. Mr. Maliaros, through Prosifabe, you have proven that chemists are strong when they stand united. Your group was doubly awarded for corporate social responsibility and what you're doing at the level of hospitals. Given this distinction of yours, this award, how can the Greek citizens be associated directly with the Prosifabe? What are the benefits and what is the total social outcome of your group? This is an interesting question. This affords me scope to say that we're not just a warehouse of drugs and medicines. Prosifabe is so much more. At the level of cooperatives, there are certain principles, governing principles, one of which is giving back to the community. So this is part and parcel of our very nature and character. We made a strategic decision. We decided at Prosifabe not to export drugs. This is a very important policy. We are the only warehouse or drug store warehouse where we have enough drugs. Your parents, maybe you're looking for your children for something and you can't find it. We're not exporting drugs. We know it's very important to make sure that we cater to the needs of public health. That's why we're choosing to channel all our drugs to the Greek chemists and drugstores, and therefore, as a result thereof, to Greek patients. So we are committing ourselves to properly tracking, and we have our own fleet of vehicles. So we are tracking the whole chain, making sure that the right circumstances are in place in the right conditions. Now, when it comes to knowledge as such, we are systematically investing in knowledge. We believe that chemists, the more they know, the more useful they will be for the community, the whole society. That's why we have established an internal in-house academy at Prosifabe. We are thus training chemists and their staff. So we're training everyone, including the staff of the group of companies. This is something we're committed to with Mrs. Tsakura and other associations of patients. We've been working together for years now. We are supportive of their actions and activities. We have been helpful in so many things. Preventing diseases, diagnosis as well is something that we support. We have helped track and identify hundreds of diabetic patients who weren't aware they were diabetic. Along with Ms. Tsakura, we've seen people suffering from osteoporosis. Leaps and bounds have been made there. You asked me about the hospitals. The problem in hospitals, or rather the fact that we're in touch with the hospitals, gave us pleasure in the sense that we helped improve the aesthetics of hospitals. At the same point in time, we improved the psychological status of people working, patients alike. Thank you. I know we're pressed for time. Please, this is a mental takeaway. Remember, we're trying to give back to the community. A brief statement, if you may, starting with Mrs. Tsuma. We are part of the health data at AU. We have the national entity for access to data. What will the benefits be for research and medical innovation? How can you, at the same point in time, guarantee the privacy of citizens?
Starting from the second part, privacy is guaranteed irrespective of whether we are active in Greece, in Europe or elsewhere. Keeping with the provisions of storing and using personal data is very important with us, and not only as regards the data processing, but also the security of the systems, physical security, technological security, data security in a physical area, also protection from natural disasters, everything because we are responsible vis-à-vis this data. It's not only as regards privacy, but also we need to keep quality data, the proper data, safe data, but also personal data. Fine. So all this part, in all this sector, rather, we participate equally. And we are proud as a country that we are an equal participant, stakeholder at the European level. We provide, but we also receive know-how in order to safeguard all this at the European level. Mr. Boufidis, which are the most important steps for a sustainable financing system, and which are the incentives needed for research and production? Listen, the system should be the promotion of the cheapest medications for Greek patients, so that we can have space for the more expensive one. And in this system, the fact that we are a producer country, we are in advance. We have 50 production plants. And as you see, Europe is trying to stop its dependence on Asia as regards raw materials, etc. So we need to strengthen our pharma industry because our percentage is very low, 20-22%, when at the global level it is over 50%. And some of those are our own medications. And Mr. Malyaras, which is the pharmacy? What's the pharmacy of the future look like? How can the role of a pharmacist be enhanced as a health advisor? Listen, this is our plan. We are planning for the pharmacy of 2050, not 2030. If the government were making similar plans, we would have been a leader. Listen, the neighborhood pharmacy is a place for primary health care. Things have changed. With the president of the Patients Association and with all the other stakeholders, medical associations, laboratories, etc., we are planning the higher level of primary health care. And we are talking about the future of a digital pharmacy, doing away with paper, and as Ms. Zuma said. And second, which was not mentioned, it is impossible for, the pharmacist should be able to access the electronic patient's file to know the people do not know whether they have been vaccinated or not. These are things that are increasingly improving. So the pharmacist of the future is a digital pharmacist who will provide advice, prevention, care, and will contribute to the new novel and innovative medicines in collaboration with the patients, with the medical association, the hospitals. Mr. Malyaras, we saw the new landscape in the field in healthcare. We saw a data-driven system, digitalization. What will that mean for the future of medicines warehouse and a company like your cooperative? Many things are changing in the healthcare sector. The medicines are changing, the structures, state and privately owned, are changing. So I think that the most important issue is the issue of the population. Every year we lose 60,000 inhabitants, a town the size of Alexandroupolis. This is no mean problem. But in our view, this will lead the Social Security funds to great difficulty. It's a bomb for them. The pharmacist is the most accessible healthcare professional. They can be found everywhere. Both are cooperative, but also all pharmacies should be next to the patients. Now, as a medicines warehouse, what we need to do is reduce the cost and become more efficient. To this end, we have recently made the greatest investment plan in our history, based on two pillars: a full digitalization. We are installing SAP S/4HANA, and the second pillar is a hub for medications distribution in Aspropyrgos, fully automated AI system, etc., so that we can reduce cost and spend the savings for pharmacists so that they can become as useful as possible. Thank you. We wish you success. Ladies and gentlemen, we now conclude with these two sessions, and it has become clear that this country is at a crossroads. We are faced with pressures, deficits, increasing needs for the patients, but on the other hand, we see the emergence of a new architecture for medications based on research on high value-added medications and production. So the Greek medical pharma industry can be shows that they can be a pillar for safety and innovation. Thank you, Ms. Tsuma, Mr. Valtas, Boufidis, Ms. Tsekura, Mr. Malyaros. Thank you for participating, and we will now proceed to the next session and see how the NHS can deal with the needs of Greek citizens. So, Mariana Pyriotti, it is now your turn. Let's take the family picture. We should not move on without the photograph. Thank you very much.
Ladies and gentlemen, and now the tough part of the difficult issues, because you see, in reality, the AI is a fad, it's a fashion, it seems to be everywhere, and it's linked with everything. AI has very specific applications, tangible applications. It's not something that goes with everything and everywhere. And AI is anything but low cost, and it's certainly not easy or very easy to manage. And therefore, AI, along with biotech, are definitely the two pillars which, in the next few years, the next decade, will be ushering in huge changes. Also in all things hospital, but mostly with regard to those units or facilities that, in essence, are transforming the Greek NHS. There will be 2 panel discussions. We will kick off with a panel discussion in which Mr. Marios Themistokleous will take part. He's actually the rapporteur for this session. So, the first discussion will be on AI and biotech. Thanks to a very interesting panel discussion, we're going to look into innovation transforming the NHS. But until then, Mr. Themistokleous, do you want to take the floor from here? Do you want us to take 2 seats together, sit next to one another? What would work for you? Good afternoon, and thank you very much for the invitation. I will try to make a very brief statement with regard to what AI is and how it impacts on health, the health sector. Definitely AI has been talk of the town, or the flavor of recent months, but it was a bit unexpected. If you look back 5 years ago, I don't think anyone saw it coming. And now we're talking about AI and everything. And there were times in the human history where developments were really slow. But there are also times in human history when developments are really fast and everything happens within the span of one single breath. And this is one of those times. AI is here. It is here as not just a tool or a machine, but it's here mostly because it's opening up a new chapter. And the big wager is about us reading through the chapter, not just reading it, writing it ourselves. Are we going to write this chapter ourselves, or are we going to let others do the writing for us? There is a very simple or simplistic question that begs itself. Is AI going to replace health practitioners, physicians? It's quite often debated publicly. And there's this question about whether AI is going to change everything in the health sector. Let me kick off from the global arena. Let's take stock of what's happening and what we're up against now in terms of access to health. Here are the numbers, ladies and gentlemen. 4.5 billion people the world over have not sufficient access to health. Half of the Greek population, of the Earth's population, doesn't therefore have good access to health services. 4.5 billion. By 2030, the health professionals number will have shrunk by 11 million. We see it here in Greece 25 or 30 years ago. When I was still a student at school, secondary education, the traditional Greek family expected their offspring to become doctors. That's when the trend was changing in Northern Europe. The good students, or A students, wouldn't choose for medicine back then. Now it's happening here. And definitely there are other sectors that are shrinking as well. 62% of the nursing staff in the United States of America, and I'm referring to the United States because it's capitalism that governs there, the remuneration, despite the fact that the nursing staff's remuneration in the US has increased, 6 in every 10 nurses want to resign over the next 10 months. And even if they don't resign, even if 1 in every 4 resigns, and it's going to happen, it's a huge impact. And 11 million of health practitioners will be exiting the field by 2030, as I said before. And this is another statistical figure, 22%. 22% means that 1 in every 5 health systems, national health systems, that's why it's 22%. 22% of health organizations are now taking advantage of AI. What can AI do? How can it help us? And let's be practical too, because AI no matter how much it improves, it will never be empathetic. It will never have empathy, mostly, and AI will never be able to grasp the fine nuances other than the algorithms and how symptoms are expressed. That's a matter of nuances. I see medical practitioners, physicians in this room, and I guess that you understand that even formulation and context really plays a key role in how you describe your symptoms. It's a matter of pain as well. There is a different scale. Maybe that will surprise you, but then again, there's a different perception when it comes to pain up north compared to the Mediterranean. And this is not something that AI can resolve very easily. Let's look at the previous slide before we get to diagnosis, or rather, let's stick to diagnosis. At this moment, although it's not applicable in everything, we are at a point where AI is doing better compared to certain medical specialists. In the UK, 3 very experienced doctors who are the top doctors in mammograms, when they compared the results and they competed with AI, there was a lesion measuring 3 millimeters. They missed it. AI found it. So despite their background, they failed to diagnose that. So AI is not coming. It's already here. So here's the question. Is AI replacing people, or is it complementing the work of people? Clearly, it's the latter. It's complementing the work of people now. I don't know what life will be like in 15 or 20 years from now, but now still the medical practitioner, the physician, has to run the last check, the last screening, and later I will explain why it's necessary to do that. It's also a given fact that now AI is helping pick up speed in terms of diagnosing patients. There is a very significant increase in the imaging capabilities. MRI is used now 10 times more than it was used 10 years ago, and that calls for more human resources. There are not enough human resources, and at the same point in time, screening exams and tests are on the rise, so AI will fill in the gap. Patient care. Let me again take advantage of an example on top of what you're reading on this slide. A US hospital put all the cardiograms of all patients in one database, regardless of whether they were preemptive, prevention, or diagnosing ones. AI used at that hospital managed to be ahead of the patient's symptom, even without evidence or signs, 6 hours before the incident of cardiovascular patients, before they were critical. AI could tell something was coming, so the patients were taken to the OR before it was critical for them to. So this is changing the model or the paradigm and ways in which we are practicing medicine. Now, maybe you're wondering, will AI be the one that will be operating on patients? Will computers ever do that? I don't expect this to happen over the next 10 years as a speaker. Nonetheless, definitely, even surgical operations. This is the last fortress. Remember, AI is helping pathologists, it's helping architects, it's helping diagnose patients, it's helping lawyers. Now, sociologists expect that the last one to go will be surgery, even within the next 10 years or so. Apparently, surgery will change. It will overhaul itself. Assisted operations will be totally different within 10 years. And in about 20 years from now, surgical operations will have changed completely. So yes, maybe 20 years down the line, we will have operations happening without the presence of surgeons. Coming to AI in administration now, one of the big issues is, of course, red tape and bureaucracy, administrative paperwork that the practitioners have to face with. That is where AI can help. I'm again referring to US data. They have the best statistics. What about the time that doctors in the States dedicate to filling in forms and documents. They have to, so administrative staff, paperwork, that is a week per month. They waste a week per month. A month has on average 4 weeks. One medical practitioners in the States spend on paperwork of all types. Maybe it's paperwork for insurance carriers and companies, maybe it's just a registration form and data entry form. That week can be saved thanks to the use of artificial intelligence, AI. That's a week of their time. AI can do everything, what they do in a week, within half an hour, maybe 1 hour. Let me share an example from Greece. As we speak, when you have an e-prescription application running, a medical practitioner here in Greece can ask AI to summarize on the vaccines that the patient has received, the meds they're now on, and what they've taken in the past. They can do it with a voice command. In 2 or 3 minutes, AI can give them the summary, the overview, and those medical practitioners that have done it that way know that it would have instead taken 40 minutes of their time, overviewing the whole dossier of the personal file of the patient. Now, this is saving time, and medical practitioners, professional physicians and nursing staff now are free to dedicate those 40 minutes to the patients and patient care. So far, AI is an assistant. It's an ally in the effort that is being exerted. AI in discovering drugs. The first drug that was licensed by the FDA in the States is one for cystic fibrosis. Normally, it would have taken 4 to 5 years for it to be approved. Phase 1, that's research at the level of the workshops and the labs, and then next stage, that was shrunk. So 5 years were turned into 46 days instead. About 6 months ago, the first FDA-approved such drug was issued. Phase 1. Remember, it takes about 10 years for a medicinal substance to be put to the test, to be tried enough in order for it from the lab to go to the patient. So phase 1, this is how we call it, especially in clinical trials. Normally phase 1 is 5 years long, and all the way encompassing the experiments on guinea pigs and so on, and the trial tests. That was instead shrunk to 46 days thanks to the use of AI. So here we are against a new, totally new landscape in terms of research and in terms of approving drugs, that's changing the landscape for pharma industries. And this is a slide on benefits and dilemmas. Please remember what I showed you in the first slide. Remember then when I said 1 in every 2 people the world over, as we speak, has no access to real health care. So this is what AI is going to help with. Those who are not getting any health services or products will get more access. There are cities in Africa, say 5 million per city, that have one single heart doctor, one cardiologist. Can you picture that? The whole of Attica, 5 million people, just one cardiologist. In India, in the remote Indian area, they took advantage of smartphones and AI, and they rolled out a scheme, a program for reticular disease. That's a sign of diabetes. They diagnosed 70,000 patients. They checked them, they screened them within the span of 2 months without any human involvement. There was a technician who was trained. The devices, AI, was used on 70,000 people to diagnose them or screen them. So this is the first main thing, the main access changes. It's facilitated. Remember what I said, India and Africa have been helped that way, but of course that can also help when the relief is very elaborate, like in Greece, where we have lots of insular entities. So that facilitates access. I will need another 3 minutes as a speaker.
So, where do problems start, and where should we, at which point should we start a debate, both technical and political and social, regarding AI? Number 1, data security. We have found ways to safeguard data and the use, and we have some relevant experience because electronic prescription systems are being used in many countries, so there is both a social debate and an operational debate. But what becomes very important as regards AI is which data it uses, and this may depend on a decision by AI, and a mistake by AI may lead to huge social inequalities. Examples: we have trained AI and have provided it with data regarding the infractus, for instance, in men. Men have very, very specific symptoms. We have fed in to the AI male data, and AI may make huge errors in diagnosing the same condition in women. The symptoms are milder, and the accuracy of a diagnosis among females is not going to be the same. We very often hear that, for instance, you can send a picture from your mobile for a diagnosis against melanoma and other skin cancers very accurately. On a global basis, 90% of the data relate to white people. So, in this manner, the black people suffer errors by 90%. So, we say the accuracy of a diagnosis is over 99%. If a black person goes, this accuracy level is reduced by 70%, and therefore it cannot be used, and there are even greater risks elsewhere. How our own social inequalities, which already exist here, into the AI, and the error rate may not be 70%, but it may be between 3 and 5%, and sometimes it is not easy to discern. And this may cause people to suffer. This has been the case in US hospitals, where they have categories and percentage of different races, that data used by AI in hospitals make wrong diagnosis or systematically errors, because for people who are not white. And this is very important in our case as well. AI must be used, and this is a political issue. AI depends on the type of data that you feed it with. So you have to both racial, social, and people who live at low-income neighborhoods suffer different symptoms and different risks than people in high-income neighborhoods. And this is an issue also related to transparency and the responsibility mainly of the state to manage AI solutions. And I will conclude by answering the question whether AI is going to replace doctors, medical doctors. In my view, AI, or rather, medical doctors who use AI will soon replace those who do not use AI. This is going to be the model. The AI is here not as a simple equipment or tool is not an MRI, which is added to the means in our disposal. The AI, alongside the doctors, is going to change the situation in medicine, and for the next 10 or 20 years, whether it is the state or the doctors themselves or pharma industry and other businesses, whoever are able to understand that the only way is that using AI, are the only ones that will survive. Thank you very much. Thank you, Minister. So I'm sure that AI is going to help those who lag behind at this point. This country has remote medicine stations all over the country, regional offices, clinics, etc. We have the wearables as well, through which any patient who are on a small island can receive a diagnosis as if they had actually traveled to arrive in Athens and have been examined. So this is quite a different model than the one that we know. So this will reduce the inequality of access of our islands. But are the patients adapting to this model? Are the patients agreeing, or the nurses, are they accepting this knowledge, or are we on the way to accept it? We are in the stage of acceptance. One issue is the technological, to have the software and the necessary hardware, but the second part is adaptation by users and the healthcare professionals who will be using it. The model has to change. We see it also in hospitals, but also among the patients who need to trust the system. They need to know that the service provided to them is equal to them having a physical appointment. In this case, there is a doctor at the other end of the line. What is more difficult when people are talking to bots or to AI, but this is about to start happening even in Greece, and there we will see whether the people will trust the system. Mr. Breda, the WHO has a huge data volumes and a very long experience and know-how. The manner in which doctors and patients cooperate with this new digital world. What can you tell us about it? Is it different? Are there differences from one country to another, from one continent to another?
Σας ευχαριστώ.
Movement in terms of the incorporation and adoption of AI into health systems, but countries are moving at different directions. One of the things that WHO has done in Europe with the European countries, pan-European countries, because we have 57 countries, so our, let's say, office in Europe supports all the EU plus some other countries that include Ukraine, Russia, Central Asia, Israel, Turkey, many countries also outside the EU, Caucasus and all of that. So as you can see, there's really different approaches and different speeds of adopting AI. So what we believe and what countries have asked us is to support them in a way that we cannot lose sight of first thing, equity, so that AI is available for everyone, and it's not going to create even more inequalities where the rich can get it and those which are more vulnerable are even more distant from having access to these new technologies. So this is really an important issue. The other issue which is very important is on the ethics dimension and the use. So in general, if you ask me, can we trust AI? No, of course we cannot. AI can do a very good job if humans take care of it. Therefore, we really need to make sure that all the different aspects from privacy, from really avoiding bias, because the Honorable Deputy Minister pointed it very well when he mentioned the example that if the models that you use, they have bias towards certain groups in the population, of course this is creating a problem and it's creating inequality issues which are very, very important. So we need to make sure that AI is also democratized and that the data sets behind AI, that they are able to give you insights into different groups in the population. And therefore, what we have done, we set up what we call a technical advisory group. So if Greece, as we are working with the Ministry of Health, supporting them on this, but also when people want to know more and to be more informed about AI, it's important to read the different documents that WHO Europe has published recently. And we set up a group with 10 people, famous scientists globally, where they can provide advice to us on what are the next steps. In a nutshell, and as I finish, just to say we believe in AI, but we believe it's a great tool to let especially the doctors and the nurses and the health professionals use their time for what they are really necessary. So AI can actually save us from redundant tasks and things which are not...
And bureaucracy and...
so much of added value. But it needs to be done. The human factor is critically important. This is what I would like to highlight.
I've been meaning to ask you, Mrs. Koraki, about the health policy. I think we've dealt on it. So maybe, Mrs. Koraki, we should talk about the ways in which biotech and AI and this whole innovation arena is really in a position to overhaul and transform an NHS. I'm not talking about health services, the whole system in practice being transformed. Thank you. Thank you for the gracious invitation. It's an honor, says Mrs. Prigiotti. Thank you very much, Mrs. Prigiotti, and you, Mr. Hadjinikolaou, as well. We heard a lot about digital technologies and AI, and since we're talking about innovation within the context of the NHS, let me start with this. To begin with, AI and digital technologies have changed clinical research for all the reasons that were mentioned before: the planning, the design, the practice. The whole research field has been overhauled because of technologies. The AI, the automation of processes and procedures, the huge loads of data that are analyzed. These are challenges that clinical experts were faced with within the context of research. We've always wanted this to be optimized, and so AI, the use thereof, is helping that way. And as a result thereof, we are having innovation happen faster and it's safer. In order now for us to understand what the impact thereof is for the NHS, let's talk about decentralized studies. And they're happening thanks to AI applications and digital technologies. It was impossible to do that in the past, says Mrs. Prigiotti. The human element alone couldn't have given that. Yes, now they're happening. During the COVID pandemic, we had decentralized research. We were able to salvage research because back then, because of the pandemic, the patients couldn't go to the hospitals, so we did it from a distance. That's how we got to know them, and that's what we did. And there are pros, there are advantages. You see, researchers now can monitor patients in real time. There are algorithms, there are portable devices, there is technology, real time. This is analyzed in real time. And so instead of having the patient go to the hospital, now the hospital or the study and the research comes to the house of the patient without giving them a hard time. And patients don't have to go back and forth. And it was mentioned before, it's important. We have patients that live in remote areas, in villages, on the islands. We are faced with patients in Greece who can't move, and this was resolved thanks to AI. You can't just find patients, you have to facilitate them to stay on the trial, to participate without dropping out. That's been helped. Another thing, we are interested in speedily incorporating patients. What are you talking about? We want to make sure that this patient or that patient is a match for the clinical study. So AI allows us to have insights. The AI tools, we have the databases, we have the e-files, the dossiers. Now we can identify even faster the right profile, the right patient for the study. And this is very important. Quite often amongst the data, we bump into patients that are early stage, and we have preventive or preemptive studies, and they are looking at this or that med or substance early stages. This is very important, so identifying early on the patients. By way of conclusion, since we're talking about the NHS and clinical trials continue and progress, we can't put an end or stop technology, you know. Next year, we will have the biomedicine registry. It's another platform, and that will be used by hospitals next year. That's why it's very important to find digitally matured users. This will help us pick up speed and produce results faster based on the plans. So you're picking up speed, and at the same point in time, you have more credibility and reliability. Right, it's exactly like that, says Ms. Koraki. So let's talk to the pharma industry now. Mr. Kinzios. Definitely, the pharma industry is one of the entities that have benefited and reaped the benefits of new technologies, especially AI. In your opinion, sir, to what extent can patients be helped, especially chronic patients that are suffering from serious conditions and their being on the right drugs is critical?
Yes, you're absolutely right, Ms. Piriotti. But I don't know whether we are just benefiting, or we also bear more of the responsibility, because having more tools at your disposal, you have to speed up and reach the desired result. Anyway, AI in our industry is just the tip of an iceberg. It has been widely discussed recently, also because of its nature. There are strong reactions, and there is fiction surrounding it. But this tool has not appeared all of a sudden. Pharma industry is one of the few industries that has been using all the tools that offered by this recent industrial revolution, all this great change that was brought about in the physical world, data that can be captured by machines, machine learning algorithms, and with the results sent to the physical world. This is a huge revolution that helps advance this world. Of course, the huge wave of digitalization that has emerged in the past 20 years has really helped. So many applications have been used by the pharma industry, and AI is the most recent addition. So we have seen many improvements in the traditional value chain of the pharma industry. We can go back to that. It's not very appealing to this audience, but what is actually appealing is the way that things change as regards treatments of patients. You mentioned clinical studies. These clinical studies are the last part, the last step of this journey. Looking at the research and development of a new molecule is that we need to seek target molecules in a manual method until now. Now with AI, within fractions of a second, you know which possible molecule could be useful for a specific target. Then you have optimization. Many tests are required to make sure that the specific molecule has the necessary properties to become a medication. Then we have the preclinical studies, research, and being able to create models about the expected results. We can reduce by a lot the number of animals that have to be sacrificed. This is huge, but in the near future we can see a situation go a step further when we will be able to trust, to validate to an adequate extent models that can foresee the relationship between the pharmacodynamic model with the result, and therefore I will not need to expect a huge sample, so we can reduce the number of patients participating in clinical studies, lower cost, lower time, more innovation, and this of course goes along with real world data, which means that by being able to monitor patients in the real world, we learn more about the clinical results of the medication, of the medicine. So pretty soon we can have much smaller clinical studies. Mr. Breda, my question to you would be, according to your estimates, in an NHS, system, which is the access that is going to benefit faster and more effectively by the use of AI, but also of biotechnology? Is it the hospital care part? Is it the process of making a diagnosis, or is it the part relating to serious diseases which are long-standing and which limit the activities of a big part of the population? Will it be related to hospitals or to people who do not need treatment in hospital?
But I mean, when we think about AI, we're not talking about one area of development. We talk about very different things. So you can actually anticipate that, okay, we're going to have tools that will improve diagnosis. We're going to have tools that will improve and fine-tune triage, waiting times. These are basic things that we are already happening. And by the way, congratulations to Greece, which is taking steps in this direction before other countries in Europe. So I think really on the way. But it could also look into things which are predictions. So you can predict with more efficacy and with more certainty. For example, when you use the data that you have, I mean, there's a huge array of things where you can use, and you can certainly work a lot around training of health professionals and capacity building. So I think that the ideal situation is where all of this works like in an orchestra, that everyone plays well its instruments, and we make use of all these tools, as I said, with human control, human always in charge. And there is a risk that we will not be in charge one day, right? So we have really to control all these types of AI because they are so different, completely different, that we cannot generalize. We cannot speak let's say, with big generalizations. You need to go into LLM is one thing, but there's many other things that also are available for AI in the health systems, medicine development, and all of that. So this is really important if we use it for the right thing. And the right thing is really taking care of those who have more difficulties in access, taking care that we improve quality, and taking care that everyone has, this is available for all. Otherwise, it's a failure of humanity in a way. So we really need to use AI in the health system to make the system better. Of course, people can evolve and profit and innovate, and all of that is important, but ultimately, to make sure that we all benefit from that. If this is going to be only for a few, this is going to be a big problem. And this is something that WHO also always highlights, is that we really need to take into account this issue of making sure that we don't create more inequalities rather than leapfrogging and bringing people more together. Thank you.
Σας ευχαριστώ.
A first question and a first reply, Ms. Koraki, and then Mr. Kinzius. Can you foresee or try to predict what the evolution will be given the situation now? Where is AI and biotech going? Where are we headed to? How far can we go? In a nutshell, the patient will win. Because biotech and clinical studies, they are complicated, they're elaborate, they're anything but easy. AI, digital technologies are providing us with tools that can help us resolve the problems that were there. Now, science is becoming more customized, more focused to the individual and the special features. So we're going to have new drugs, more specific. Over the next 10 years, we're going to reap great benefits for the patients. Now we are faced with rare rare diseases. There are many special categories. There is the geriatric population. Now, given that biotech, technology in general, digital and AI can help us maximize the benefits, and that will give us innovative drugs, better drugs, and that will be better for patients. They're right. Mr. Kinzios, you are the pharma rep. You, as a group of companies, the CETIS companies, you are in touch with startup companies, researchers, academia, various institutions. The question is the same. What about 10 years from now? Treatment is headed in a specific direction. New treatments, nucleotides, we are focused on such. Peptides, monoclonal antibodies, they're already there. Cell therapies or cellular, and then gene therapies. All of that is quite clear. That's where we're headed to. It's a matter of speed, the speed in which, as Ms. Koraki said, these are going to penetrate the market, and it's also going to improve the daily lives of patients. Let me go back to what I said before. I don't think I dwelled on it enough. A lot of effort is invested in developing sensors and smart devices, smart sensors. And this is a step even better compared to what Mr. Baldas said, when you remind patients to take the right dosage. I have two examples, one of which is pertinent to treatments. In many cases, a treating physician doesn't really know which dosage to start with and how to continue. Maybe the nature of the treatment calls for constant adjustments and changes to dosage. So the devices, the smart devices, or quite often these are subcutaneously administered drugs. We have specific devices, type 1, and in the case of these devices, we don't have a lot of automation. So in the future, we expect things to be automated that way. Devices will be more automatic. They will be easy to use for the patients. They will inject themselves, and it will be easy to track down how this is working. The data will be collected. The treating physician will receive the data, and that will help us be smarter. So you have to keep discussing with the treating physician. The attending physician has to keep track of the various insights, including data and biometrics. These are many important variables, and that's what is going to help customize treatment. That's where we're headed to. This is real customization and individual treatments. Obviously, customization is also pertinent to automated. Now, slow metabolizers, we were talking about it. Fast and slow metabolizers. Now, real customization, that's what's happening now. And let me briefly refer to something more direct. We have inhalers. Have you ever used an inhaler because you're getting no? So far I have escaped that, but who knows? Hopefully you'll never have to use it. But then again, many fellow human beings are using inhalers as we speak. And this is improving. It's easy to use them. But you have to train yourself when you begin with that. And there are steps. If, for instance, you don't take the right volume and then exhale properly, because things stay in the lungs, then the medicinal stuff will never get to where it's supposed to go. This is very simple. It's a simple remark. This is how you should kick off with the treatment. Maybe the doctor will say that again and again. The chemist will say it, but then the user will tend to forget. So smart devices can help in that direction as well. They have reminders. They check on the compliance of the patient. They share the right insights and data with the doctors, and they help improve the treatment and the outcome thereof. So this is revolutionizing the daily lives and the use. Minister, let's conclude with you. When did you join the NHS? 20 years ago? 23 years ago. 23 years ago, says Ms. Pirioti. Back then, 23 years ago, if someone had said, well, you're a neurosurgeon, if someone had told you then that by the year 2025, the NHS of Greece would be like this, but not because of what you learned no longer applies, but because you see times are changing. There's this amazing progress of technology that is progressing next to the medicine, science of medicine. Huge changes are happening. Could you have fathomed that? Could you have pictured that? And if you couldn't back then, can you now picture the future?
even 5 years ago, had this question been asked, we wouldn't have been able to predict that we would be discussing what we are now discussing. In the last 15 years, a huge leap has been made by technology, and talking about a leap, this means thousands of lives. This concerning neurosurgery. In the past, people were suffering from huge disabilities, and doctors have been given fantastic means for our work. But even 5 years ago, I wouldn't have been able to predict. There are some developments in neurosurgery, which is my specialty, which are they are assisted. Practically, the computer works on its own, and the situation is going to change radically very shortly. And the change in the situation is brings about great benefits to the patients. I have experienced this in our own sector, this transition, and it is impressive. 15 years later, people who we thought were lost have changed their condition. So, Minister, my lady, gentlemen, thank you very much for participating in this panel. We will take our picture, our family picture, and please let the next panel get ready to discuss AI at the first line, from hospitals to clinics and to the rehabilitation centers. I would therefore like to ask the Biotechnology CEO, Mr. Nicholas Marathias, Ms. Argyri Vagiona, who is the chairman and CEO of Anagenesis, which is a rehabilitation center from Thessaloniki, Mr. Theodoros Hamakiotis, Director General of the Athens Medical Center, and Emilios Vouglioukakis, who is the President and Governor of the Asklepion, which everyone knows. This is a big hospital in Voula. And let's move on to the private clinics and see how the use of AI, the implementation of the miracle that we have experienced in the past 20 years. It is very important. And what is also important is that we have with us two leaders of two hospitals, a private one and a state one. In the past, the perception was that only private hospitals were equipped with the state-of-the-art technology, and on the other hand, only in state hospitals we had the kind of doctors who would be able to deal with some difficult cases because they see so many people. Things have drastically changed. Also, the private clinics, the private centers, test centers, private clinics would never have been able to be so effective because of AI and digitalization. So let me start by Mr. Marathias, who, as I said, is the Chief Operating Officer of the Bioiatρική Group. Let us listen to you, what you use, which are the technologies that you are using, and what is the AI going to contribute to this innovation. Good afternoon. Thank you very much for inviting me. I would like to start from a different point of view. The last part of what Mr. Themistokleous mentioned. He mentioned lack of human contact as a result of the introduction of AI. We want to increase the participation and the of the doctors in order to increase human contact. Can you increase it? Listen, as the use of these tools by doctors is going to increase, I believe that they are certainly going to focus on patients and human contact. Now, as regards the everyday work of private clinics, we deal with everyday diagnosis, starting from imaging, mammography, MRI, or other types of imaging. But we are also adopting much more specific practices. For instance, the pathology lab, which was not attractive at all for medical practitioners, but this is going to change radically, and I'm not going to go into the details of the everyday operation of our clinics, but we have already started to adopt practices in this direction. You rightly mentioned that there is some sort of mistrust, especially vis-à-vis the AI, not the other innovative technologies that have already been adopted and are very effective. But as regards AI, some people have skepticism, and they also have to deal with this fantastic phenomenon. Patients who say, I did a Google search and I learned this, that, and the other, and the doctors don't like it, and very rightly so. Yes, there is a resistance, just like the resistance vis-à-vis anything innovation. Yes, but I looked it up with ChatGPT. Well, what can a doctor say? In our sector, we want to have the doctor at the center of any decision. Everything comes from the medical practitioners who work for us. Yes, we have to start using explainable AI, as is the case abroad. Many people, for instance, are familiar what is happening in Israel. Everything that happens as regarding the AI tools, algorithms, is communicated to the medical community. Ms. Vaiona, the rehabilitation centers were late to arrive in Greece. I remember before you, and there was a need. Now these centers are here with a great delay, I believe, but they come dynamically, and the technology helps with better equipment, but also the way that all these new equipment is going to be used on a personalized basis, I would say, if I'm not mistaken. Yes, you are right. We do not provide medication, just one allantoid toxin, but we haven't been using it for 18 years. We have been using biotechnology as part of our lives, part of the treatments we provide. Our next objective is to implement AI protocols where we are going to which we're going to feed our own data and to use the necessary parameters to prevent any side effects and to improve the rehabilitation treatment. Yes, of course. The fewer the side effects, the better and the faster the final result. We can also start remote monitoring of patients, people who were tired to be hospitalized. All the others are tools, and we want to use them based on our own vision. Yes, I really sympathize with what you said. There are people who are in a rehabilitation process, a long-term rehabilitation process. If they are able to undergo this remotely, this is a relief and also less costly. And of course for all, and better advertising for us, because we can achieve good results sooner. Because this is what we can advert on the basis, what is the basis of our advertisement, that people who have come to us have recovered. Gentlemen, 2 hospitals, starting from you, Mr. Kapodistrian, your own participation, because with hospitals which, as regards the infrastructure, the so-called the hotelier, what you have to offer as hotels, the medical center, your hospital, is an advanced one. Now, the implemented AI in an already advanced hospital, what can it offer? What can it contribute? The same as in other hospitals? Good afternoon. Congratulations for this conference which you organize. And I should also like to congratulate the Deputy Minister for what he has just said personally, but I think generally when the Deputy Minister makes such a well-documented explanation of the present and the future, yes, this makes us all feel safer. Yes, and he's the only one who has remained as a pillar in the management of Ministry of Health. Yes, in the governance of the state, this is one of the secrets. So, coming to your question, yes, our hospital is exactly as you describe it. It is a pioneer in state-of-the-art technology, and of course we have integrated AI in our work. All these state-of-the-art robotic systems which we have, up until a few years ago, we were relying on the fantastic developments of medical technology. But AI now is helping us advance not by one step, but by 10 or even more steps. In the immediate future, I expect that we will benefit as regards the rapidity of decision-making. There have been studies in Europe and globally where the emergency care doctors are unable to identify errors at a rate of 10, even 15%. It's a quite big rate, but of course they are not gods, they are doctors. And this also happens in state-owned hospitals because of the volume of patients. Yes, the emergencies that arrive at a private hospital are much fewer than the ones that arrive at a state hospital. So, AI has direct implementation in imaging technology, mammographies, MRIs, etc. In our hospital, we are already using AI. All X-rays go through AI. You are already using it. Yes, that is correct. We have reached that level. So have you seen a difference, or have the doctors seen any difference? The big difference is with the speed. And as you heard earlier, even from the Prime Minister, that the health professionals are among the professionals who suffer from burnout among the highest rates of burnout. I believe that AI will be very helpful to reduce the workload of doctors and nurses. We have set up an AI group in our group of companies in order to properly implement this technology. And the next step for us is the flow of the provision of health services to our patients. I believe that we can reduce the steps as well as the cost to the hospital. So we have risk-free economies of scale without diminishing the quality or the safety of this service provided. Mr. Vouglakis, you are quite the opposite. You have taken the well-known hospital, Asclepion, and you have taken it to the new age. We have new equipment, but there's also things that have to be done.
It's exactly like that. A few years ago, having the governor or the representative of a big public sector hospital in the presence of private sector leaders, having a panel discussion encompassing everyone. After all, the NHS public and everybody is a part of it. Regardless of whether we're talking about public or state, health is a public good. So here you have brand names from the private sector and leaders. Maybe in the old days, a representative of a public entity would feel a bit embarrassed or uncomfortable, and maybe they would feel like they're lagging behind. They would suffer from a complex of inferiority, but it's not like that. In recent years, things have changed. And starting with Asclepion, let me generalize. This is a huge success for Greece. The fact that we're talking about AI. Most hospitals are in the antechamber of AI. This is a success because, on the one hand, we are one of the first countries, or the first wave of European countries that were going to use AI. We have the São Paulo Hospital in Barcelona, the Universitat de Dex. These are some hospitals in Barcelona, in Sweden, in Hong Kong, so there's just a handful, no more than that. And given that, we are here in Greece discussing the fact that we have hospitals that have been digitalized. We were lagging behind. It was a fact. Let me share an example and take half a minute of your time. When I was appointed, and it was an honor, digitally speaking, the Asclepion at Voula had one server that was actually elsewhere at the Soteria Hospital. I was not in charge of it. The hospital was not. Why is that? Because it was the Society of Information byproduct. It was made back in 2012. It was established in 2015. Back then, the Asclepio was in a different region. Then things changed. It was moved to a different health sector region. And again, we were not the proprietors of the server. And we needed to have consensus. And in order for me to appeal to my legal capacity, I had to be assertive or use legal remedies against Soteria Hospital to have access to my server. There were a couple of digital systems there, but they were not interoperable. One system was about finances. The other involved meds and services. In terms of cybersecurity, it didn't even exist as a notion. Let's not discuss cybersecurity in health now, okay? Well, what I'm trying to say is that now we have Greek hospitals that are interoperable through IDICA. They're in a position to issue e-invoices. They're all interconnected with the system, so the mobile devices can be used by the users to book appointments. Everybody is exchanging data at the level of the ORs. So yes, this is a digital revolution, and now we are talking about using AI at hospitals. Can you picture this? Within the span of 2 and 3 years, we made leaps and bounds. in terms of the Greek health sector with regard to the public hospitals. And here we are today. We are equal partners competing nobly and fairly. Do you have the equipment and the know-how? I'm talking about Asklepion, your hospital. This is a hospital which is not the top hospital, but it is transitioning, has been for some years. So do you have the resources, the human resources, the equipment, the machinery, and the technical expertise to proceed with this transition? I'm talking about AI, the AI landscape in which we live. As the Deputy Minister said, and he was to the point, we shouldn't be fearful of changes and challenges and difficulties. We shouldn't be afraid of them. They go hand in hand with changes, and you identify them when this is happening. It's not something you should just dwell on theoretically. And for years now, it was just in theory, a whole discussion, a long discussion. We are currently living in the era of leaps and bounds, and there's also constant and continuous education and training for us to be in line with the current reality. Do you have the right material, the right infrastructure? Well, as concerns infrastructure, to a great extent, we have modernized it. Electrical equipment, devices, technical devices, we have upgraded them, and now we can accommodate it, advanced digital programs. And there are advantages to them. Many of the previous speakers were quite eloquent. I'm not going to agree or disagree with the Deputy Minister. I think it goes without saying that we agree. But especially when it comes to running a hospital, fast decision-making matters, and this is going to the NHS is effective. It will make it efficient, saving time. That's one thing, and better management of beds. Of course, this is critical to public hospitals. We're under pressure. We cater to the need of 23.8% more patients compared to what we used to do, and we have at half the time. By using the right software and AI, we can improve the data and be more accurate in terms of discharging patients and rationally using the beds. Mrs. Vaiona, when it comes to rehabilitation, I will insist on it yet again, and I will reiterate that because it must be heard. Rehab centers in Greece were considerably lagging behind on all levels. And of course, the NHS didn't allow for any big breaks. So it's very important now to prioritize rehabilitation, while at the same time it's important to acknowledge there are new rehab centers. Mostly, though, the existing ones are working. They're up and running. People my age, my experience, I've seen it, been there. I know friends of mine who couldn't find a place. They had to pay huge amounts of money. They were not covered. There was no bed. They couldn't go to the rehab center, physical rehabilitation. Your role is huge, and more people are currently in need of, mostly after suffering an accident or maybe a small stroke or some disease that leaves a certain problem behind. So it's very important for you to be there. So here's my question. Given that we will be faced with an ever-increasing number of people who will need your services, and also given that the new technologies, we described them before, so new technologies will most probably be really helpful, even more helpful to your work now. So how exactly do you picture the next decade for your particular field? To begin with, hopefully we will be able to fund and finance such technologies and the use thereof. Let's start from there, because these services and technologies are quite costly, and I'm not just talking about costly machinery, but it's also a matter of properly training and educating the personnel. It's needed, and it's also a matter of maintenance. The cost is sky high. What I see, well, I'm not even looking at the span of a decade. This is December 2025. As of March this year, there's a European directive, the Health Data System, European Health Data System. It says that by the year 2029, the EU member states must be all aligned to make sure that they start entering into the systems things and data that are pertinent to admissions and discharge notes and licenses and receipts and also prescriptions. By 2031, we have to harmonize everything, all other types of data contained in a medical file and dossiers. This to me signifies that it was necessary even yesterday to have a national strategy in place to cover everyone. A national strategy that will discuss the primary health care and services, diagnostic tests, lab tests, third degree, and then rehabilitation. Because we're aging, the population is aging, and of course there's damage and problems. The human body is breaking. I mean, we live longer, we don't die young, and so in the meantime we need support throughout. And therefore, we have to be ahead of developments, and developments tend to crop up really fast. As we speak, I can't really imagine where AI will get or how far it will go in terms of our services. And 10 years ago, I couldn't imagine there would be exoskeletons that would allow patients to walk. Right. Mr. Marathias, by way of conclusion, the Prime Minister referred to it. He heavily emphasized on all prevention programs and schemes. So, lab tests and results, going to diagnostic centers. What's your take? After all, there is an ever-increasing number of people who are taking tests preventively. What's your strategy vis-à-vis this challenge? 4 million people have already been examined or screened. What's your strategy? To begin with, Mrs. Agapidaki just ended, so we have to commend and congratulate her. Oh, right on time, Mrs. Agapidaki. We were talking about prevention. You're right on time. There you go. And let's also commend and congratulate the whole of the political leadership and administration of the Ministry of Health for exceptional work. Screening the population and the whole effort to change the mentality of people, a mentality shift is very important. It's true, all of us now are taking more screening tests and exams because now we don't want to get sick or ill. We actually want us to be in shipshape. And allow me to say this, AI can make a real difference in terms of prevention. The Deputy Minister said before that in certain regions and areas already they were using wearables. And so if some of your vital signs are no longer normal, there is the option of telemedicine. So in the next few years, or maybe the next 18 to 24 months, I would like to see, even in Greece, the models that big insurance carriers are using abroad. They are using wearables, they are tracking down the vital signs, and maybe that can help subsidize the good health of patients, and that can help certain premium or commissions, insurance premium drop. So this can be really helpful to the NHS and the health systems. We're running really late, you know that. It happens, always happens in every single conference. Let me thank you, all of you, for this exceptional discussion, and let me now hand the baton over to Emilia Stathakou, who is in charge of oloigia.gr. She's also working for the health section of Real News. She will be really fast in the crossfire discussion that will happen between Mrs. Korak and Mrs. Vilderidi. It's not crossfire, it's real discussion, right? All right, thank you.
So, yes, we are in difficult times as regards the strengthening of NHS, and now we are moving on to something which is of critical importance, clinical studies, which helps health and the economy and can be a growth generator. Clinical research is one of the most dynamic parts of to the healthcare sector and the economy. It helps knowledge of the medical community, creates important value added also for the national economy. Greece is faced with a big challenge and opportunity to cover its delays, to stabilize its framework and to become a European destination on the clinical trials map. So to this will help me with my discussion with two ladies who are at the forefront of these developments. Lilian Venitia Vildiridi, who is the Secretary General of Health Services, and the President of Hellen Association of CROs, HACRO, the President and Managing Director of Coronis Research, Ms. Evangelia Koraki. Thank you very much for being with us. So, Ms. Vildiridi, can we start this discussion by describing the status quo? What is the number of clinical trials taking place in this country? Which are the recent trends, and where is Greece in comparison to other EU states? It's open, it's on. Yes, thank you very much for this, for honoring me with an invitation and the opportunity to discuss the changes in our field for the second year in a row. During this past year, let us point out that this country has completed its full transition into the European framework, so full harmonization with the EU regulations. There was a turning point during 2025, which is a result of the transition, and the trend during 2025 is upward. In November 2025, we had 260 new requests for clinical trials when we had only 217 throughout 2024. So before even the year has the year end, this number is higher. This is a change that is a result of the existing framework. It is positive, and no complacency is permitted. We have, as a working group, fully mapped the weak points of clinical trials in this country, and we are trying to deal with them. As regards our position in general, we get useful data from a report that gives our country the 11th place among all the member states. This is not fantastic, but it's satisfactory, and our efforts are to improve our results. Ms. Koraki, based on this picture, do you believe that the current data is satisfactory, and what does this private sector expect from the state in order to improve the investments and to upgrade the clinical potential of this country? Hello. So, in order to understand our position, we need to understand the global environment. Europe, US, and China, who were the leaders in clinical trials, we see Europe is losing its position. China is a dynamic new player. Europe has been weakened. They tried with a new regulation to acquire this position. These things did not go well, but in this negative picture situation in Europe, Greece is doing well. And this is not what we say ourselves, but there are studies that say there are 3 European countries that are resisting the comparative fall of Europe, and one of them is Greece. And this is not by chance. We have very good researchers, we have advantages, we have a competitive cost for these trials, but there are also weaknesses. These weaknesses have been identified by the ministry since some time, and there is a will to deal with them. This committee in the ministry, coordinated by Ms. Vildiridi, is very important because the aim is to to map the system, to provide new proposals and get best practices from other countries. So we are in a good way. We are in the middle, and it is not. It is an honor to be in the middle because countries such as Belgium, with a culture of a long-standing culture of clinical trials, are 7th. So we have room for improvement. There is no question. How do you explain this improvement of all the indicators, and which is the plan that the ministry has to further improve and speed up clinical trials in the coming years? Just as Ms. Koraki said, since 2019, a huge effort is underway so that we can map and register the weaknesses in the field of clinical trials because of red tape, delays, lack of incentives, and because of the adequate participation of patients. So we have registered all that, and for the first time we are trying to create a consistent framework for clinical trials in Greece. I will briefly mention what we did since 2019, the investment program mentioned by the minister, which is a lever for a reassessment. Yes, we're going to discuss this later on. Incentives were provided to the health centers and hospitals. The income from clinical trials can be reinvested in equipment and infrastructure. We have included the assistant doctors and the doctors training specialists to participate. And this is not part of their remuneration. Their participation is not included in their remuneration. So we have a joint ministerial decision which provides for faster processes and doing away with the hurdles. For instance, the most important is that the file is submitted in parallel both to the specialized committee and to EOF and at the trial center. So the checks take place in parallel and we avoid delays. What is also very important is that the time schedules are much stricter as regards each stage. And finally, we have model contracts per category of trials and this facility. This means that we save 3 to 4 weeks because the hospital administration needed to decide. We have the register for research and technology, which will be completed in 2026 and which will register the cycle of each clinical trial from the inception to the conclusion, and this will be in a point of reference for all the stakeholders, patients, hospitals, sponsors, everybody. And finally, the next task of this working group is already underway, is the implementation of the joint ministerial decision which sets the limits, conditions and prerequisites on clinical trials on humans, where we are discussing both the extension and broadening of the centers. For instance, day clinics can also participate, and the dental schools as regards their field. And as Ms. Koraki said earlier, what's very important is the widening of clinical trials so as to be able to execute part of this at home, of course, by safeguarding that all the necessary preconditions are in place. There are some linguistic facilities, so part of the documents which are required can be submitted in English, which is also deemed to be a cause for delays, and the use of digital tools so as to inform the participants, and the participants' consent can be done more easily and faster. So this is a new framework, a new network that provides changes and possibilities. Ms. Koraki, how about this joint ministerial decision? Which are the new things that it's going to bring about, and how are these going to make the system speedier and more effective?
Ever since we started working with this team, with this group, it was obvious that red tape was a problem because it impedes speed, and speed is needed for investors to come, for clinical studies to materialize. That was one thing. A second thing is that a clinical trial is tough. It's highly regulated, it's strict, so you have to have timely and topical legislation that must be in the right direction with a view to resolving problems, and it certainly needs to be in compliance with the European legislation and directives. Mrs. Velderidi was to the point. Everything that's happening is resolving issues, unified process procedures, joint and shared documents. We have the same, they're unified. We have model contracts. We no longer have to discuss forever and ever these documents. We have the digitalized e-signatures. This is a revolution in terms of the electronic signature. This is revolutionizing things because we knew the problem was not the approvals. The approvals are now off. The Greek NDA is interconnected with Europe, but the thing was always the glitch at the level of the hospital. The hospital had to sign off to the deal, the agreement, so it's very important, the contract. And like I said before, the legislative framework keeps changing or kept changing. Now, as Ms. Velderidi said, there is the consultation taking place on the next legislation. Everything is in the direction of resolving problems, being informed all the time, updated, and while putting in place a legislative and institutional framework which is steadfast and it's the right one, and it helps pick up speed for us to appeal. These are huge changes, and this is very innovative, but I can't help but worry about possibly glitching or bumping into simple stuff. Mrs. Velderidi, public hospitals are a critical link in the chain. Can they be up to par? Do they have the right human resources, the right infrastructure? Do they also have in place the right processes and procedures for them to be supportive of competitive clinical trials? Your remark is to the point. I think that we have made important steps in this direction. Let's start with the independent clinical trial centers at the hospitals. By virtue of a decision made by Mr. Themistokleous, the preconditions for them to work were determined. They're already happening at Hyatt in Thessaloniki, at the University Hospital of Alexandroupoli, at Attikon Hospital here in Athens. We have such clinical trial centers, so there are terms and conditions for funding, financing, and hiring the right people. Yes, everything is in the legislative framework, and those that are up and running are fully manned. Mr. Themistoclou is smiling, so I guess he's committed to that. All three of them are working, and already we are working with a view to establishing such trial centers at Papanikolaou, Thessaloniki, Papageorgiou, at Ioannina, the University Hospital, and Patras as well, the General Hospital of Patras, Agios Andreas, and the University Hospital of Heraklion. You must be commended and congratulated, because I remember that there was talk in previous years and nothing happened, so I'm very happy. Various efforts had begun for new departments to be up and running, and they never materialized. So if you manage to get some to work already, I think we're on the right path, we're on track. Yes, and most importantly, they are a point of reference now for everyone involved, the stakeholders, the EOF, the Greek FDA, excuse me. So the patients are therefore being helped. This is helping us pick up speed, and for the first time there are very clear tasks, specific tasks that must happen. And it's also important, and we don't forget, we have to highlight the fact that clinical trials, appealing to such trials, is not just about legislation or organizing properly and setting up the hospitals, but you see it's a general investment that has to happen horizontally in the system. You refurbish and renovate the hospital, you update the equipment, you help the human resources, and you appoint human resources wherever there's need. Wherever there's need, there's the right people and there's organization and setup, and all of that creates the proper landscape or a climate which increases and enhances the competitiveness of our country. Already, we have tough players, strong players. We are not competing just against ourselves and trying to get from the 14th position to the 7th position. We are competing with all of Europe. Mrs. Koraki, a comment. The clinical trial offices and the biomedicinal research registry, do you believe that speed will accelerate in practice? You know what, those two were designed and decided upon after we understood the problems, and they were the responses to the problems. They were a way to resolve this. There are specificities in some hospitals. When we grouped up the various issues, be it delays, we realized that only having an office within the confines of the hospitals would help us pick up speed. So the people in the hospital at the spot could resolve the problems, because the clinical trials office is of course institutionalized. Now, technically speaking, we know what the job descriptions are, but now with the joint ministerial decision, it has a role. Within the context of the new joint ministerial decision, there's mention of the fact that the file must go to the office must need to do this and that, so it's becoming a very strong player. It's a contact point for the hospital. It's going to play a key role. It's going to resolve all those issues that we have turned into rules, and they will be enforced at the level of each and every hospital. The registry, is a platform for our trials in Greece to be entered electronically, because back in 2016, when there was a European directive, the EU decided they would create an ITS system, but within a reasonable amount of time, each and every member state had to create its own electronic system for us to have an interconnection. It doesn't suffice to get approvals at the EU level for the clinical trials. We have to make sure that we can track them down nationally. So the registry is very, very important, and we're looking forward to having it happen within the year 2026. And then again, the clinical trials office again is going to be a very important stakeholder, a player who will have access. So all these were proposals and designed in a way to produce results, because like you said before, if Europe has 55 billion that was given last year in 2024, if we don't take what we ought to, then someone else will take it. So we have to make proper plans, the right plans, and indeed things are happening. A lot of things have been done. Maybe it sounds like it's titles or brief things, but there are things that are happening and more will happen. Would you like to add something? I think it's important to add something. The hospitals, which comply with the necessary standards to have these clinical trial offices. For those of you who don't know, these must be hospitals with more than 200 beds, and during the last years they have to have run or rolled out a few studies, 30 for that matter. So we keep in track of that, but the most important thing is the evaluation of the administrations that have independent clinical trial centers. They will be evaluated because there is the relevant evaluation framework to see at the end of the year whether they complied with the instructions they received and to what extent, if at all, they have supervised the operations of the clinical trials office in line with the relevant ministerial decision. Mrs. Veloudidis, we have another important issue. It's the so-called investment clawback. The way it's enforced today, it doesn't look like it's a real incentive for beefing up clinical trials because most of the resources go to productive expenses. Do you expect to make corrective steps or maybe intervene? The Minister, Mr. Kyriakos, mentioned that this is something that's going to expand and deepen and is going to be integrated within the national framework. The terms and conditions will be announced by the Minister, and I believe the terms and conditions will be discussed with interested parties and the stakeholders, and we look forward to the impact thereof. Mrs. Goraki, far and above the existing measures, which recent or right incentives could we put in place to make Greece even more appealing as a destination for clinical trial sponsors? And the financial incentives are very important if you want to appeal to such a market. The first thing, and I'm repeating that, is to make amends for the ways in which the clawback, the investment clawback is enforced in terms of clinical trials. We want to have plants and factories and people and jobs and people being hired, but we definitely want to have investment clawback, R&D clawback, and we want to encourage the companies to conduct clinical studies and surveys and trials in Greece. We as CROs who represent various customers and clients, we don't work with pharma companies and sponsors in Greece who are helped by the investment clawback measures or the taxation provisions. We have many sponsors from abroad, and therefore we have to find incentives for those. Maybe it's pharma companies or institutions from abroad, academia and universities that are conducting clinical trials, and they still encompass Greek centers. So we have to find incentives for them as well. Another very important issue, Mr. Koraki, is the participation of patients. This is a fundamental criterion for a country to be selected. Since the public, generally speaking, is not well informed, what about the Clinical Trials Alliance? How can it help enhance and strengthen the knowledge? Thank you so much for asking me about the alliance, because I have to say that the alliance as such started 2 years ago at a conference of the Association of Greek Patients. That's where the patients expressed their concerns and worries about the fact that there are bias, prejudices and lack of information. Ms. Veloudidis was there. She sort of challenged them to think, and she said she would be there, the ministry would be there in order to do something to inform the public duly. That was a great opportunity. The Union of Association of Patients of Greece, along with Agro and the Medical Association of Athens, they created the alliance, as it's called. The purpose of the alliance is to reach out to those citizens, to inform them, to encourage trust vis-a-vis clinical trials, and that trust will be nurtured through proper information dissemination, and to do away with bias about guinea pigs and stuff like there was in the past. It's a matter of trust and confidence. To have clinical trials, we have to find the patients and we have to retain the patients, so hold on to them. Without them, we can't have clinical trials. So it's very important for the people to know, and through this knowledge, to show trust, reliability, which is necessary for people to take part in trials. This is a precondition. A precondition is to be able to cover them or cater to them, because if you tell people and you can't afford them scope to take part in that, there will be demand, Mrs. Veloudidis, and then the system will have to do something about it. Maybe patients will show up, they've heard about this and that medication, but you can't incorporate them. I believe that Mr. Kyriakos, the Minister of Health, also said that the patients, meaning average citizens, could use My Health Hub to declare their interest and be part of clinical trials. It's exactly what I said before. This is a new framework, says Mrs. Veloudidis. We are currently updating it, and that encompasses new digital tools to properly inform the new participants and also ensure there's consensus. So we're evaluating all of that now. And by way of conclusion, within the next 3 years, where would you like to see Greece in the clinical trial field? What's your personal vision? I'd like Greece to be a reliable and competitive hub within the wider ecosystem of clinical trials. I'd like Greece to have taken advantage of its edges, which are the following: very high-level scientific staff and scholars, specialized staff, infrastructure that keeps updated and improved, and definitely I think we talk about the real value of clinical trials. It's not a matter of figures and having more, but it's a matter of outcomes and how that produces outcomes to benefit the patients as such. By way of conclusion, I'd say that we have a great window of opportunity currently, and there are multiplying effects that will primarily help patients, the economy, and the society. And our vision is to take advantage of it as much as we can. Mrs. Bellideridi, what you just described, I think, is pertinent to the very core of the efforts that are exerted now. Mrs. Koraki, I guess your side would agree. You share the same ambitions. You want to have more clinical trials to make real progress. I hope this joint effort bears fruit to benefit the scientific community and patients. In the reverse order, Mrs. Bellideridi, Mrs. Koraki, thank you very much for your interventions. Thank you for the real debate we've had. Ladies and gentlemen, we are not going to have a break now. We'll have a break later. So let's proceed duly with the next discussion. Mr. Breda, would you like to join me on stage? You have a presentation, sir, and then we're going to have the comments because the Deputy Minister, Mrs. Abidaki, and Mrs. Xenogiannakopoulou, because you're running late, have been waiting. So, Mr. Breda, let's have your presentation, and then we're going to have the two ladies and the ensuing discussion. Mrs. Ageletou will be acting as moderator.
Upon the most important aspects that we believe need to be considered. We were asked to talk about artificial intelligence and innovation, tool to transform health systems. We do this in the context of a recently adopted new public health policy for the WHO European region with 5 mega trends, so to say, and 5 major aspects. I will not go into detail, but covering from the health security aspects to the aspects related with main drivers for health and non-communicable diseases, aging, really, and the importance of climate change and health and really the use of technology. These are the mega trends which are included in this new policy, which you can consult on our website, and it's called EPW2, and I would recommend, if possible, that you really have a look. And it's a nice way to frame these initiatives and conversation around AI. We all know, but currently we are in the times of growing demand, workforce shortages, longer waiting times, digital fragmentation, and rising complexity. And these challenges are important, and they put a lot of pressure in the health systems. No matter how much money you put there in addition, because particularly in the EU, in general, all countries are investing more in health, but still they're challenged with facing challenges, with growing challenges and difficulties, and really comply with the demand from the population in spite of all the extra efforts that are put there. And this is, in general, true across the board. In the WHO European region, concretely, we are faced with chronic non-communicable diseases. They represent more than 80% of all premature mortality, and therefore, if you want to improve the resilience of the health system, we really need to look into chronic non-communicable diseases. But also there are other threats related with infections. There are, of course, demands, and people have expectations of having a more personalized, equitable, people-centered care. We talked about the shortages. We talked about the aging population. We here in Greece, we are delighted for basically almost 4 years that we are working with the Greek authorities and with the government on the establishment of the Athens Quality of Care and Patient Safety Office, and now and really trying to help countries implementing new policies in this area. And we are grateful for this support. With this support, we can not only work with Greece, but also support other countries across the WHO European region. Greece is becoming an important partner, even more important partner for WHO, and we are grateful for that. I see here people with the relevant responsibilities, both at the government and parliament level, and I would like really to express our gratitude to Greece over the board. There are structural weaknesses that we believe that AI can help overcome. They are of a structural, operational, technological, but also cultural nature. I will not go in details due to the pressure of time, but we believe that the modern health system should be able to work on predictions, anticipating and seeing where the trends are going, more prevention, more preventative. We all say that, but we don't do it in practice as much as we should. Without creating more inequalities, we can also ensure that it's more personalized and at the same time equitable. Increase participation, particularly from patients and their families. Interoperability needs to be improved, but also systems that learn and are really oriented to learning and to provide feedback. So we believe that AI in health is already transforming diagnosis and care. These are simple, obvious elements for everyone. We see progress in diagnosis and treatment. We see initiatives and we see evolution in predictive algorithms, for example, and we also see already actions around clinical decisions and support systems. So when we talk about AI, when I said before, when we were sitting there, AI it's a constellation of different things, and one should distinguish what we are talking about. And many of the areas in the health system can be powered and improved by AI, but we really need to know what we are talking about. So if you talk about prediction, it's completely different when you talk about tools, for example, that are going to help you improve your triage and waiting times and all of that. As the conference is very much focused on biotechnology, there's of course a very strong role by AI to be played at the level of genomics, personalized medicine for everyone. Personalized medicine for everyone. It's not the case yet. AI could maybe help us there. And of course, on remote monitoring technologies, huge potential there. Clearly great opportunities, we believe, in accelerating the digital transformation with smart patient records, with AI scribing, with personal health assistance. So there's many things, very many things that we can do. These digital systems can become the backbone of a learning health ecosystem. So the potential is huge in the context of course, risks, ethical elements, and really the human factor in control of the AI, which is always absolutely critical. Having this, really always thinking about that, everything we do should avoid that we increase inequalities. On the contrary, we need to help those in vulnerable groups to catch up quicker, to leapfrog, and this is where AI can really play a strong role, of course, always in the hands and with the leadership of doctors. So the human factor here is not going to disappear. It's going to be actually much more important, but we will leave time to do the real things that the human brain can do better than anything else. And that's really about what it's very exciting if we can do that. Of course, we need to do it the right way. I said in the beginning, when we were sitting there, that WHO in Europe has established a technical advisory group on AI with a strong focus on regulation, the role of governments, the ethics, and all of that. We really need to think about. Bias is a huge potential for AI, and the last thing we want is AI systems which are full of bias, and one could argue that at the moment there's a lot of bias. The Minister really talked about that, Dr. Themistokleous. So it's really important that governments do what's needed and right from them, but governments cannot lag behind too much. Governments are always behind innovation. It's normal, but they need to catch up very quickly in Europe. And probably that's not the case. Some people would argue that in other parts of the world, these things are going fast, and then in Europe we need to accelerate. So data protection, safety, and secondary data use is an important element to look into. Digital equity, I had a lot talking about that, and the ethics, oversight, and governance are very, very important. We also need to look into metrics and performance improvement, looking at clinical and quality aspects, systems efficiency, at the equity and experience. AI has a role to play in all of these potentially if we want. There's huge implications for us at the World Health Organization, but also international implications for countries and how countries work together, and let's say, multi-country cooperation, which is something really important. WHO can play a role in these multi-country discussions and contexts, and therefore we here willing to work for Greece and with Greece in whatever you believe that's necessary, and also to convey the experience from Greece, because I would like to commend Greece. You are taking steps in this direction already in a brave, let's say, approach to incorporating AI already into your health system, and that can come at the end of the day. If you're in the innovation seat, in the driving seat, of course, you will collect benefits from that at the end of the day. So WHO is ready to assist. This is what I would like to say. And congratulations to Greece. You're really embracing. You're putting it into practice. I think that your experiences certainly are being already observed by other countries. It's experimental moving forward, but deserves to be commended. In the WHO, in Greece, and as a result of the WHO European region, we also have, because our office focuses on quality of care and patient safety, we do have an innovative action plan where AI is also going potentially to play a significant role, and therefore implementing some of the policies that we have developed together is a great opportunity also using all of this. We have several initiatives in our office where these things are already being incorporated. Tomorrow we will be presenting one, for the first time, the new function, the new platform, which is called Health IQ, and we will be discussing it at the level of the ministry. But moving forward, we have also plans to continue to incorporate AI. So thank you very much. This is all very exciting. Congratulations to Greece for your recent effort.
Καλησπέρα και από μένα, είμαι Βάσο Αγγελέτου. Θα συντονίσω το επόμενο πάνελ. Ευχαριστούμε πολύ για την συμμετοχή σας, τον ενδιαφέρον και την παρουσία σας με φυσικό τρόπο στην αίθουσα που διεξάγεται το σημερινό.
Thank you for also watching us over the internet. Thank you to Dr. Breda for such a very interesting presentation with regard to AI and innovation. How the British NHS is transforming itself. There was a reference to Greece. You gave us compliments and you congratulate us on the efforts that have been happening so far, with a view to us keeping abreast of developments for the Greek NHS to align itself with the AI. Of course, sir, you refer to challenges that are not just pertinent to our own health system, but the world over, if not just Europe. Having said that, for the sake of our discussion, let me now kindly invite on stage the Deputy or Lord Lieutenant Minister of Health, Mrs. Irini Agapida, Gavridaki, and Mrs. Marilisa Xenogiannakopoulou, who is a former Minister of Health and is currently a member of the Political Secretariat of Syriza. We will be looking with the two ladies into the vision. This is a visionary panel about health in the year 2030, and 2030 is not really very far off. And maybe that will be ushering in a very new era. Thank you very much, ladies, for being here with us today to discuss the vision on health in view of the year 2030. And of course, the vision goes through certain challenges or walks hand in hand with challenges. So here's one first challenge. Dr. Breda also referred to it. And this is a challenge that was also highlighted by and pointed out by the previous panel discussions and our guests. I'm talking about the aging population. Dr. Breda said before that here in Greece, other than the objective demographic problem, which we are aware of, and it's a problem that is pertinent to Europe, there's also the faster aging of the people working in the healthcare sector, possibly also because of the brain drain. Maybe this is one of the many reasons. So, Mrs. Agapidaki, let me turn to you. Could you please explain what the measures you're taking are? Could you elaborate on how the Greek NHS can cope with the demographic issue that Greece is facing? What's your stance? What's your take? And what do you expect for the next 5 years? Good afternoon, and thank you very much for extending an invitation for me to participate, everyone. Mr. Breda's presentation was really interesting with regard to the aging of the population, amongst others. Indeed, in a few years' time, those over 60 in Greece will certainly be in excess of the numbers of productive people, working people. So the demographic is changing the landscape, and we have to duly rearrange our healthcare services. Prevention is something that we're focusing on. The Minister of Health and the Prime Minister also referred to the change or how we are adjusting. Let me just highlight a few points. There is a global shift. Instead of just investing in hospitals, we are now heavily investing and focusing on prevention. Now picture this. 60-year-olds flocking to hospitals, suffering from diseases. If you look at that possibility, we won't be able to cope. It will be another crisis in excess of the pandemic, for that matter. That's why we are heavily investing on prevention. That's why we have the Prolambano program. Prolambano in Greek is prevent. 5 million out of 6 million absolute beneficiaries have come and been screened for cardiovascular disease, colon cancers, amongst others. We have 100,000 people that were screened and identified in a timely manner through these programs. And when it comes to cardiovascular disease and screening, now we're adding new things. On the 2nd of December, WHO issued guidelines for meds for obese patients. Pretty soon we will be sending out SMS text messages. There's a relevant ministerial decision too. On top of that, there is another program on renal malfunction being detected at an early stage, and pretty soon we're going to do that for hypertension patients or early detection thereof. According to our estimates, we have 500,000 who are hypertensive in Greece and they have no idea. In the meantime, we're upgrading our systems and our hospitals. We're establishing practices, especially for chronic diseases, within the context of the local health centers. We're not just renovating and refurbishing our local centers. We are also creating new units, new practices for chronic diseases. And we have the mobile or ambulant health services. The minister said so much in the morning, amongst others, and so did the Prime Minister. We are showing up at the threshold of older people who are not mobile anymore. So we have to go to them or else they'll never get to the system. Yes, everywhere, all around Greece. And indeed, most cases that we have identified so far, and it makes proper sense. At the urban centers and the metropolises, you have most of the population, so we have most of the cases in the metropolises. I'm talking about mobile teams helping patients at home. Thank you very much. I'll come back to you, Ma'am. Mrs. Xenogiannakopoulou, over to you. To begin with, What is your take vis-à-vis those measures? And based on your experience, what do you think about prevention, the shift in the culture, and specifically about the demographic issue? Are the measures enough? Because this is a challenge on so many levels. It is an existential challenge for Greece, the demographic issues. So what's your take on what's happening? Good afternoon, ladies and gentlemen. Thank you for the invitation for me to participate. Let me commend and congratulate Mr. Breda for his presentation. Indeed, sir, you gave us many insights, and this is food for thought and concern. It's true. The aging of a population, the demographic issue is a big challenge, obviously, for all the European NHSs and especially for the Greek NHS, where the demographic crisis is one of the biggest issues we are up against. And we have to have a long-term strategy to deal with that, because the demographic issue and the aging of a population is pertinent to the future of our country. To be honest, aging of the population, you were to the point when you said, ma'am, that we're talking about aging for medical practitioners too. Mr. Breda referred to that. OECD statistics also point to that. So generally speaking, it's an overall crisis. We have lack of personnel. Unless my data is wrong, I have OECD data, about 2.1 million is missing from nursing staff, medical practitioners, totally in Europe. We don't have enough nursing staff and medical practitioners, and it seems that about 1/3 in Europe of the practitioners, of the physicians, and 1/4 of the nursing staff is over 55 now. Within Europe, this is a big issue, and it's wide. The OECD says that what we need first and foremost is to evaluate the conditions, the working conditions, to look at the reasons why young people are more and more reticent to choose to become medical practitioners. And we have to look at digitization. After all, this is one of the issues that we're talking about here. So maybe digital technologies can help somehow. Coming to Greece. As far as Greece is concerned, the situation is even worse. Even prior to the crisis, prior to 2009, the financial crisis, and then the memoranda that were signed, we had shortage of staff, and then we had the retirement of certain people, and then the brain drain. I'm coming to that, but you see, even the remuneration was frozen, so it's a matter of salaries and wages, and that's why people really don't know. And then it's a matter of hiring the right people. The brain drain, and you're right, the brain drain is a critical parameter when it comes to physicians. Hundreds of young, highly educated physicians left Greece and went abroad, and they embarked on successful careers. Now, what we can do to reverse that? Well, to begin with, the national health system of Greece must be properly manned again, so it needs permanent jobs, permanent posts, not occasional hires, permanent positions. Syriza, obviously, disagrees with what the government is doing. We want to make sure that medical practitioners working for the NHS are permanently hired and exclusively employed there. So we're talking about 15,000 permanent physicians, medical and nursing staff, and also adjunctive staff. But it's also a matter of remuneration. Let's be open about it. When you have a medical practitioner who's dedicated years on end to get an education, that physician will live abroad, will live for another destination abroad if here they're not paid enough. They need to be twice as much compared to what they're getting now, and that will help us reverse the brain drain into a brain gain. And I have a personal story to share that is pertinent to the establishment of the NHS back in the 1980s. Back then, we gave incentives to people to work for us, and that's how we managed to get people, Greek physicians come from the US, despite the Korea. And next to hiring people, it's a matter of improving the working conditions. It's critical. And it's also a matter of training, education, especially with regard to nursing staff. Nursing staff must be in a position to take advantage of new digital capabilities that are there now, since we're living in a digital age and it's happening as we speak. And of course, it's a matter of AI. Ms. Agapidaki, what about these proposals by Syriza, by Mrs. Xenogiannakopoulou? What about improving the working conditions? I don't want this panel discussion to become into a political one. Yes, but these are meaningful questions. They make sense. Yes, let me highlight a few things. To begin with, it's a pleasure because now, and it hasn't always been like that, I get more often than in the past, I get to meet and listen to people representing the opposition parties to support our views. And I know that they voted against what we had come up with. And I was surprised. I sort of expected to have some sort of understanding, to have a national alliance involving everyone across parties, in order for people to know that the prevention of cancers, amongst other, is what we agree on. It didn't happen. I'm very well aware, and we had the opportunity to talk with Mrs. Xenogiannakopoulou. I know what she's been, or rather where she's been, along with Pofiki Genimata. They worked together, they worked really hard. But allow me to say, Ms. Xenogiannakopoulou, that you are using, mentality-wise, the terms and philosophy of the past instead of being aligned with today. Remember, the 10-year financial crisis inflated what was wrong with the NHS. People who came up with the NHS must, at long last, avow that it was a good piece of legislation back in 1983, but it was never enforced. Instead, there were hospitals erected everywhere. It was a wrong, twisted approach. 40 years down the line, people were still waiting for them to get sick before they go to the doctor. Now we are here to change that, and along with everything that was ushered in with the crisis, we have to at long last agree that, internationally speaking, the picture is complicated, it's tough. Let's suppose that we had a magic wand and we had money all of a sudden. If you say that we have to pay the doctors twice as much, then tell me, where are we going to get the money from? Are we going to slash defense expenses, for instance, to pay them more? If supposedly we could find money somewhere, there was a rain of banknotes and we could pay them twice as much, you know what? There are organizational charts. In 5 years from now, AI is going to change those posts. If we hire people today, in 5 years down the line, maybe they will not have anything to do. So are you focusing on paying them more? Let's focus on that. I understand. Ideologically speaking, Mom, you beg to differ. It's part of the game of democracy. But the practitioners were asking for them to be allowed to have private practices while working for the NHS. And this is what Spiros Doxiadis had asked for Paraskevas Avierinos to do years ago. And we did it now. What I'm driving at is that quite often a political proposal doesn't suffice. You have to have evidence-based policy making, meaning you have to have insights and data. And this is the trend today. This is what we're supposed to be doing. It no longer suffices to have political discussions. We have to have well-validated scientific data, or else we'll not be able to keep abreast of international developments. The NHS now has more people working for it than they did back in 2010. We are paying more money to the doctors, and when it comes to the problematic areas, we still have provided more incentives to hire more people there. Forget about the public sector. Let's talk about the private sector. For a Mykonos-based doctor, and this is a popular destination, in order for them to show up twice a month, the private sector pays 20,000 a month and nobody still goes there. The demography of the doctors has changed. That's why Mr. Breda showed us ways through which we can turn the time of physicians into something more productive. Let's not just look for more people to be hired. Let's make things more efficient and effective. The way the NHS is the world over, it doesn't work. Increasing productivity is a challenge overall for Greece, all of the economy. Increasing productivity concerns all of our economy. Mrs. Xenogiannakopoulou, what is your comment given what the Deputy Minister just said? And would you also share to us your take on prevention? There was mention before by the Minister and the Prime Minister. Do you think there is the prevention culture in Greece? Do we need to dedicate our resources to other sectors? But I think prevention is something that everyone understands now would help us and save us a lot of trouble, personally, but also economy-wise.
Really like to say is that the NHS, the Greek NHS, is one of the great advances of the Greek state. Every survey has shown that this is a leading achievement. But I can agree with Ms. Agapidaki that the primary health care is lagging behind. That is a fact, and we need to improve, and we may look at things differently, but we need to discuss. And we also exactly have the AI and new factors that are entering the system. So diagnosis will improve, also better governance and administration. And all. But let me say a few things. Of course, we all agree that the NHS has to be modern, advanced, but it requires staffing. There are many empty places around the country, on the island, and let me point out another aspect for which we will agree with Ms. Agapidaki, I'm sure, that strengthening the NHS in the regions will help the growth, but also help the demographics. Young couples will be able to stay in their villages, in their hometowns, and it also helps tourism. So investing on the NHS, both in staff and obviously infrastructure, favors the growth of the economy. By example, I come from Kefalonia, the island of Kefalonia. We have the hospital on the island since the 80s. When people need to go there for dialysis, let me tell you, there were more than 100, when it was possible to do dialysis, there were more than 100 families that remained on the island. And of course, this has helped tourism because tourists, Greeks and foreign, are able to continue their treatment on the island. So we need to look at this in a modern way. Prevention is extremely important. We need to look at it from a modern strategy. All these mobilizations, the campaigns are very positive. Nobody could disagree with that. But there are two other aspects of prevention. As we heard from Mr. Breda as well, we are at a period of huge crisis, climate crisis, the pandemic, and a series of other issues that need us to be ready, prepared, and alert. And there are some other aspects of prevention which are not so widely discussed. Health and safety in the workplace, we lag behind. This is a huge issue. Yes, of course, it's a huge issue. And I have recently looked at a survey conducted by the European Parliament. We lag very much behind, starting from the controls of health and safety in the workplace. And secondly, which is unfortunately very topical around Europe and in Greece, has to do with the social inequalities and social crisis. Meaning that according to the recent data from OECD about Europe, but also specifically for this country, wherever there is economic difficulty, the presence as regards mental health, depression, and whatever this may bring about, or else obesity, overweight children and adolescents. These problems have 60% more incidence among poorer families. So all these have to be taken into account by AI. Yes, of course, screening, yes, prevention, yes. Now, Ms. Agapidaki, you have undertaken a series of initiatives, among others, self-harm, at the level of prevention, of course. Please, can you tell us about it so that people get to know what these initiatives are? Because these are problems that affect many families. I'm very happy to hear Ms. Xenogiannakopoulou mention the social inequalities in the field of health. We need to avoid, to save costs with technology. Today we're discussing technology, and over and above the mobile health units, we are able to use remote medicine technology for a number of tests that people should travel for without traveling. So people need to spend more than 100 euros to travel from a village. And in a family, and especially a young family, you can imagine, when the doctor comes to you with all the equipment, there is a difference. That makes a difference. There are medicines for people who have difficulty in accessing them. For me, it is very important for people to know the number 1135 so that they can make an appointment. There are many points around the country where people can be vaccinated. Whole families can go. As far as child obesity, because Ms. Xenogiannakopoulou is absolutely right, yes, the rates are higher among the poorer families. So over and above are all other actions which have been welcomed by many people, we are able to provide free nutritional advice with a psychologist and nutritionist. We have set up a National Center for Obesity. We have served more than 1,000 families. Minimum decrease of BMI is decreased by more than 80%. As regards self-harm, with funding from the RRF, in collaboration with the Unitian Hospital Psychiatric Clinic, we have set up the first model self-harm children. And this is underestimated. The figures about self-harm are underestimated. More than 60% of children 14 to 24 say that they know somebody who has have harmed themselves. People have difficulty in managing their feelings, anger, bitterness, etc. So we provide a number of psychological interventions which are difficult and expensive to find. And these services are provided wherever somebody is in the country. I would like the people to visit our site, Child and Mental Health. There is no perfect family. There is nobody who can do everything by themselves. So please don't hide these issues. Don't feel ashamed. So our campaign is based on the acceptance of what we cannot do, of our weaknesses. So, Ms. Xenogiannakopoulou, your vision concerning the next 5 or 10 years as regards health, how can you combine it with AI, but in a nutshell, please?
The critical issue is to have an NHS that will be state-of-the-art, universal, covering everyone, while being modern and taking advantage of primary health care and having hospitals everywhere with emphasis on remote areas and our islands. Hopefully with the right staff, appropriate staff, modern terms and conditions, right infrastructure with digital skills, tools and AI. I think it all goes without saying. And when it comes to prevention, let me dwell in particular on what was said before, because Ms. Agapidaki focused on youth, children and teenagers, social media, the pandemic, the digitalization of our lives, the fact that the kids were in their houses for so long, abusive behaviors. All of that is happening everywhere in Europe, not just in Greece, but it's also a matter of depression and isolation. So given all of the aforementioned, what is needed is a special strategy to focus on the youth. And I also believe that it's important to continue efforts through time. Let me share a typical case because I want to communicate a positive message. It makes sense to have different political stances and approaches. Of course, it's necessary too, I agree. But let's talk about tobacco. It started by many governments when I was in charge, 2009, 2010, along with Fafigeni Matas, the late minister. When we took over, Mr. Kaklamanis was our predecessor. Before him, there was Mr. Kremastinos. Before him, there was Mr. Avramopoulos. So we took the bill of law, we improved it. Of course, there were enforcement issues. And the next governments then enforce the same legislation. Despite any weaknesses and problems and challenges, there had been a series of governments that worked on this, the banning of tobacco. And thanks to that, nobody now smokes indoors. And it makes perfect sense for young people to not use so many tobacco products or smoking devices. So you see, if you have a long-term strategy, it pays off. That's what I'm saying. And especially when it comes to prevention and protection of public health, such strategies must be the result of consensus and debates. Since we're talking about mental health and prevention, I know this is not intertwined with the NHS, but then again, social media and the youth, controlling access, having an age threshold. This is happening in Europe. This is prevention. Yes, I have friends who are pediatricians and now they are specializing on being hooked on the social media. Thank you. Madam Deputy Minister, what is your vision? I've jotted down two things from Dr. Bredas's presentation. The AI systems are slashing by 95% the work that experts have to dedicate, and that is helpful for skin cancer, and 60% in breast cancer, saving time. Please know that in 2026, we're going to have AI help us detect at an early stage skin cancer. And we will be proceeding with facilitating the lives of radiologists. We will be offering them AI tools to read properly the X-rays and have early detection. We're also using the RRF funds as of March 2026. This will be accessible to all the population in order to prevent and preempt cervical cancer, gestational diabetes. A special message will be received by pregnant ladies and they will be monitored from a distance using their cell phone. They'll be in direct contact with a doctor wherever they live, free of charge. There will be pre-screening for cardiovascular disease. We will have a health advisor at the tips of our fingerprints on the cell phone. There will be personalized reporting. We will be able to have the risk factors assessed. There will be advice on recommended services to improve our health. So we have two layers, AI and data. Again, a policy that is based on just pure theory is over. That era is over. Now we need insights and well-validated data for each and every single euro we invest in public policies. That way we can help our lives with the data. My aspiration is for my successor to find more things and a system, and we're doing that, a system that would allow the person who will succeed me to properly plan for and schedule the future. As Ms. Xenogiannopoulou said, we want to have continuity. It's of huge value. And so we're here to also facilitate the lives of practitioners, the physicians, we're helping the patients, and we're also helping the politicians and the statespeople for them to embark on a path that will solely count on scientific, validated insight. So continuity. May I, says Ms. Xenogiannopoulou, you know what, I think it's critical, and I believe everybody will agree on this. Since we're talking about AI, Mr. Breda, thank you very much. You dwelled on it. We are talking about very sensitive personal data, health data. So we have to make sure that we also protect personal data, private data, human rights. We have to have accountability and proper checks and controls. This is pertinent to the whole of Europe. You agree. We agree. And everything we do is fully aligned with the European directives. It's good we have the EU, yes, and everybody is supportive. And we are attaching great importance to biosecurity and safety. As far as this is concerned, for us to be, and we are, whether we like it or not, a step ahead than other members. Thank you. Data security is an issue elsewhere. Thank you very much, dear ladies. This was an interesting discussion.
«60 χρόνια. Ένα ταξίδι που ξεκίνησε από το όραμα του Δημήτρη Πενταφράγκα, ενός φαρμακοποιού από τον Εύρο. Και έγινε ιστορία ελληνικής φαρμακευτικής καινοτομίας και βιομηχανίας. Από τότε, ένα πράγμα μένει αμετάβλητο. Η δέσμευση να βελτιώνουμε τις ζωές των συνανθρώπων μας. Κάθε δεκαετία, ένα βήμα πιο μπροστά. Από την πρώτη εγκατάσταση στο Πικέρμι και τα πρώτα σκευάσματα, στα ποιοτικά γενώσιμα που κέρδισαν την εμπιστοσύνη των Ελλήνων. Με την ίδρυση του πρώτου ερευνητικού και πειραματικού κέντρου της χώρας. Τις εξαγωγές που μετέφεραν τη γνώση και τα φάρμακά μας σε όλον τον κόσμο. Την καινοτομία του Panhellenic που αναγνωρίστηκε διεθνώς και την παρουσία μας σε περισσότερες από 90 χώρες. Μέχρι σήμερα έχουμε διαθέσει πάνω από 300 εκατομμύρια συσκευασίες, βελτιώνοντας την καθημερινότητα εκατομμυρίων ασθενών. Και παραμένουμε η νούμερο 1 φαρμακευτική εταιρεία σε πωλήσεις στην Ελλάδα, στην αγορά λιανικής και στα ασφαλιστικά ταμεία. Συνεχίζουμε με νέες επενδύσεις που διαμορφώνουν το μέλλον. Πίσω από κάθε επίτευγμα βρίσκονται οι άνθρωποι της ΕΛΠΕΝ. 3 γενιές επιστημόνων, ερευνητών και συνεργατών που μοιράζονται τις ίδιες αξίες. Με ακεραιότητα, ομαδικότητα και αφοσίωση κάνουν πράξη το όραμα της εταιρείας κάθε μέρα. Στην ΕΛΠΕΝ, η διαφορετικότητα, η επιστημονική αριστεία και η ίση συμμετοχή είναι δύναμη. Περισσότεροι από 1.700 εργαζόμενοι σε Ελλάδα, Γερμανία και Μέση Ανατολή ενώνουν τις γνώσεις και τις δεξιότητές τους για έναν κοινό σκοπό, την εξέλιξη της υγείας και της φαρμακευτικής επιστήμης. Σήμερα κοιτάμε μπροστά, με νέες μονάδες παραγωγής, με επενδύσεις σε έρευνα και καινοτομία, με διεθνείς συνεργασίες που φέρνουν την ΕΛΠΕΝ πιο κοντά σε περισσότερους ανθρώπους. Χτίζουμε το αύριο της ελληνικής φαρμακευτικής επιστήμης με την ίδια αφοσίωση που μας καθοδηγεί εδώ και 6 δεκαετίες. Να καινοτομούμε, να θεραπεύουμε, να εμπνέουμε. ΕΛΠΕΝ. Advancing Health and Care for All.
δυνατά! Πιο ψηλά! Δεν κλέβουμε!
Μπορώ να διαλέξω κάτι πιο χαλαρό. Δεν είμαστε σε reality επιβίωσης. Και για το χώρο θα ήθελα κάτι πιο ατμοσφαιρικό. Να αλλάξουμε και την ώρα. Τόσο πρωί το καφές μου δεν έχει κάνει stretching.
Θέλεις παντού τη δύναμη της επιλογής όταν έχεις το My Health First της Eurolife FFH. Μια πιο οικονομική λύση ασφάλισης. Γιατί με το My Health First διαλέγεις εσύ όποιον γιατρό και νοσοκομείο θες, με απευθείας κάλυψη εξόδων ή με ποσό οικονομικής παροχής που γνωρίζεις από την αρχή. My Health First. Δύναμη επιλογής.
40 χρόνια τώρα, στον Όμιλο Βιοιατρική, βαδίζουμε δίπλα σε κάθε οικογένεια με ένα και μοναδικό σκοπό. Την προάσπιση της υγείας όλων. Γι' αυτό, εδώ και 40 χρόνια, επενδύουμε συνεχώς. Σε κορυφαίους συνεργάτες. Σε εξοπλισμό τεχνολογίας εχμής. Σε προηγμένα συστήματα διασφάλισης ποιότητας. Σε πλέον σύγχρονες και ασφαλείς εγκαταστάσεις. Σε πιστοποιήσεις από ηγετικούς οργανισμούς του κλάδου μας. Σε σημαντικές διεθνείς διακρίσεις και συνεργασίες. Στη στήριξη της χώρας και την κοινωνική προσφορά. Επενδύουμε πάνω απ' όλα στον άνθρωπο. Για να αισθάνεστε όλοι εσείς και οι αγαπημένοι σας σιγουριά και ασφάλεια κάθε φορά που εμπιστεύεστε την υγεία σας στον Όμιλο Βιοιατρική. 40 χρόνια βιοιατρική. Είμαστε εδώ για την υγεία όλων.
Στην Εθνική Ασφαλιστική, τα όνειρά σας, οι άνθρωποι σας, η υγεία σας, η ζωή σας είναι για εμάς πάντα σε πρώτο πλάνο. Γι' αυτό κάνουμε πράξη την ασφάλεια. Εθνική Ασφαλιστική. Εδώ για την επόμενη ημέρα.
Damien is the name of the 8 billionth human being. He was born in the Dominican Republic and was fortunate to come into the world with the help of excellent medical care. Healthcare that starts from birth and extends throughout our lives might seem to be a given for us, but for billions of people around the world, that's simply not the case. And the more people there are, the more important it becomes to act responsibly and sustainably. We believe that good healthcare should be standard rather than something special. That's why we work together with our customers to develop innovations that push the boundaries of what's possible. It's what gets our more than 70,000 colleagues out of bed each morning, and sometimes keeps them up at night. We need this kind of passion and diversity, and that's why we invest in the potential of each individual. That makes us more than pioneers in health. It makes us healthineers. Digital twins allow patients to receive individualized diagnoses, treatment, and follow-up care. Thanks to intelligent, image-guided diagnostics, treatments are more precise than ever. With the help of digitalization, data, and artificial intelligence, we optimize procedures and treatments in an outstanding way. New imaging systems allow for earlier detection of diseases and more targeted treatment. With innovative methods, labs can recognize disease profiles more reliably and adapt to other challenges along the way. By continuing to integrate and digitalize imaging and treatment in oncology, we are getting ever closer to a future in which cancer is no longer something to fear. But even the most advanced technology is worthless if not enough people have access to it. That's why we cooperate with international partners to tailor our innovations to the needs of our customers, healthcare providers, and local infrastructures. We pioneer breakthroughs in healthcare for everyone, everywhere, sustainably. That's how modern healthcare will become an accessible, affordable reality for billions of people. Just the most normal thing in the world.
Γίνεται κάτι τόσο μικρό, να περιέχει τόση ουσία, τόση γνώση και εμπειρία, τόση ευθύνη, τόση δυναμική, τόση ευαισθησία, τόση φροντίδα, τόσο νιάξιμο. Γίνεται κάτι τόσο μικρό να καταφέρνει να κάνει τόσο καλό. Στη Unifarma γίνεται. 60 χρόνια. Αξία για τον άνθρωπο, ευθύνη για την κοινωνία.
Πάμε δυνατά! Πιο ψηλά! Δεν κλέβουμε!
Μπορώ να διαλέξω κάτι πιο χαλαρό. Δεν είμαστε σε reality επιβίωσης. Και για το χώρο θα ήθελα κάτι πιο ατμοσφαιρικό. Να αλλάξουμε και την ώρα. Τόσο πρωί το καφές μου δεν έχει κάνει stretching.
Θέλεις παντού τη δύναμη της επιλογής όταν έχεις το My Health First της Eurolife FFH. Μια πιο οικονομική λύση ασφάλισης. Γιατί με το My Health First διαλέγεις εσύ όποιον γιατρό και νοσοκομείο θες, με απευθείας κάλυψη εξόδων ή με ποσό οικονομικής παροχής που γνωρίζεις από την αρχή. My Health First. Δύναμη επιλογής.
40 χρόνια τώρα, στον Όμιλο Βιοιατρική, βαδίζουμε δίπλα σε κάθε οικογένεια με ένα και μοναδικό σκοπό. Την προάσπιση της υγείας όλων. Γι' αυτό, εδώ και 40 χρόνια, επενδύουμε συνεχώς. Σε κορυφαίους συνεργάτες. Σε εξοπλισμό τεχνολογίας εχμής.
Hope you can hear me. Ladies and gentlemen and dear kids, literally now there are kids in this room. Now, with some delay, because this is what normally happens whenever we have conferences, now we will move forward and kick off the next session. And this session is on measures to prevent hospital infections. And let me be more specific. Accreditation of hospitals. If you have failed to grasp what a hospital infection is, I think those attending physically know, but then again, there are about 800 to 1,500 people that are watching us over the internet with us live streaming. So just for your benefit, let me explain that hospital infections are the second most important reason why we are faced with huge problems, or other patients are faced with problems. They enter the hospital, they're admitted for one condition, and instead of leaving, they get an infectious disease, or there's a hospital infection, and that deteriorates because these are highly resistant strains we're talking about. And most importantly, such infections burden significantly so the national health system for something that is actually redundant, or if you will, this is a secondary and collateral damage. The chief editor of Real News, Alexandros Kondis, will now take the baton and he will be acting as moderator. Our rapporteur is the Deputy Minister for Transport, and you will understand why Mr. Kyriakos will be taking the floor while Alexandros moderates the discussion. Thank you very much, dear Mariana. Now, let's discuss hospital infections and take it from A to Z. But before we embark on this discussion, let me remind you that it hasn't been long since we had the pandemic, when there had been various surveys suggesting that mass transportation media are quote-unquote bombs filled with germs, and they are dangerous to public health. Let's give the floor to Mr. Kyriakos, the alternate Minister for Transport, and what can be done. Over to you, sir. Now, good afternoon, ladies and gentlemen. To be honest, I guess it's strange, and I guess you are wondering why the Minister of Transport is taking the floor to discuss nosocomial infections. I am not exactly the man who's an expert in analyzing hospital-acquired infections, but we have recently taken an initiative that is worth mentioning because it's paid off. I'm talking about antimicrobial filters that were integrated in the public transportation buses. They are filters that come with a certain logic. You see, the surfaces of the public transportation means are important. They obviously are loaded with germs, and they can be cause for infections, and of course infections can be communicative, and we want to avoid that. These copper filters are there. This surface is, and you know better than I do, ladies and gentlemen in the audience, stopping the infection, and that's what we did. This is a measure that comes with EOF accreditations and a SIV accreditations. This is the national authority that accreditates or provides certificates for accreditation, and I believe that this is something that should be adopted by other public transportation means. I know we tend to forget about what the significance thereof was, and we normally think about the infections when they happen. In those hospitals that these filters are being used the world over, these filters are working. And wherever there are spaces where there are many different uses and the spaces are used by many, many people every day, such filters can help protect public health even better. Mrs. Periotti, with your permission, let me refer to something else which is relevant to the overall framework of what you're talking about. Let's discuss road accidents and their impact on the NHS and on more than just the NHS of Greece. Off mic, unfortunately, we regret not being able to interpret. Exactly, says Mr. Kyriakos. 2024 statistical data are sad. We had more than 600 people who died and another 600 who were injured. Obviously, they were moved through Greek ambulances to the various hospitals all around Greece. The impact, of course, was serious for their life and health. Our main goal for 2025 was to have the number of deadly road accidents drop. And I'm happy to share with you that at the end of 2025, this is December, indeed, there's a drop in the number. And we managed to get them to drop more than they even dropped when we had the pandemic and nobody was moving around the streets. So this is the end of 2025, and we will have another road accident prevention campaign during the holidays. But it turns out that this year we're going to have fewer deadly road accidents, fewer than we had in 2020 when nobody was roaming the streets. And of course, this is the result of tough work and the fact that we adopted a new road regulation for vehicles, and most of the parties all across the parliament have voted for it. Thank you. Thank you to the opposition parties. Mrs. Straskia is here, so thank you. There are quite often in the plenary issues that we agreed on, and I believe we and her agree that deadly road accidents are a huge blow that our community is dealt with, and we shouldn't be faced with such accidents, or rather not treat them like an individual responsibility, so we wouldn't sit with our hands crossed. And I'm happy that almost everyone across the parliament and the partisan lines agreed this was a good code. Now, policing has increased, especially during the summer months. It paid off because we had many strict tests and alcohol consumption tests, breathalyzers. The number increased. We had an unprecedented number. We also finished important motorway and road projects, Quadripyrgos, for instance, where there used to be many, many road accidents up until next year. And whole families had suffered the consequences. Tragedies had been caused, especially in the Western Peloponnese, before this road was finished. At long last, this project is ready, and we've already embarked on the construction of VOAK in Crete. This is yet another motorway which in Crete has become synonymous with fear and loss of life, bad circumstances and tragedies that are costly in terms of the death toll. And this is yet another part of our strategy, motorways, and we will continue that direction. We also have the metro up and running for 24 hours. That is all round Saturday. We used it and tried this on a pilot basis, and we're going to try it in Thessaloniki because Saturday night is always the deadliest time of the week. Saturday night, Greek drivers and maybe the world over drivers tend to be more tired, or maybe possibly they had one too many to drink. The streets are empty and the roads are empty, so they accelerate more than they would normally do, and so especially after midnight the data was shocking. So people working for the metro in Athens were helpful, so that's why we have the metro work all day round and night on Saturdays. Last week, 60,000 people used it. And another thing which is important to us is education and training. I can't help but see that in the audience today we have young people. Unfortunately, available data shows that young drivers age 18 through 24 are the ones who cause most of the road accidents, and that's what we're focusing on. And currently, we are looking at ways through which we could change the system by means of which people get a driver's license. And once you get your driver's license, you should be retrained or keep training, if you will. This is what we're going to apply to ensure that those who are driving for the first time or for the first years still have all it takes for them to not cause road accidents. And another thing that I also believe is relevant to the health sector, and this is something that will kick off this January 2026, is that we'll change the ways in which we check the driving skills of elderly drivers. They are not the major cause of accidents, but they're still causing accidents. It's an issue. So for those of you who are doctors, I don't know how many of you are doctors or no doctors, that up until now, driver's licenses were renewed by simply getting 4 physicians to stamp a document. As of January 2026, renewing driver's license will be not so easy. You will have to go through the e-system, Idika, so doctors will check the whole dossier of the person before they sign off to it. So before there's, or rather whenever and if there is a road accident and there is a 65-year-old involved or over, then we will have access to the whole dossier and we'll know who signed off to their getting a renewed license. Now, I'm certainly here. Let me thank the organizing committee. I'm certainly here to work with you and make sure that the public transportation means will be more friendly and protective of public health.
Thank you very much, Deputy Minister Kyriakos. And without further ado, let's move on to the panelists. Measures to prevent in-hospital infections is So Anargyros Souliotis, Director General of Greek Copper, Emmanuel Papasavas, President of the Child Oncology Hospital, Grigoris Vlachfahakis, Governor and President of the Larissa General Hospital, Evanthia Botsa, who is a pediatrician and a specialist on infections, Dr. Dimitrios Velisariou, who is a chemical engineer and quality director for Health Cert. So, I have spoken to all of you over the phone. You are aware of the framework. This is a hugely important issue. And before we start, we should gauge it correctly on the basis of the following. In 2022, Greece, EOP, made a survey with among 9,700 patients who were hospitalized, and 1 out of 2 reported a hospital infection, having contracted a hospital infection. So, let's look at the problem and how we can deal with it. Mr. Souliotis, Hellenic copper, so antimicrobial protection. Can you tell us, can you explain your method to us? And what does exactly copper do? Good afternoon, everyone. To the Prime Minister, to the ministers, to the opposition. And let me discuss these hospital infections, which has been described as a silent pandemic. Yes, there is a problem. Many Greek families have lost their loved ones who have gone to a hospital for a routine test or even surgery. Even Minister Plevris practically died. And the means we have to deal with this issue is awareness, patient awareness, patient nurse awareness of the nurses, and antimicrobial protection, air, antimicrobial copper filters, and of silver, because there are other products, that industrial products that can be used to this end. The EU has measured the effects. Therefore, the competent hospital committees are aware of what they have to do. We are a company that produces and markets such products. We have helped with hospitals, public transport in areas that there is lots of people go, and therefore we create a healthy environment. And the minister discussed the schools, and we have a ministerial decision asking schools to keep the windows open because there was no such equipment to protect the children. So in the winter cold, the windows had to remain open. All of this is currently underway to be dealt with on the basis of measurements. How do you actually measure this? Well, beyond any clinical studies and research that has shown, we have measures that are taken beforehand. For instance, paint on the walls, so measuring the air samples, and then we achieve the banning of microbes by 99%, and this is measured by organizations that are specialized. What we do, we participate in the hospital sector, but as you heard from the minister, 1,200 buses were equipped because, as you also said, the microbial bombs term was used. Lots of people using a mask. You will see that in some age groups, people still wear masks. In the buses, there is no transmission. 3 surveys have taken place, and we see 99.9 buses. So the lifespan is from 3 to 5 years. There is a renewal, and the cost of that is practically zero compared to their contribution to public health. I don't want to take up more of your time, but most governors here the president of the oncology hospital, chemical engineers are more competent to describe this. What I can tell you is a full file that we can submit showing 99% protection. So, thank you. Mr. Papasavas, you are the president of a specialized hospital, the Children's Oncology Hospital. So I suppose that one misstep in the treatment of a child would lead to tragic results. Can you actually assess the situation with hospital infections, not only in your hospital, but around the country? Thank you. Thank you for the invitation and congratulate you for the conference. Yes, these infections are long-standing problems for the hospitals. On the basis of a study by AOP, our hospitals have among the highest levels of such infections in Europe, both as regards the frequency. Approximately 12% of patients that are hospitalized will be infected, and this percentage is even higher when it comes to patients that will be treated in intensive care units, which is 40%. These are very high figures. As regards our own hospital, the pediatric hospital, the rates of such infections are much lower than in the other hospitals in Greece. And let us look at the causes for these infections. First of all, lack of staff, especially nursing staff. When we don't have adequate numbers of nurses so that few more nurses can care for the patients. The old infrastructure also a factor. Number 3, the fact that rules of hygiene such as hand washing are not kept. This also affects these infection, and the improper use of antibiotics. We use last generation antibiotics while we could be using older generation antibiotics, and this is very helpful as regards the resilience of the tolerance levels, and also the monitoring of the hospitals allows us to focus on the problem and fight against this phenomenon. Your hospital has lower rates. Why? Because of the type of disease of patients that you have, or for any other reason? It's a combination of reasons. We very strictly adhere to the protocols. Also, we only have a single or 2 bedrooms. Our infrastructure is better, and we have a good monitoring mechanism. Now, Mr. Vlachakis, the Larissa General Hospital, a big hospital called upon to deal with many different cases. I want to remind you that you managed everything that had to do after the Tempe rail accident, a terrible. What's the situation in your hospital? Good afternoon. I would also like to thank you for inviting us. The Larissa General Hospital is a hub, plays an important role in the whole area of central Greece, and this was shown during the recent crisis in the health sector, especially the Thessaly, the pandemic, the COVID pandemic, the earthquakes around Larissa, the flooding, and the Tempe, the tragic accident of Tempe. As regards our hospital, during the pandemic, that was the hospital that was assigned with COVID cases. So as a result, although we were not a reference hospital, people preferred the general hospital. Therefore, we had a very high number of cases and therefore high rates of hospital infections. In some of the clinics, which were closed as COVID clinics even for 2 years. And this created feelings of insecurity among the public. What we tried to do is to make people feel safe in the hospital. So we wanted to have people feel safe to come to the hospital, but also to achieve the same thing for the staff. During the COVID years, it was difficult to convince anyone to go work there. After measurements, we saw that even on the walls there were high concentrations of this virus, which had to be dealt with by using antimicrobial paints or copper ions. The same happened in other clinics, because we felt more confident as regards the future. We need to plan and build a new hospital, because over and above the different crises of our hospital, the hospital is actually changing. In general, everything is being renewed, refurbished, new wings are being built. I think that the hospital was refurbished or built 30 years ago. Well, not so bad. This is an issue that all hospitals are faced with. But the issue is generated 48 hours after hospitalization. In Larissa, we have many rehabilitation centers and private clinics, so we have serious cases in our hospitals which demand very high level care. So it is only after 48 hours these people are deemed to be saved, plus 5 days after they leave a general ward and 3 months after surgery. This is a process which we manage using tools such as painting the walls with special dyes, filtering the air, and training of the staff to clean their hands and to use their personal protection equipment properly. Their safety is also the safety of the public. Ms. Boccia, there is something I can't understand. What does a parent feel when they go to a hospital for a child to be treated and they learn that because of that their child has suffered something else? Can you please tell us what's the situation with hospital infections in the pediatric hospitals? Is it the same as the general hospital? Good afternoon. No, it is not the same situation. And since we are very well aware of having very sensitive patients, we are much more careful as regards the measures that we take. We want this rate to go down to 0. The pediatric hospitals are doing much better, and we have worked on every pillar. Our own hospital, the Hagia Sophia Pediatric, it was the first to monitor situation of hand washing and hygiene, and we have reached a level over 80% for hand hygiene, which is high for the Greek situation, and this is a standard rate. This sounds easy, but it's basic, and from then on we move to the other pillars. Initially we looked at the most highly used surfaces. We used copper so as to avoid any contamination. Then on a next phase we used, over and above the copper filters that were being used earlier, we also used registration of the status of the area, meaning that in the ICU use in the operation theaters, we recorded the status of the halls, but so as to review the processes. So when you find an infection in an area, you need to go back to see what might have caused this and what can you do to take corrective action. Even the surfaces there are the ones that are most contaminated. So this has all helped to assess our processes. We have improved them by a lot. Secondly, in this way, we had an objective comparison with what was happening. We knew what was going on, and right from the start, we had a very good situation. We did what was necessary, and I will point out what is most important: the change of attitude. People come to the public hospital when they see that all the pillars, all the measures that are required to reduce hospital infections are in place, even though they might not be at obligatory, compulsory at nationally or at the European level. They realize the level of the service that we offer to young patients. Well, in the past, young journalists were assigned the easiest task. They were sent to hospital to record the situation. And we have seen these images everywhere, but the situation has improved greatly. Now, let's go to Mr. Velisarios, Quality Assurance Director, or that is looking at how a hospital operates. What do you look for? No, can't hear the gentleman, I'm afraid. No. His microphone cannot be heard.
This is our role as well. And in the health provision services areas, we're taking stock of those practices, and we are gauging how and how much they're improving. By way of introduction, let me say the following. Indeed, a very interesting situation is the so-called GRIP. It's a program to contain and limit HAIs, hospital-acquired infections. And for the very first time, there were some hospitals, well, to be honest, there were some hospitals that knew about best practices, and now this is all-encompassing. Best practices are exactly the ones that were mentioned so far. It's about infrastructure, it's about hygiene, it's about training the staff. It is also overall training and having the right resources. This was a very encouraging program too. It went on between the years 2021 and will go on until the end of this year, so end of 2025. We, as an accreditation authority, as a certification authority, are there to impartially attend or rather go to health related areas and check whether the conditions are met, where everything is complied with international standards wise, and whether there is scope for a further amelioration and improvement, because this is the end goal after all. And let's discuss the general overview as well. Indeed, we're using management systems. Indeed, proper management systems and systematically dealing with the problems, methodically resolving the issues. That is a way to get reports, if there are any, but there's also a comparison, and you can take stock of ameliorations. Let me, by way of conclusion, ask a second question. Let me come back to you, Mr. Souliotis. There's mention of hospitals, of public transportation means, of ministries and public services, the headquarters, I mean, where you normally have lots of people. What would make you happy? What would be satisfactory to you? In order for you to feel like you have delivered and you have done your part. What antimicrobial filters and the relevant surfaces and filters will be like in the years to come. So I believe that the first step came through the RRF. We took advantage of funds from the RRF and embellished the hospitals, and we have to congratulate the administration, meaning the governments in power. And then protecting them from germs is important. We have to shield them that way because yes, there were new facilities and new ORs and so on. We have to make them safe, and this is stage 2. The ministry, based on what we heard, aims to, and we've been attending beautiful conference for 4 years, and we will continue to come here because being updated and informed and being aware of the goals of the government are important, and they always should aim high. But then the WHO has proceeded with measurements, and apparently we are second on top of the list, sort of, second from the top. We've made steps, this is positive, but then again, we are still faced with the same issues. So the second goal of our company is to now go to schools. We are currently in conversation with the Ministry of Foreign Affairs, of Education, We are having talks with the Ministry of Education. This is certainly an issue that's intertwined with the local municipalities, local government and regional authorities, and I expect there will be donations made by big business people. They are aware of the problem. They are endorsing a solution. You know what? Before the pandemic, we didn't know what a pandemic was, but now we are knowledgeable and we are protecting ourselves. We had no idea about disease and illnesses, how they spread. And nowadays we're not talking about COVID, but there's talk of H1N1, Candid Towers. Candid Towers, Alexandros, is Candida auris. This is the worst pathogen because you would have to demolish walls if you want to get rid of it. There's no other way. And there has been research, and we can actually eliminate them just as long as we use the right filters. And I told my family, you will picking up from where I left off, so you have gold in your hands. Take advantage of it, not to make money, but to save the lives of people. Because there is another research which I just remembered of. The financial and economic benefits that hospitals will gain just as long as they slash the days of hospitalization. According to a survey, investing in filters pays off because it helps you slash the number of days during which you keep a patient in hospital. ICU, the cost is 250 euros. If you want to insulate the ICU. So this is great now. Let me move on to Mr. Papasavas, unless you've been willing to add something else. No, I'm good. Thank you. Mr. Papasavas is running a hospital where, unfortunately, the patients will stay for a long period of time. What is it you are striving to achieve? What would make you happy? Because we are talking about lengthy stays and there are risks. The Oncological Children's Hospital is the only one in the country. It's only for children exclusively. Let me share some figures. Every year we have about 350 firstly diagnosed cases, out of which 85% is actually admitted to our own hospital. The average stay, especially during phase 1, is 4 to 5 months. So this is the first cycle of treatment, and then we try to keep them outside of the hospital and to just make them come for a day stay. The outcomes thereof are good. 3 in every 4 children recuperate fully. And now with precision medicine, we were the first who are scoring successes. We managed to have gene therapy and cell therapy thanks to donations made by the late Mariana Vargatinogianni. So we're trying to turn this rate from 3 out of 4 into 4 in 4. So we aspire to having better rates, recovery rates, full recovery, and an important parameter to achieve that is to slash the number of hospital-acquired infections. We are already at a low rate. We want to turn this into 0. Is it feasible? What was that? 0? 0 infections? Is it possible? This is our vision. But to do so, we need to strictly comply with personal protection measures on the part of the staff. We have to keep training the people. We have to keep introducing new products in our hospital. We were the very first who used copper filters and copper products on the services to make sure that we improve the rates. And indeed, the before and after showed there's a difference. Constant supervision, monitoring, this is what is also needed. And then again, you have to make sure that you not diverge from the instructions for antibiotics and therapeutic and treatment protocols. What about you, Mr. Vlachakis? What would make you happy in your own case? We're talking about a very big general hospital in Larissa. Is 0% possible?
No, I don't think so. There are always different factors playing which are exogenous. But we need to fight it so as to achieve a 0 feeling of insecurity that I mentioned earlier, both by the patients, also by the staff. Because as I said, we used to be a COVID hospital, and our staff were afraid to enter these clinics. But from the moment we took the measures, we gained our staff, people who were willing to go and contribute to the cure of people, to the care of people who were in there. We tried to achieve measurable results so as to try our best to take the proper decisions. Thank you. Ms. Botza, is this a critical a factor of critical importance to measure the extent of the problem in every hospital? And are you happy with your own measurements or results? In order to resolve a problem, you need to identify it. Identification means measurable results. These are prerequisites. So with our monitoring programs, with the training programs and all the techniques that we have implemented we first recorded everything and we then proceeded to resolve the problem. The only way to solve a problem is to measure its extent. Yes, our hospitals are at a better level, but everything is a whole, is part of a whole. We cannot go down to 0 if society doesn't change its attitude. If we do not stop providing everyone with antibiotics, then we will not be able to get rid of resilient microbes. Children should not be given antibiotics for no reason. Children are not isolated from adults. This microbe, this infection can be transferred to a child by an adult. So pediatric hospitals do the best we can because of these fantastic weapons that we have. But society as a whole has to help us, so there is much to be done. Do the children keep the rules? Yes, better than anyone else. Even during the pandemic and afterwards, children were the best pupils. It is we who do not do what we do or we need to do all the time. I mean, we adults. And now let's move on to Mr. Velisariou, who is a quality assurance expert for HealthCert, and he's going to give us describe the situation of all hospitals.
Let us start this discussion about the situation in Europe. You insist on asking whether 0% is possible. Theoretically, this was achieved in the Nordic countries, in countries such as Sweden, Norway, Finland, and Denmark. And clearly, this has everything to do with an effort that was going on for years. It's exactly about what was said before. It's a culture shift. You have to trust your doctor. You shouldn't get antibiotics on your own, and the same should go for hospitals, best practices, and of course the right spaces, stick to the protocols, have micro programs for training and education. This is part of a reality or a change that needs a lot of patience and a lot of effort. I think that it can be rewarded if put in practice. And if you want to talk in financial terms, yes, it saves money. Yes, it's possible. That's the mental takeaway indeed. And then when it comes to the rating or the ranking, I'll insist on that one, says the moderator. So there's a rationale behind the work of our entity. There has to be discussions, communications between and amongst the relevant entities, practices abroad. There are practices abroad, such as conducts, and they produce protocols, they create practices, they put in place practices, and they also come up with instructions. They try to enforce them in a unified manner in order to follow up on what's happening. And we have developed, therefore, our own standard that was indeed coined during the COVID pandemic. It's 1969. HC 1969. It's about the germ load in areas where health services are provided. This involves the enforcement of protocols, consistency and frequency, ensemble taking and proper compliance, along with improvement based on the various practices that are enforced by this specific entity. Overall, it's possible to do it. You have to be systematic and methodical in your efforts. I keep insisting on the use of this word. We are systems-oriented people. That's why I'm insisting on the systematic aspect of things. This is the only way to do it. So you have to have funds and resources, and you have to have an understanding between and amongst all the parties. You've been meaning to say something, Mr. Souliotis, just to share some information with you. Before I took the floor, I was informed that EODI is in charge of a scientist who was in the avant-garde in terms of clinical trials with regard to antimicrobial COPA. And I am very happy as a result of this news, and I hope this person will be instrumental in this work from now on, because he's given his heart and soul. We came up with the facilities, but this is a person who's worked hard. Mr. Deputy Minister, I'm talking about Mr. Evstathiou. Off mic, apparently, comments, or the minister is not listening to me, says Mr. Souliotis. And dear Mariana, I keep looking at my cell phone because pretty soon, or rather in a few minutes, I will become a grandfather and I have to go to the maternity ward and make sure there are copper-covered surfaces. This is my first grandchild. Thank you so much. And therefore, this is the ideal way to bring this to a close. At least this panel's discussion, they keep sending me messages and people are asking why I'm looking at this. Thank you so much.
60 χρόνια. Ένα ταξίδι που ξεκίνησε από το όραμα του Δημήτρη Πενταφράγκα, ενός φαρμακοποιού από τον Εύρο. Και έγινε ιστορία ελληνικής φαρμακευτικής καινοτομίας και βιομηχανίας. Από τότε, ένα πράγμα μένει αμετάβλητο. Η δέσμευση να βελτιώνουμε τις ζωές των συνανθρώπων μας.
So, let's give the floor to my good colleague, Ritsa Bizoglis. Ritsa, here you are.
Βάσματα στα ποιοτικά γενώσιμα που κέρδισαν την εμπιστοσύνη των Ελλήνων. Με την ίδρυση του πρώτου ερευνητικού και πειραματικού κέντρου της χώρας. Τις εξαγωγές που μετέφεραν τη γνώση και τα φάρμακά μας σε όλον τον κόσμο. Την καινοτομία του Inhaler που αναγνωρίστηκε διεθνώς και την παρουσία μας σε περισσότερες από 90 χώρες. Μέχρι σήμερα έχουμε διαθέσει πάνω από 300 εκατομμύρια συσκευασίες, βελτιώνοντας την καθημερινότητα εκατομμυρίων ασθενών. Και παραμένουμε η νούμερο 1 φαρμακευτική εταιρεία σε πωλήσεις στην Ελλάδα, στην αγορά λιανικής και στα ασφαλιστικά ταμεία. Συνεχίζουμε με νέες επενδύσεις που διαμορφώνουν το μέλλον. Πίσω από κάθε επίτευγμα βρίσκονται οι άνθρωποι της ΕΛΠΕΝ. 3 γενιές επιστημόνων, ερευνητών και συνεργατών που μοιράζονται τις ίδιες αξίες. Με ακεραιότητα, ομαδικότητα και αφοσίωση κάνουν πράξη το όραμα της εταιρείας κάθε μέρα. Στην ΕΛΠΕΝ, η διαφορετικότητα, η επιστημονική αριστεία και η ίση συμμετοχή είναι δύναμη. Περισσότεροι από 1.700 εργαζόμενοι σε Ελλάδα, Γερμανία και Μέση Ανατολή ενώνουν τις γνώσεις και τις δεξιότητές τους για έναν κοινό σκοπό, την εξέλιξη της υγείας και της φαρμακευτικής επιστήμης. Σήμερα κοιτάμε μπροστά, με νέες μονάδες παραγωγής, με επενδύσεις σε έρευνα και καινοτομία, με διεθνείς συνεργασίες που φέρνουν την ΕΛΠΕΝ πιο κοντά σε περισσότερους ανθρώπους. Χτίζουμε το αύριο της ελληνικής φαρμακευτικής επιστήμης με την ίδια αφοσίωση που μας καθοδηγεί εδώ και 6 δεκαετίες.
So, good afternoon. Who are we? Mr. Dimitris Bartzopoulos, Deputy Minister of Health. Thank you for being with us. Ms. Rania Trasia, who is an MEP from Thessaloniki, MP from Thessaloniki. Mr. Bartzopoulos, because we need to promote, to tell them, to say who is elected where. And we also have with us Mr. George Alevizopoulos, who is a professor and director of the psychiatric hospital of Kifisia, University Hospital. So the topic is the AI revolution in mental health and in prevention. You know that AI has come into our lives rapidly and is present in many medical specialties. We are all more or less aware of that in cardiology or in surgery. People say that using AI, one can identify a malignant tumor that human eyes cannot. But mental health is a very different sector. You're laughing, Mr. Bartzopoulos. I hope I'm correct. So this is an extremely sensitive sector where high emotional intelligence is required. So how do we deal with AI in this field? How can AI help somebody who suffers from depression? This is the scourge of this century. We know that 350 million people around the world suffer from depression. So the mental cases around the world are 30%, and according to the WHO, this costs the NHS $1 billion. And there are other issues. What do we do with the AI chatbots, the ones which, according to all studies, people consider their mental therapists, mental health therapists. So you have the floor now, Mr. Bartzopoulos. Thank you very much for the invitation and for presenting a picture. Before I start, let me clarify my own point of view. I think that we are interpreting the AI in a very elastic manner. These are not algorithms which analyze big data. No. AI is to go to a smart coffee maker who that is able to understand the day, the time, and and they will make the coffee of your preference. No, AI is the new device that will produce a new drink. So diagnosis, preventions, etc., which rely on many data, cannot be considered AI. It is an abusive use of the term. This is very important also. This is also what is also important for me as regards the chat box. It's as if you bring somebody, an unknown person in your home, give him the keys, you allow him to use everything in your house, and then you leave. This is the relationship. Nobody knows who or what is behind the chat box, and especially among adolescents, and not only adolescents, everywhere and everyone. Chatbots familiarize themselves with us, because if I give my phone number to a provider, I'm not going to talk to a person, but to a chatbot, and this familiarizes me with the process. So I feel that I know how. So, of course, they are constructed so that they can be very positive. You can, if you try to discuss a mental issue with a chatbot, they will tell you that they will encourage you, they'll tell you do well at this, that. But there are questions to which you receive no answer. So it is very important that we should define AI and prevention on the basis of AI. Can we say that this is a suspect situation? Yes. Let me say a few things from our own work so that we can distinguish what is AI and what isn't. About a month ago, I received a patent for the Alzheimer dementia recognition using AI algorithms that can identify the gaps, about 10 years earlier. This is not AI. This is an algorithm. These are complicated equations, but still they are equations. There are studies that show that the same algorithm that is generated by different developers will probably give you different results. So this is a problem that seems to be uncontrolled. Now, as regards AI, we do something with psychosis. Again, with AI and algorithms. In the environment of a psychotic process, the environment is developing depending on the illusions and the delirium, this is not related to prevention, no. The second case, the first one relates to prevention, but the second one relates to a patient and can follow the different ideas, the delirium, etc. So this creates the virtual reality of the delirium, which is then conditioned. That is very interesting. It is very interesting. It's doing well, but we still have years to go. Do we have any statistical results? Excellent results. For instance, our brain functions in a very algorithmical manner. This what aligns us with AI. And the changes that happen in our brain are identical only at a 17%. So for the rest, we do other things, different things. So there is a very important colleague from the Polytechnic of Crete, Nikos Christopoulos, who is a professor of machine learning from the University of San Francisco. He was able to generate an AI algorithm that can foresee the behavior of a football player 14 seconds before he makes the move. And this is fantastic. This is fantastic. And it is the time is incredible. 14 seconds before the penalty, they can foresee that. This is AI. They generate new ideas, new things. Just like the human brain seeks and creates from scratch, the same is true with AI. So we'll come back to you. Now let's go to the Deputy Minister of Health. Let me add something to what the professor said that's very, very interesting. This is very well known since some while that the brain has decided what we are about to do a few seconds before we realize it, which means that the system is automatic, which means that the notion of conscience is rather relative in neurophysiology. Anyway, we need to start discussing what is conscience and what we do consciously. We get lost by using ideas, terms which are scientific meaning, and they are being used by the general public. Now, let's go back to our topic. If we make the distinction that the professor said between the LLMs, which use big data, which process big data, and the use of specialized and complex algorithms, and we make a distinction between this and AI and the generation of new ideas. This is not AI. So normally we are now, when we say AI, we are referring to the LLMs, the use of big data for decision-making and information. Now, we need to make a very basic distinction, very important distinction. Why do we use AI? We use it for two reasons. One, for the person that is going to make a decision to be informed about the sector on which they have to make a decision. Doctor or whoever needs to make a decision. For instance, in the healthcare. Number two, to inform using AI the beneficiary of this service, the patient. No, they may not be a patient. They may be somebody else. In our view, in our lingo, a patient is something very specific. Somebody receives service and they may not be a patient. And things become tricky. We need to be very careful. Let me give you a very characteristic example from our own work in the ministry. Number one, it was voted since last year, and we are now finalizing and funding a program of worth 12, 13 million an integrated treatment program for the monitoring of the population regarding mental health. This is a big data collector. It's a database, yes, very simple, at the same time extremely useful for us. And for the service provider, who is a doctor sitting in front of his computer and is about to meet the patient. What will this do? It connects the social security number with the ICD-10 diagnosis, for the first ICD-10 diagnosis, which belongs to the mental disorders. So this connects to a disorder of this type, and they start registering the medications, whether the patient visits hospitals or not, how many days they have been hospitalized, if they receive an invalidity pension, what is the degree of invalidity, whether they work or not. They connect with the databases to show whether you are an active professional or you participate in such and such a program. Whatever there is available in relation to this social security number is brought in. And how does this help the doctor? Very importantly, they prevent hospitalization or morbidity. The person who visits the Alexandroupolis hospital, they will know that they start visiting increasingly often. They change their medication quite often. They start not avoiding work. They receive continuous unemployment benefits. What does that mean? That the person needs to be prepared for a special leave, or to start that they are on the way to mental care, to mental health care institutions. So, looking at subsequent hospitalizations, successful or not successful, the doctor will know what to do.
Off mic, we regret not being able to interpret.
Unfortunately, there's no microphone.
This is a long discussion. Well, listen. The answer is clear. It's just the public entities or hospices. It's not possible to involve private entities. What also can be done at a certain point in time would be to involve private psychiatric hospitals to see what the duration is, the duration of the stay. This will be something which we will be reticent to do, and only after we deal with something that we will be presenting at the Parliament within the next 6 months. Long-term care is what we will be focusing. Long-term care, especially for a certain group of patients. That's another discussion. And this is also foreseen and covered by this system. How long they've been patient characterized as such, and whether there are places for long-term care. This would be useful. LLMs would help us make decisions in these cases. And maybe if you have a software which helps, and if there is an early alert if it sounds the alarm early on, that would be useful. But this is working. This is about to be up and running. So we're working on that one. It won't happen really fast. And unfortunately, the gentleman's sound is breaking up. There's something very fast, or more fast. Something which we are doing and we will be trying on a pilot basis. The main premise behind it is the following. We're working with the Quality Assurance Organization. We want to have a system that could eventually get an app in place. Suppose you want someone who needs mental health care services. The premise is simple. Suppose that I think I should see a specialist mental health care. You mean between a hospital and someone else? What we're doing, remember, this is the state/donation, so it's free of charge. So it's a state free of charge. The approach is simple in this case. So you have an app. Where are you? It shows where you are. The GPS indicates the available facilities in this location or in the region. You can contact A or B or C. A full update. But we are thinking of advancing this a bit and creating a digital sphere, a space where there will be better information. Say we can have a sort of ChatGPT info and insights about what you might be suffering from. So you are rendering the symptoms. Yes, you tell the app, this is what I'm suffering from or how I'm feeling, and then it will advise you and tell you where to go. We would also like to allow scope for interaction. Interaction and context between peers, groups of peers, people who are suffering from the same symptoms. Are there risks? Yes, the risks are huge. Please pay heed to that. We will be taking things one step at a time, always in contact with the Central Health Council and the Mental Health Committee. Each step along the way will be dynamic. Each step will be carefully designed and planned. One last thing. We are doing that, and we'll be cautious and careful because both the psychiatrists and the psychologists will get what I'm driving at. The user's update must be in a way that will be easy to get. Suppose you have depression. There's a difference if you're depressed because your partner left you or because I'm not going to become a minister in the next government reshuffle. And this is my emotional response or reaction to the fact that I'm not going to be minister after the reshuffle. It's one thing to suffer from these, and it's another thing to have an intrinsic depression, which calls for an expert to see you first. In that case, really now, it's very, very difficult. The whole situation is difficult, and guidance may be dangerous. Getting instructions from bots. The use of such tools can be really dangerous. Over the past few days, I've browsed the web. There are many such options, too many, and not all of them are accredited or certified. Who's certifying these apps? Who's saying that these are right? And please picture this. You have a child who's experiencing the first signs of schizophrenia. So before you have these symptoms, this child is suffering from these symptoms and is trying to understand what's going on. If this person uses ChatGPT or any other tool and doesn't go to somewhere else, that will be a disaster for the person. But if the person who's suffering from the first symptom gets to see an expert at the start, a psychiatrist can tell, a psychologist who will be able to, they're trained, and they all see that that this is not exactly normal when it comes to emotions and the handling thereof. We psychiatrists are faced with many patients that come as referrals from psychologists. Psychologists can tell something is wrong. Can the machines understand that? No, they can't. Machines can, to a certain extent, replace our role only in terms of diagnosis, but they can't replace psychotherapy. Therapy cannot be done by machines because machines are not born and machines do not die. And so if they're not born and they're not dead, they're not in position to treat. You load the machine with data that you enter. Mrs. Raskia, over to you. To begin with, I'm very happy because this is a conference on health, which is everything, which is indeed all about health and above everything. Mental health is not always granted. We tend to talk about it, but it's not really understood that physical health is equally important as mental health is, and it's very important. It's a very important coefficient, a parameter for the future of our society. We're talking about such things. You put things right for years now. Now, the news reports are filled with violence, and everything is intertwined with mental health. Yes, we have a knot in our stomach, but we don't pay attention to the fact that we're talking about mental health. So we're talking about health. It's important to understand that mental health is equally important. There's no physical health without mental health, and quite often it's the other way around as well. And prevention is just another long discussion, and it goes without saying that the health sector and the mental health sector, other than managing diseases or symptoms, we have to make sure we come up with policies and undertake initiatives, everything that's needed to go to the deeper sense of prevention. All three of you agree that quite often mental health impacts on the physical health, on the body. Yes, they are interwoven. The brain is just one brain. Some may be more specialized, but then again, it's one single brain, and the brain governs everything. Quite often, we tend to think that our emotions are expressed through our body. That is why we have psychosomatic or embodiment of the pain of non-expressed, non-verbalized emotions. All of that is dealing blows to not just our body, but specific emotional problems might impact negatively on specific organs. It's that much intertwined. Dear Mariana said something very, very important. Unfortunately, the problem in properly using AI to protect mental health or manage problems is pertinent to the lack of data, especially shortage of data in Greece. You know why? Because this is the heart of the problem. When a mental health services recipient, to a great extent in Greece, is getting that from private entities, then what the minister said is exceptional, tools like that. But then again, tools cannot be applicable, and you can't get measurable results because we're talking about a limited amount of people. And this is a huge political wager for everyone. Let's make sure that mental health becomes a subject. Maybe it could be incorporated, or at least let's highlight the importance of mental health and make it as important as physical health. We have to make sure that we provide for it as a state. Do you know one person now who would say, I'm not feeling well, and someone would tell them, or rather everyone would probably think that they have to go to the private practitioner? Maybe they won't even tell they have a problem, even so. But even if they start looking in the private sector, then there are issues. There's a huge gap, there's lack of and shortage of data. Coming to the practical aspect of things, psychologists, including myself, what is it we often encounter? More and more people come to us, especially teenagers. You're very right, Ritsa. Teenagers come and they are ready to tell us what they have. They think they know what they have. They've looked it up, they've browsed things, they've Googled things, and the most important, the most normal thing is for them to talk with their peers. This is very, very normal. But then again, they come to the experts. They try to find experts in so less tools or apps. And that's where the problem begins. And the professor knows, and the other professor know very well, better than I do. But in clinical practice, what is it we often get to see? They come to the practices of psychologists. It's another long discussion. We know how tough the fight is, Mr. Deputy Minister. What about who's entitled to exercise the profession? Hopefully you will come up with legislative measures and proposals to protect the profession and the public, for them to know that they go to professionals. Teenagers, maybe they're destitute, maybe they're afraid of being stigmatized, it's still there, maybe because of stereotypes. Quite often people tend to think that if you're faced with mental issues, then you are crazy. We still use, in the year 2025, we're using terms such as a lunatic or crazy or a lunatic. But anyway, we're still doing that, to a lesser extent we are, and then again, they use the bots or take advantage of them. So youngsters come to us, they diagnose themselves, that could be bad, not only wrong, maybe they are underdiagnosed. Or maybe this is not even the case, because the same symptoms apply to different conditions. If I'm coughing, maybe it's the cold, it's the flu, it's because I am a smoker, or maybe I have lung cancer. You can't decide on the problem without an examination. For physical health issues, we'd never turn to bots or AI, but when it comes to mental health issues, we turn to bots, meaning AI, and if the symptoms persist, then we'll look for help. And suppose you go to a public practice, or maybe you go to a private practitioner. Research has shown that people, generally speaking, don't trust a real diagnosis, a true diagnosis, because they have used AI and they're convinced that AI is right. And then therapy, even advisory and consultation with psychologists, depending on their knowledge and specialty. I'm a clinical psychologist. There are people who are very reticent. They've spent hours talking to ChatGPT and every other such app, so they are convinced that they know what the problem is. And when they meet a real person who tells them that it's different, when they start therapy or talk with a therapist, they have in advance rejected them. They start doubting things. There is this agony and anxiety over the transition, being diagnosed. So ChatGPT convinces them that you're doing okay. Let me share an example. It's a typical example. There have been measurements. OCD is on the rise, or other narcissistic disorders. The numbers thereof are on the rise because all these bots and AI-related apps won't go against you. They tend to confirm what you tell them. I have a problem with my spouse is treating me this or that way, or my colleague at work is very abusive, he's a bad character. ChatGPT tends to, given the data, tends to confirm your own theory. You enter the data, the ChatGPT agrees, and then the story continues from there. Exactly. So that's... And there is an increased percentage rate. There are many narcissists. And such cases have been on the rise. Quite often they are the reason why there's violence, not just stereotypes. Quite often behind people who resort to violence as a solution to resolve certain problems or try to reach out to others, quite often there is narcissism. Of course, this is exacerbated due to patriarchy and stereotypes, especially when we talk about family violence or domestic abuse. Now they tend to believe that since this is not constantly, it's there, it's never tired, it's never bored, it's reminding us how amazing we are. We as mental health experts don't want to tell people that they're not amazing. It's quite the other way around. We're trying to unearth what's hidden, what's good, what will make this person believe in themselves in order to take pathways that ensure health from a mental point of view and a bodily point of view to ensure there's growth. Unfortunately, that is going in the wrong direction. The ChatGPT will flatter you. In most cases, people tend to think that therapists are there behind the digital assistants. These are digital therapists. That's why in many countries we see such cases. Hopefully, here in Greece, we will ban the use, especially of such apps on TikTok.
It is forbidden, especially using TikTok, for someone to say that they are mental health specialist and provide any advice, even slogans. No, this is forbidden because the result is the opposite. Every person will read, will understand this differently, and that's why mental health is a very specialized sector. The same image will depend on the background of the person, on the filters that they have, the trauma they've suffered, and they will perceive everything different. Half full, half empty glass, etc. And one of a classic test, people tell you, you are on a bus and somebody is staring at you. I am a girl, let's say. No problem. No. 8 out of 10 think, I shouldn't have worn this skirt today. Oh, I'm too fat. I've put on lots. And this is not looking good on me. And why didn't I take care of my people? Men and women will think that this is a feeling of, yes, they feel that badly about themselves. Only 2 out of 10 persons will say, oh, I must look very good today. And what we would like to achieve is for the person to think, this one is looking to start talking to me. Yes, that is the level we should reach. So let us go back to the professor. So that we can come to a final conclusion. Have we moved on, and to what extent are we going to use the AI or not? I was considering Mr. Piotis' question. 80-90% address the private go to the private sector. We have data from IDICA about the medication and the tests that people do are prescribed. So if we see that somebody is 15 or 17 years old and they use too many painkillers, then the possibility that they will be schizophrenic by 19 years old is very, very high. This is a very healthy and very useful function of AI. It's not that we do not have the data, it's we don't use the data that we have. In the state system anywhere, we need to have a window, just like a thief will get into your house if you leave a small window open. No microphone. What you're saying, although we can't hear it, it is true. Yeah, painkillers is just one factor, but this can show us something about the population. So every fact that we get to know will provide us with the information we need in order to achieve our objective. That is how we started. In order to reply to your question, in June, the algorithm for first-line professionals will be ready. This will be an algorithm to prevent violent behavior among adolescents. We will see, we will get the data from the way they move, they walk, they behave, or they make grimaces, make faces. This is my group, university group, alongside Indians, Americans from Nevada, where the sheriff The governor was a sheriff and is familiar with that. And by June, we will have the final result, the prevention of abusive or violent behavior. Because, for instance, a policeman who is dealing with a dangerous situation, they will be very well informed about who is a dangerous person and how they can, what means to use to deal with that. And this is excellent, and this project is doing very, very well. So in some sectors we're doing well. In some others, not so much. Let me tell you, the test PAP, how credible is it? Very credible. No, 8.5% only. PAP test, 8.5% credibility, because test PAP is effective 85% in positive cases, and 15% it gives 15% false positives. But only few women suffer from cancer, of cervical cancer. This 15% is much higher than what we find. Medicine in general is a probabilities science, and the huge leap that AI has made is that has increased the possibility of a correct answer. Certainty is not there. Certainty is a static situation, and we are dynamic beings. Minister, you before Mrs. Frasesca. Just to say something positive and something useful to what makes these panels and these discussions useful. There is a real need to certify or control, validate these apps that are available in the Greek language, especially at least in the Greek language, because the internet is elsewhere. Whatever is in a foreign language is not accessible. I had attended a discussion in Brussels about 2 years ago, organized by Mr. Kibouropoulos, then MEP, who is also a psychiatrist. And there was an effort at the European level to assess these tools. And this effort has not given results, but at least in Greece we would be able to look at this, especially because of the digital tools that will allow for parental control and many other things. So inside this initiative, we will be able to include this. In conclusion, what the professor says confirms once again the fact that yes to AI in any of its forms in order to provide information to the service provider. And very careful when we are using AI if you seek the service, because as regards mental health, I will use the term, specialist term, both diagnosis, but mostly treatment has gestalt elements, that is holistic elements. This cannot be provided by AI. And what you also discussed with about the 16-year-olds, etc. And Mr. Raskia, I agree with the Deputy Minister. Yes, there are AI tools for mental health specialists, but before using them, one needs to be to learn about them, to be trained, and this helps psychologists who can identify the symptoms and refer better to a psychiatrist if there is the issue of mental health disease. psychotherapy and medication proceed alongside one another. We may have only therapy, but never only medication. And then, as we decode the human brain by the scientists achieve this, then new tools may emerge. And I will agree that something what is tool for the specialists, it cannot be used by the beneficiaries of mental health, because psychologists can only provide empathy, and this is not provided by any AI tool.
To you, all of you, the heroes that have stayed on since 9 in the morning up until now, our warmest thanks. Our thanks also go to our friends over the internet. This was yet another conference which we believe contributed significantly so to the public debate about health. The presence of the Prime Minister certainly branded and sealed this conference. Let me simply say something. Against the backdrop of my health, mostly for the sake of our internet friends, those who keep insisting that the NHS has collapsed. There was never any point in time when we ever had a good NHS or a perfect NHS that then fell through. We've always had an NHS that had deficits and shortages. When I was a youngster and a teenager and a young lady, there were always shortages. Other than the period of a huge financial crisis, the NHS kept improving, regardless of government in power. There was no single NHS that was handed over from one government to the next and the next demolished it. That was never true. The only thing we are claiming and asserting is an improvement compared to today's. There's no best that was ever around. We want this one to get better. Thank you very much.
Πάμε δυνατά! Πιο ψηλά! Δεν κλέβουμε!
Μπορώ να διαλέξω κάτι πιο χαλαρό. Δεν είμαστε σε reality επιβίωσης. Και για το χώρο θα ήθελα κάτι πιο ατμοσφαιρικό. Να αλλάξουμε και την ώρα. Τόσο πρωί το καφές μου δεν έχει κάνει stretching.
Θέλεις παντού τη δύναμη της επιλογής όταν έχεις το My Health First της Eurolife FFH. Μια πιο οικονομική λύση ασφάλισης. Γιατί με το My Health First διαλέγεις εσύ όποιον γιατρό και νοσοκομείο θες, με απευθείας κάλυψη εξόδων ή με ποσό οικονομικής παροχής που γνωρίζεις από την αρχή. My Health First. Δύναμη επιλογής.
40 χρόνια τώρα, στον Όμιλο Βιοιατρική, βαδίζουμε δίπλα σε κάθε οικογένεια με ένα και μοναδικό σκοπό. Την προάσπιση της υγείας όλων. Γι' αυτό, εδώ και 40 χρόνια, επενδύουμε συνεχώς. Σε κορυφαίους συνεργάτες. Σε εξοπλισμό τεχνολογίας εχμής. Σε προηγμένα συστήματα διασφάλισης ποιότητας. Σε πλέον σύγχρονες και ασφαλείς εγκαταστάσεις. Σε πιστοποιήσεις από ηγετικούς οργανισμούς του κλάδου μας. σε σημαντικές διεθνείς διακρίσεις και συνεργασίες, στη στήριξη της χώρας και την κοινωνική προσφορά. Επενδύουμε πάνω απ' όλα στον άνθρωπο, για να αισθάνεστε όλοι εσείς και οι αγαπημένοι σας σιγουριά και ασφάλεια κάθε φορά που εμπιστεύεστε την υγεία σας στον όμιλο Βιοιατρική. 40 χρόνια Βιοιατρική. Είμαστε εδώ για την υγεία όλων.
Στην Εθνική Ασφαλιστική, τα όνειρά σας, οι άνθρωποι σας, η υγεία σας, η ζωή σας είναι για εμάς πάντα σε πρώτο πλάνο. Γι' αυτό κάνουμε πράξη την ασφάλεια. Εθνική Ασφαλιστική. Εδώ για την επόμενη ημέρα.
Damien is the name of the 8 billionth human being. He was born in the Dominican Republic and was fortunate to come into the world with the help of excellent medical care. Healthcare that starts from birth and extends throughout our lives might seem to be a given for us, but for billions of people around the world, that's simply not the case. And the more people there are, the more important it becomes to act responsibly and sustainably. We believe that good healthcare should be standard rather than something special. That's why we work together with our customers to develop innovations that push the boundaries of what's possible. It's what gets our more than 70,000 colleagues out of bed each morning, and sometimes keeps them up at night. We need this kind of passion and diversity, and that's why we invest in the potential of each individual. That makes us more than pioneers in health. It makes us healthineers. Digital twins allow patients to receive individualized diagnoses, treatment, and follow-up care. Thanks to intelligent, image-guided diagnostics, treatments are more precise than ever. With the help of digitalization, data, and artificial intelligence, we optimize procedures and treatments in an outstanding way. New imaging systems allow for earlier detection of diseases and more targeted treatment. With innovative methods, labs can recognize disease profiles more reliably and adapt to other challenges along the way. By continuing to integrate and digitalize imaging and treatment in oncology, we are getting ever closer to a future in which cancer is no longer something to fear. But even the most advanced technology is worthless if not enough people have access to it. That's why we cooperate with international partners to tailor our innovations to the needs of our customers, healthcare providers, and local infrastructures. We pioneer breakthroughs in healthcare for everyone, everywhere, sustainably. That's how modern healthcare will become an accessible, affordable reality for billions of people. Just the most normal thing in the world.
έχει τόση ουσία, τόση γνώση και εμπειρία, τόση ευθύνη, τόση δυναμική, τόση ευαισθησία, τόση φροντίδα, τόσο νιάξιμο. Γίνεται κάτι τόσο μικρό να καταφέρνει να κάνει τόσο καλό. Στη Unifarma γίνεται. 60 χρόνια αξία για τον άνθρωπο, ευθύνη για την κοινωνία.
60 χρόνια. Ένα ταξίδι που ξεκίνησε από το όραμα του Δημήτρη Πενταφράγκα, ενός φαρμακοποιού από τον Εύρο. Και έγινε ιστορία ελληνικής φαρμακευτικής καινοτομίας και βιομηχανίας. Από τότε, ένα πράγμα μένει αμετάβλητο. Η δέσμευση να βελτιώνουμε τις ζωές των συνανθρώπων μας. Κάθε δεκαετία, ένα βήμα πιο μπροστά. Από την πρώτη εγκατάσταση στο πικέρμι και τα πρώτα σκευάσματα, στα ποιοτικά γενώσιμα που κέρδισαν την εμπιστοσύνη των Ελλήνων. Με την ίδρυση του πρώτου ερευνητικού και πειραματικού κέντρου της χώρας.